Hi everyone. So first of all, I am so happy and so glad to be here with you today. And my request to all of you will be that let us look at the radiology question in the first part, and then on this link we will keep doing all subjects. Be there, don't go off from this video because we'll be recalling the entire paper. After this, Obs Gyne will be coming. And my purpose is, okay, my purpose is to tell you that this time we have had a massive strike rate in the INICET paper, and I am sure if you recall, if some of you would recall that in the 2 days back in the predictor series I had told you that brain infection will be asked. If you remember, I told you that the brain infection will be asked, and I told you that they will show you ring enhancing lesion in the first part of my DVT. So we had the same questions. We had the same questions in the exam, and I'm very happy that you could get the same questions directly in the exam. So let us start. Are you able to hear me? Give me a thumbs up. Are you able to hear me clearly? Okay. 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 So once you are able to hear me, let's look at the first question. One of the questions that we start our radiology class with is, which imaging modality should be avoided in pregnancy? So if you remember the first part of my radiology class, if you remember the first part of my radiology class, when we start, I tell you CT scan has radiation exposure. Can you tell me how many of you got this right? I am sure almost everybody should have got it right. And it is, directly a question multiple times asked anyhow. Second question that we saw in the exam was Honda sign. So Honda sign is seen on bone scan, and a parallel of it can be seen on a MRI. If I do a stir image, so you will see a H-shaped area of increased signal or increased uptake of the isotope in sacral fracture or sacral insufficiency fracture. The other choices that I could get from the recall are multiple myeloma, acute osteomyelitis. Can anybody tell me what were the other choices? What were the other choices? So paper was doable directly. Many questions were from DVT, many questions were from the PYQ ka Baap session, and students who had done the actual class had a lot of benefit, And last option was edema, like bone marrow edema or something like that, somebody is saying. So probably this was the question, but the best, transient edema. So H sign is a sign of sacral insufficiency fracture or Honda sign. So the answer is sacral fracture, there is no doubt. And so now I am making the full questions for you. Sacral insufficiency fracture, multiple myeloma, osteomyelitis, transient edema. Transient bone marrow edema was the choice. So instead of bone scan, they had written stir MRI. And if you remember from my class, I have told you in the skeletal system we use stir to see bone marrow edema. This H-shaped bone marrow edema is a sign of, the Honda sign is a sign of sacral fractures. That is the correct answer. Okay. Okay. And one of the questions that I predicted, in the last YouTube live also, that एक मैंने बोला था ring enhancing जरूर आएगा, if you remember, and give me a thumbs up if you remember from the video. Okay. एक बार याद करके देखना, मैंने बोला था डायरेक्टली एक ब्रेन इन्फेक्शन जरूर आएगी, एक स्टोन जरूर आएगा, एंड आई टोल्ड यू अगर गॉल स्टोन आएगा तो अल्ट्रासाउंड होगा, बट इफ दे से यूरिनरी स्टोन देन द आंसर विल बी, if they say urinary stone then the answer will be NCCT KUB. कुछ बच्चे कह रहे थे कि IUC नहीं था सर, बेस्ट लिखा था, it hardly matters, the answer is NCCT KUB. Okay, NCCT KUB. So if you remember, okay, if you remember that this is what we discussed in the PYQ का बाप also, direct prediction किया था मैंने कि आएगा. I discussed this in my YouTube live also 2 days back. You can go back and see directly there from the exam. So if you missed out on the predictor, don't do the mistake in the NEET PG. NEET PG again we'll do the predictor, miss नहीं करना किसी ने भी, okay? And one question was indirectly radiology, where we had sunburst appearance mentioned in the question, and we had a question saying, if you remember, Codman triangle, sunburst appearance. Directly in every of my class I have discussed this. This is the answer of osteosarcoma. The answer was osteosarcoma. Can anybody tell me what was the other choice? What was the other choice? What was the other choice for osteosarcoma? Other than osteosarcoma, what else was written in the question? And what else were they were saying Codman triangle, they were saying sunburst appearance directly from the class notes, yes, but one of the options was Ewing's. Okay, any other option? Any other option? Okay, so we need to know the options so that we can give you correct answers also. The age of the patient was 17-year-old. Okay beta, any other thing you can tell me from the recall? It was a 17-year-old. And Ewing's osteosarcoma, chondroblastoma was also in the chondrosarcoma and GCT. Chondroblastoma and giant cell tumor. So I hope you know GCT would have that soap bubble appearance. GCT would have the soap bubble appearance. Okay, and Ewing sarcoma will have that onion peeling appearance. Chondroblastoma will be a epiphyseal lesion in the child. And all of them have been discussed at length in the class. This is a direct from the class question. If you have missed out on it, remember I told you this in the last predictor on YouTube. एक bone tumor आ सकता है, याद है कि नहीं? मैंने बोला था कि नहीं? एक bone tumor आएगा, फिर osteosarcoma भी दिखाया मैंने YouTube के अंदर. अगर आपने नहीं देखा तो प्लीज दोबारा देखें. इससे बेहतर प्रेडिक्शन 15-20 मिनट की वीडियो पे कोई नहीं कर सकता जो मैंने की है. मैंने बोला था थायराइड पैराथायराइड आएगा, याद है कि नहीं? मैंने बोला था थायराइड पैराथायराइड आएगा. सो दे आस्क्ड अ क्वेश्चन, बेस्ट इन्वेस्टिगेशन फॉर पैराथायराइड लोकलाइजेशन. द आंसर वाज सेस्टामेबी स्कैन. रिमेंबर, सेस्टामेबी स्कैन. ओके, so in the osteosarcoma question, 17-year-old boy had pain and swelling in the leg, sunburst appearance, and you had the Codman triangle mentioned. The answer was osteogenic sarcoma. Okay, and parathyroid directly, I told the same thing in my PYQ ka Baap. I told you this in the last repeat, last final session that we did before the exam. Correct answer. Okay, one question that many people had said that there was a patient who had diarrhea for 8 months. So you need to help me. You need to help me. Diarrhea for 8 months, ahostral right colon. Right sided colon was ahostral. Okay, okay, so one option was here PET scan. I am writing it down. Okay beta, okay beta, very good, thank you. Okay, ulcerative colitis, right ahostral colon was there, and if you remember I discussed this in my DVT, I discussed in my every class that if you see ahostral colon, that means the colon is fibrosed and we are dealing with a patient with some pancolitis. Yes, any other word? And then this is similar to that. People were telling that there is a CT abdomen image given in the paper where the right sided colon was shown as ahostral, which is same as the lead pipe colon. If you now open your DAMS handwritten notes, you will find written there directly ulcerative colitis. Ulcerative colitis. So coronal section of the CT abdomen was given. Approximately this was similar to the image that the people were recalling. So you could see the entire colon was ahostral, but many times the number of hostri in the left side are less, so on the right side are higher. So this was the exact same image in the exam, and we discussed this at length in our classes in DVT. Remember in DVT, if somebody remembers in DVT, I told you that if the colon becomes ahostral, you need to think of ulcerative colitis. You need to think of ulcerative colitis. Are you happy with the recall now? Okay beta. One of my favorite questions for any of you who has attended my class, I am sure you will be happy to answer. Eye of the tiger sign on MRI seen in. If you remember from my MRI class, eye of the tiger sign seen in, anyone can remember? It is seen in, tell me, Helleverdens-Pass disease, which is also called as pantothenate kinase associated neurodegeneration. Pantothenate kinase associated neurodegeneration. Okay, one of the choice was Krabbe's. Okay, any other choice you can tell me? Okay, so Krabbe's was in the option, so I am putting it there. Krabbe's also I have covered in the class. Huntington's disease will lead to boxcar ventricles, not eye of the tiger, boxcar ventricle due to atrophy of caudate nucleus. And Wilson's, I have told you in the class, will lead to face of giant panda appearance. So the answer was pantothenate kinase associated neurodegeneration. Direct from the class, beta. Direct from the class. So the choices were Huntington's chorea, Wilson's disease, Krabbe's disease, pantothenate kinase, associated neurodegeneration. So I am happy that this is an example of the discussion that we do in a regular class. Many times I see children, when you only do a revision course, maybe you might miss something, but this is every year we cover this in the regular class in the MRI brain section. Remember I told you, याद है कि नहीं, टाइगर और पांडा की कहानी. If you remember, eye of the tiger, face of panda, एक आना ही आना है, एक आना ही आना है इसके अंदर. Okay, okay. Some people are saying कि lead pipe colon के अंदर TB भी choice में था, Crohn's भी choice में था, ulcerative colitis भी था. So Crohn's usually would be small bowel involvement and TB would be ileocecal involvement. So looking at the options now, still I feel the answer would have been ulcerative colitis, but we will look at the recalls properly also there. Okay, one question that, you know, if we remember, I told you in my classes that there are two type of metastasis, osteoblastic, osteolytic, and I told you more commonly you see osteolytic metastasis. Thyroid and kidney lead to osteolytic expansile metastasis, and particularly in thyroid it is the follicular cancer which causes osteolytic expansile metastasis. So skull showing a lytic lesion, please think of a follicular thyroid cancer. Papillary cancer usually goes to the lymph nodes. Do you remember from your surgery and pathology classes? Papillary cancer usually goes to the lymph node, follicular cancer goes to the bone, medullary thyroid cancer will have osteoblastic metastasis. I hope you remember, and these were more or less confusing the question. Okay. Okay, are you able to do it? Okay. Second was, this is where I start my DVT. In my DVT, the first thing I told you was a ring enhancing lesion, and I told you how to approach. If in a ring enhancing lesion, if you are able to appreciate a dot, that dot is the scolex. If you remember, I told you, अगर ring lesion बोल के देखो, यहाँ पे था child with recurrent seizure, HIV लिखा है नहीं, so toxoplasma नहीं होगा आंसर. If they say HIV, then the answer would be toxoplasma. HIV तो लिखा नहीं है, ठीक है ना. दूसरा याद है कि नहीं, if they are showing conglomerate lesions which have lipid peak, then we think of tuberculomas. Okay, but this is a CECT. Okay, and I hope you are able to see a ring lesion with a dot, that is scolex. The answer is neurocystic sarcosis. And I hope that when we see a ring lesion with a dot like a scolex, the answer is NCC. Discussed directly. This is my first discussion that I do in the DVT. I am very happy that you could get it. And people who missed the DVT, don't panic. This is the first discussion that I did in my predictor session also. Remember, 2 days back in YouTube, directly I told you. So if you see from my 25 minutes predictor session, 4 or 5 questions have come in the INICET paper. I'm very happy that we could answer all these questions for you. And one question was, you could see the rectum and you could see the contrast material being defecated. And you could see the pelvic bones in the lateral view. Many children told me that the lateral view was visible and you could see the bone, you could see the sacrum and the coccyx. This is the X-ray and you can see the contrast. So is this esophagus? No, this is not esophagus, this is rectum. So cannot be barium swallow. That means we are looking at X-ray defecography. This is not MRI, because in MRI your bones, the cortex of your bone will be dark. If you remember, I told you in every class, X-ray, CT, MRI में फर्क करना आना चाहिए. Directly exam में question आएगा. And most people said that it was the lateral view visible, something similar to what I have shown you here. This was a X-ray defecogram. अभी बहुत सारे लोग और भी YouTube पे आके बताएंगे कि ये क्वेश्चन थे, लेकिन मैंने YouTube पे पेपर से पहले बताया था आपको कि these are the usual topics that they hit in the paper. So we are very happy that out of the 10 questions that I have discussed here, you know, almost 9 of them are directly from the classes and 10th is indirectly from the class. So I'm very happy to say that these are the questions from the radiology. This time in INICET, my first observation, they have given 10 MCQs, direct, indirect from radiology, which is different from last year's pattern. Last year pattern, there were very less images. There were very less radiology. Okay. So I hope for you, that DVT was very important. There were a lot of questions based on previous year topics. So I hope you attended the PYQ का बाप. अगर नहीं किया था, नीट पीजी के लिए गलती मत करना. नीट पीजी के लिए जरूर अटेंड कर लेना बेटा. PYQ का बाप. Now we will do the NEET PG edition on the app. We will start with the NEET PG FMGE edition for PYQ का बाप. And I am telling you, we will make even better strike rate in NEET PG because we will work harder. When you give us the feedback, जब तुम बोलते हो ना मजा आ गया चैट में बोल रहे हो, तो मन करता है और मेहनत करेंगे बेटा. And many questions were directly from the regular classes. So for the people who are starting from 2026, don't directly go to the revision resource. First do the main course, then come to the revision resource. So whenever we say, okay, one question, Honda sign, I have already told you. Honda sign is sacral insufficiency fracture seen both on bone scan as well as on STIR MRI. Okay, are you able to do it? Okay, so I'm very happy that you could do all of these questions. Very soon we will upload the individual videos also, and we will give you the questions. So my request to you is keep revising. Also, let me answer one question before we go. I did a quick poll in the DAMS Telegram group. I'll just take the queries from the Telegram group also. Just give me 1 second. If you are not following it, please do it right now. There is a DAMS eMedicoz official Telegram channel. Please follow it. Now, most people were of the opinion in the Telegram group that they could just finish the paper on time. The time was there. So, was it a lengthy paper? Tell me, was it a lengthy paper or no? Was it a lengthy paper? Okay. So, most people believe that there was just enough time. Do you agree? Let me know in the chat box so that we can do a review for all students. Okay, beta. Second thing, that there was a slight predominance, almost like every other INICET paper. Basic sciences were around 53-54% is what the most people are saying in the. So, paper was not lengthy. You were able to do it. Okay. Okay. First and the last block was lengthy. Many people are saying, okay. 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 First, second prof had more representation is the most people are saying. Match the following. Less than 20 questions were match the following. Is it correct? Is it correct? So you had first, second year were more. Loads of anatomy was there. Anatomy was little tough. Yes, we can see the feedbacks. 50% basic sciences. If you go back and see my prediction on INICET in the daily transform series, this is the exact percentage I predicted for the INICET. Okay. And if you remember, for the students who had appeared for INI CBT, we followed the same order in the INI CBT. Many people were saying कि jumble कर दो वो कर दो. मैंने बताया था ऐसे ही आएगा because this is the style of the exam. So INI CBT paper was the closest resemblance to the real exam. Okay. And also most students regular notes DVT were the most useful. Around 40-50 questions were based on PYQ. Okay. PSM was more of calculation based. Anatomy was on the tougher side. First, second years were predominant. Okay. Yes. Okay. And most people believed that paper was moderate difficulty level. So this is the idea. I just want you to tell us in the chat box, how many did you attempt? आपने कितने attempt किए? Start typing. Start typing. Start typing. Okay. And there was a question on WHO recommended investigation on TB spine, but that was not purely radiology, so I am not taking that question. Maybe WHO PSM के अंदर आता है, PSM वालों की सुन लेते हैं. देखो रेडियोलॉजी का नहीं था वो, WHO recommended था, इसलिए रोक रहा हूँ यहाँ पे. PSM वालों को बताने देते, WHO तो उनके डोमेन में ज्यादा जाएगा. Okay, so how many did you attempt? So I see people having done 190 and above. So my prediction is इस पेपर में 190 से ऊपर अटेम्प्ट करने ही करने थे, बिकॉज दिस इज व्हाट आई हैव सीन मोस्ट पीपल डूइंग. 190 के ऊपर अटेम्प्ट करना था. पेपर मॉडरेट डिफिकल्टी था. PYQ, PYT, DVT, class notes were very important. So 190 is the approximate thing to have attempted in this paper. So don't panic, don't judge yourself right now. Our goal right now in this recall is not to create panic. Our goal is just to tell you, okay, कि ये था, ये ऐसा था, सोच के ताकि you can go home and relax. And next in line we have Dr. Deepti. She's going to come up with the Obs and Gyne recall, and I think hats off to madam. Every question has been asked from her notes. So let me ask Dr. Deepti now to join in. मुझे लगता है कि ये पेपर डैम्स के बच्चे के लिए उसके पास एज होना चाहिए. सो लेट मी आस्क डॉक्टर दीप्ति टू जॉइन इन.
Hanji everyone, everybody, are you able to hear me and see me? Yes? Okay. So I think there were a lot of multiple completion type questions. So maybe as of now, I don't have all the options for every question, but I think none of the MCQs are out of what I have covered in the class, right? I hope everyone agrees on that. And in fact, chota sa humne INICET marathon mein 30 minutes we had given to every subject, and that itself had a lot of hit rate. Yes, so let's see what are the questions I've recalled, and if you can give me any of the correct order of the options, you can let me know. Okay? Acha, overthinking nahi karna hai. Okay, chalo. All right, so let's talk about this. So I think let me start with what all options I have. So there was a question on the Rotterdam's criteria. Am I right? It is a multiple completion type question. Yes, every time we've covered it in the class. Okay, and you all know that, please remember, obesity is not included in the Rotterdam's criteria. Yes, as well as insulin resistance is also not included in the Rotterdam's criteria. But what do we do include? We do include hirsutism, right? We do include irregular cycles. Yes, so these are absolutely included. Okay, so these are included. Any other recall from this one that you can have? Okay, so this is the first one. Then let's look at the next question. There was another question where they have talked about 2 opinion doctor. Yes, so 2 doctors ka opinion kitne mein chahiye. In fact, we did it even in the marathon session. Yes, so it is between 20 to 24 weeks, right? So 20 to 24 weeks is when we need the opinion of 2 doctors. Okay, everyone good with this? Third, again there was a question on MTP, है ना? और हमने कितना, मैंने even in the marathon I told you, you will get questions from there. So remember, when we ask you minimum age, है ना, आप बताओ क्या आंसर होगा? There were options like 16 years, 18 years, 22 and 25. Now this is a very basic question. Do you remember we have taught you routinely कि when we talk about consent, आपको याद है हमने बात किया था क्या? हमने बात किया था कंसेंट इन माइनर के केस में किसका चाहिए? यस, गार्जियंस. सो इसका मतलब इवन इन माइनर्स यू कैन डू एमटीपी. सो देयर इज नो एज लिमिट. यू कैन डू एमटीपी फॉर इवन अ गर्ल हु इज 16 years, एंड दैट इज द आंसर हियर. ठीक है, तभी तो बात हो रहा है ना, बिकॉज लेस देन 18 इज व्हाट इज अ माइनर. सो कंसेंट सिर्फ आपको उसके मम्मी पापा का लेना पड़ेगा, द लीगल गार्जियंस, राइट? सो द आंसर इज गोइंग टू बी 16 years. देयर इज नो मिनिमम एज. Anybody can undergo MTP based on the MTP Act as long as the consent criteria is met. Okay. Chalo. Then there was a question on, अरे बाबा consent नहीं लिखा था, मैं बता रही हूँ how to reach to the answer. Okay, I am telling you how to use your basics. Alright, to reach to the answer, everything is there in the notes. You have to apply the concepts that have been taught to you. I know consent was not given. I am saying this is one of the things you know. So that means even in minors, you can do an MTP. Okay, chalo. Alright, now next important thing. There was a question which said, कौन सी condition में fetal bradycardia नहीं होगा? Yes, bradycardia is not seen in. Again, most of the options you know, there were options like abruption. So abruption में yes, there is bradycardia. There is fetal head compression. Again, there is bradycardia and fetal head compression. Then meconium aspiration syndrome, you all know, can cause fetal distress. So you know it can cause bradycardia. What was the answer? The answer therefore is maternal fever. Now everyone knows if there is maternal fever, which means there will be tachycardia. Maternal fever is actually the most common cause of fetal tachycardia, बच्चे. So जब maternal का heart rate high होगा, बच्चे का भी high होगा. Okay, it will cause fetal tachy, not fetal bradycardia. Okay, everyone good with this? Chalo. So again, everything has been so far covered. Let's talk about the next question. What is the next question? Drug which is not used, okay, in PPH. Again, so many times, even in the marathon, I told you the list of drugs that is used. Even in DVT, we have told you list of drugs which is used, which is not used. So what is the answer? Not used in PPH is dinoprostone. मैं हमेशा बोलती हूँ dinoprost and dinoprostone are different drugs, right? Dinoprostone is PGE2, dinoprost is PGF2 alpha. So yes, the answer is dinoprostone, है ना? Yes, we've covered this in Mission INICET also. I mean, we have been revising class notes in various formats. So we did Mission INICET for you. We've done a Predictor Series for you. We've done PYQ ka Baap for you. And then we did the mega revision as well. Hai na? So, chalo. No, it didn't say AMTSL. It just said PPH. So, it includes both prevention and treatment. So, dinoprostone is not used for prevention. It is not even used for treatment. It has no indication in PPH. Yes, it is used for induction of labor, beta. Okay, it is used for induction of labor. Very good. Chalo. So yes, you have to be with us, and if you be with us, you will realize that most of the things, we have really covered for you multiple times, not just once. Then I have routinely done this in class, in quizzes, every time. There was a laparoscopic image, or in fact, मैं endometriosis और PCOS का lap image बार आपको recall करने के लिए भी देती हूँ. So there was a laparoscopic image of PCOS, okay, and why was it PCOS? Because ovaries were enlarged. Yes, so ovaries are enlarged and the fallopian tubes were normal, right? Why? Because they mentioned that there is spill, है ना? So ovaries enlarged थे, uterus normal था, fallopian tube normal था. The girl probably also had irregular cycles. Yes, so this was, the image was of polycystic ovarian syndrome. Yes, very good. Okay, next there was a clinical question on a long history given, and there were so many keywords. I have always taught you keywords. So there was a clinical history where the woman had omental caking. Yes, she had ascites. Okay, she had raised CA125. And she was older in age. I think the age was 64 years, right? So, kya hai ye batao? These are all features of malignancy. So, if you go back to the class, I always tell you high risk features of malignancy. So, raised CA125, ascites, omental caking. In fact, it is an advanced stage malignancy. I even gave it in my telegram. Now, if it is raised CA125, as I said, it is a malignant mass and it is older woman. Yes, it is serous. Okay, CA125 is the tumor marker for epithelial ovarian tumors. But it is not raised in mucinous, bache. Mucinous ka tumor marker, how many times I have given you this? Mucinous ka tumor marker hota hai CA199 and CEA. It is not CA129. Okay, so answer is not mucinous, answer is serous. Okay, there were 2 questions on ovarian tumors. I'm coming to the second one. Also, the answer for this question would not be any of the benign tumors. Some of you have marked fibroma because you thought they have written ascites. So you were thinking of Meeks syndrome. No, it is not a fibroma. Fibroma is a benign tumor. Okay, fibroma is a benign tumor. It will not show omental caking. These are features of malignancy. इसीलिए classes में concept करना बड़ा जरूरी होता है, because if you have done that, your revision through multiple, हम तो DAMS में बहुत सारे revision कराए हैं आपको, है ना? We have done multiple revisions. Okay. Yes, obviously, if it is malignant, it will have solid components. Okay. If it is malignancy, ये सब वही तो मैं बोल रही हूँ, they had all features of malignancy. Solid component is also a feature of malignancy. Okay. Now, next question. There was another question on ovarian. Yes, and there was a gross finding and a histopath finding, and it was directly from what I have done in the class. Right? It was granulosa cell, but it was a multiple completion question. It was, yes, Karl-Exner bodies, है ना? So Karl-Exner bodies का image था. They have given you enlarged picture of coffee bean nucleus, है ना? So enlarged picture of coffee bean nucleus and Karl-Exner bodies. Although Brenner's was also in the option, but the recall that I have got was about the image of Karl-Exner, exactly like we do it in the class. Right? So remember, Karl-Exner is a sex cord stromal tumor. I have always told you, DVT में भी मैंने बोला है, classification is important. Right? Classification is important. So it is a sex cord stromal tumor. Yes, inhibin will be raised. है ना? Inhibin will be raised. All these things we have done in the class. But CA125 will not be raised because it is a sex cord tumor. And when we talk about CA125, that is a marker of epithelial ovarian tumors. Yes, exactly. It is a multiple completion. Yes, do let me know what were all the options so that I can give you. But I know that it is a multiple completion type question. I don't have all the options framed. Yes, inhibin was there. That is for sure. Sex cord tumor was there. That is also for sure. One option was CA125. So that will not be included. Okay, CA125 would not be included. ठीक है? Is that clear to everyone? चलो अगला करें. Should we do the next one? Okay, let's look at the next question. So then there was a question on MagSelf. Again, we covered it even in marathon, DVT, every time. Yes, every time we have done this. So MagSelf के uses पे questions are. What is not the use? Increases renal perfusion. So it does not increase renal perfusion. Yes. So बहुत बार हमने ये किया है. It does not include renal perfusion. Yes, we have covered this. That it is what? It is going to be used as neuroprotection. We have talked about use for prevention of seizures as well as treatment of seizures. Okay, so yes, the answer is going to be, it does not increase renal perfusion. It is not a vasodilator, right? Yes, exactly. Chalo, very good. So this one is again covered for everyone. Let's go on to the next question. Then there was a question on, okay, let's see what are the other ones I have. Okay, there was a question on UTI in pregnancy. Yes. UTI in pregnancy, what is the complication? Again, directly from my class notes, always and always. मैं कुछ topics बहुत concise करके पढ़ाती हूँ, but they will always cover the key points. The answer is what? Preterm labor. I have told you multiple times. In fact, I have told you that it can be used for what? It can even be, you know, when we talk about UTI and preterm labor, मैंने बताया हुआ है, whenever you talk about preterm labor, the single most important risk factor is infections. Even true for bacterial vaginosis. I also gave it as a, you know, question in my Telegram channel for revision. What is the complication of bacterial vaginosis? So those infections are going to cause preterm labor. Yes, abruption prevent हो जाएगा ना बेटा अगर preeclampsia में आप दोगे तो. So abruption is a complication of preeclampsia. Right? So if you had to choose single best answer, then we will go with renal perfusion. ठीक है? We will go with renal perfusion. Okay. No, how can chorioamnionitis be a direct complication of UTI? No, chorioamnionitis is a complication of PROM. Okay, premature rupture. In fact, it is not very common thing that you come across. The question asks you the most common complication, and that is preterm labor. Yes, first trimester UTI. In fact, this is exactly how I teach in class. If you go to my topic or initial classes, when I teach about physiological changes and I talk about testing of urine routine microscopy, I always teach this, that even if it is asymptomatic, you should treat UTI in the first trimester because it will increase the risk of preterm labor. No, it is not a risk factor for abortions. It is actually a risk factor for preterm labor, right? Right in the early part of my class, I always talk about first antenatal visit. I talk about urine routine microscopy. Why is it done? Okay. All right. Now we go on to the next one. Okay. Next question again directly covered in the class. I have shared these snapshots in my Telegram channel. Yes, mujhe batao, Turner's syndrome. They had asked you what is not true. What is the answer? Prominent occiput. No, Turners do not have prominent occiput. That is not true. Everything else is directly from the class. I have shown you image also. I have made you write down in Ultimate App Live classes as well, right? You will see what were the other options. The options were webbed neck, which is seen. You will see short fourth metacarpal. यहाँ पे मैं in fact इतना भी बताती हूँ that this is a point which INICET will ask, not NEET PG. So whenever I am teaching in the live class, my students will agree that I always try and segregate that this is the depth you need for INICET. This is what you are likely to get in NEET PG. So short fourth metacarpal, that is also seen, and widely separated nipples. Yes, widely spaced nipples. So these can be seen. So again, this is something that we have covered. Okay. Now next, what are we going to talk about? Next, we will talk about most common HPV strain. Very simple. I think everyone would know what is the most common HPV strain. So yes, the answers are 16 and 18 directly from the class. In fact, I also tell you what I tell you, that when it is 16 and 18, they are responsible for 70% of cervical cancers. Yes, and I said that these are the percentages which INICET is fond of asking. Okay, so a simple one. Then again, one slide in my marathon I included for teratogens, and do you agree that it was a very, very important thing that I told you? Yes, so even covered in the INICET marathon, I only selected few slides from my Obs DVT. It was just few slides. Okay, from the obstetric DVT, and one of those was teratogens, right? So it was about neural tube defect. What is the answer? Valproate. Yes, neural tube defect, valproate, right? Yes, you even got thalidomide. It is teratogenic, although you had other options about thalidomide as well. But yes, these were the two questions. Neural tube defect, valproate and thalidomide. There was another question. Okay, there was another question where they have asked, which of these drugs is safe in pregnancy or not given? And you have options like lamotrigine, levetiracetam, and there was valproate here as well. And this is again something that I have routinely taught you, that it is supposed to be a category X drug. यहाँ तक भी mention करते हैं कि valproate के बारे में INICET does tend to ask twisted questions as well, है ना? Turner's का आंसर था prominent occiput, ठीक है? Now next question, let's go on to the next one. There was a next question. Yes, let me see. All are aneuploidy except, again a very, very simple one. All are aneuploidy except, right? Whenever I teach you primary amenorrhea, whenever I teach you Downs, we have been talking about this. I'm sure path people have also talked about. What was the answer? The answer was Bloom syndrome, right? So the all are aneuploidy except, we had options like trisomy 21, trisomy 13, Klinefelter's syndrome, right? So Bloom. Okay. Ready everyone? Yes, yes, yes. Coming to the other questions, have patience. Are you? Now coming to the next one. The next one was steps of pap smear. Now this is again something I talk in detail in my classes, and I in fact ask questions like this. Please remember, I have taught it in Ultimate App Live as well, right? We are not supposed to do a PV exam before taking a pap smear. So you ask the patient to lie in lithotomy position. Yes, you do a per speculum exam and you make the smear. कुछ चीजें मैं स्पेशली पढ़ाती हूँ कि पीवी नहीं करना है. You don't have to clean the cervix, right? No douching to be done. So these are the things that we routinely teach when we teach concepts, because we always start from basics in the class. So this is again covered. Okay. So PV is not done before taking a pap smear because you will scrape off the superficial cells. Okay. So you will scrape off the superficial cells. Isiliye you just put her in the lithotomy position, do a speculum and you make the smear. Yes, I know it was arranged. Magar when you have to arrange, the order is 1, 2 and 3. You don't include PV. Agar PV karna hai to end mein karoge after making the smear. Right? So this is what you need to know for this one. Okay. Now the next question. There was a question on timing of insertion of IUD. Now IUDs can be inserted anytime as long as we are sure that the woman is not pregnant. So what was the best answer to know the woman is not pregnant? She is in the first 7 days of LMP. So you are very sure that if she is within first 7 days of LMP, she is not pregnant. So as long as we can reliably say the woman is not pregnant, we can put the intrauterine device, right? So first 7 days. No, it was not about postpartum IUD. Some of you are getting confused. That is a NEET PG question. Okay. So NEET PG में हम बात करते हैं postpartum IUD. For that the time limit is within 48 hours. Okay. Within 48 hours is the answer for postpartum. Okay, it was multiple completion. You have to tell me what were all the options. So, agar multiple completion hai, then we will include this also, right? So, this is also correct then. So, postpartum within 48 hours is correct. You will include this also if it was multiple completion type. Okay, right? So, okay, ठीक है. So, आप बाकी option भी बता दो. So, this is correct. Yes, in the first 5 to 7 days, it is correct. In the first 5 to 7 days, it is correct. Okay, that is correct. Somebody saying till now they've got all 18 questions correct, and I'm so happy to really see that. Okay, now any other question that you can recall? This is the ones that I have been able to recall. So any other recall question? I think I've covered the ones that I got, but any other MCQ? Okay, anything else that is left, Beta ji? Yes, so within 7 days of the next menstrual cycle, which is true, because when you say within 7 days, it is first 7 days of from LMP only, na beta. The first day is the first day of the menstrual cycle. So that is correct. Okay. I've already discussed cervical cancer most commonly. वो कर चुके हैं. Yes, ये मैंने इसलिए नहीं लिया because Dr. Sumer has already covered it. Again, whenever I teach teratogens, I teach about radiation exposure, and I have taught you. But since Dr. Sumer had already covered, I haven't taken this. But yes, CT scan is contraindicated, something that we routinely covered. Yes, there was a question on toxoplasma as well. Again, if you have attended my classes, again, this is from the topic teratogens. And if you see, मैंने Telegram पे photo खींच के डाला है, right? And that is the first line when I teach about viral infections. What is the first line? That transmission increases as POG increases. So transmission will most commonly happen, or highest risk of transmission is in the 3rd trimester. Yes. So highest risk of transmission is in the 3rd trimester. So transmission increases as POG increases. Okay. Yeah, okay, thalidomide, they are saying it was tough because I think the other options were pharmacology, but one of the options is that it is teratogenic and contraindicated in pregnancy. Yes, okay. So this, no, I think the question was not about teratogenicity. From the recall that I've got, the question was about transmission of toxoplasma, okay. 48 hours postpartum is correct. Within 7 days of PP, what do you mean by that? Postpartum, no, you don't put it within 7 days postpartum. It is only up to 48 hours. But immediately after you can put, yes, because there is a post-placental insertion as well, within 10 minutes of placental expulsion. So that is correct, okay. Yes, Magself is neuroprotective. It is a very basic thing. I've taught you multiple times and I'm sure you have seen the INICET marathon as well. Okay. Okay. GnRH, मुझे अभी ANTAC का, I haven't got the recall. Probably it is a, pharma question. So I haven't got the recall for GnRH ANTACs, but yes, you let me know and then I will let you know the answer. Okay. Yes, 7 days of the next menstrual cycle means it is from first LMP, right? Because first 7 days is you are ensuring that the woman is not pregnant. So you let her have the menstrual cycle and the first 7 days we are very sure that she is not pregnant. So you can put the intrauterine device. Okay? Okay. Everyone, are you okay with the recall? Any more recalls? So how have you done? I think fair number of questions. कौन कह रहा था Obs Gyne से कम questions हैं? Okay, so Obs Gyne, even if you include the common question, one from maybe radiology and one from maybe some other subject, there are still 18 to 20 questions, which is what is the pattern for INICET. Nothing was out of the class notes. In fact, we've done multiple revisions in the form of, I just told you, Mission INI, PYQ ka Baap, Predictor Series, DVT. So at DAMS, we are going to do multiple revisions even for NEET PG, right? So stay tuned, we'll help you push in the last month, okay? I told you minimum age for MTP 16 years will be the answer, beta. There is no minimum age. Just the consent now will be the guardian's consent. Okay, what was the question on male infertility? I haven't got any recall from male infertility. So, okay, everyone, are you okay? That's a good thing. 1 to 2 correct is, wrong is okay. Don't be so harsh on yourself. Galtiyan hoti hain. Even if I go for the exams, I will also do some mistakes. Yes, so don't worry, you've all done well. Relax. Right, it is all a matter of who has done more mistakes, so don't worry, okay? Chalo, so fair enough everyone. Let me, if you have any other recalls, let me know in my Telegram channel. And one of the funniest things that I was doing revisions for other subject as well, and I just got to know that one of the questions that I gave in Path for revision directly came in the exam, yes? So I will continue with the revision series in the Telegram as well, which is free for everyone. I have been dedicating time for it, right? So we will do that, or we will keep continuing. Very good. So many of you have got 20 out of 20. So proud of you. Super, super happy. All the best, everyone. We are with you. And remember, the purpose of this recall is only to help you know what to use now for NEET PG. So you revise your content. DVT was super helpful. Remember, the marathon was only a few pages of DVT, right? So now NEET PG, let's give stress to it. I will be posting the DVT based tests also for you to help you in revision. Okay, we will stay with you, don't worry. Chalo. GnRH ANTAC, let me see. I think it's a pharma question. I really don't have the recalls of that, but whenever I do, I will give you the answer for that. Okay. Telegram channel is simply search by the name of Obs Gyne with Dr. Deepti. All of you can join in. Okay. Obs Gyne with Dr. Deepti. आ जाओ, पढ़ेंगे, खूब एक दूसरे की help करेंगे, and we will help you do your best. That is why we are here for, to push everyone to do their best. And remember, you are not known by your marks or ranks. Yes, you are more worthy. Everyone can improve no matter where you are. We just need to know where are we lacking. We will work on our wrong diary and we will get better. Okay? And do you all want us to do the NEET PG marathon as well? Let me know, everyone in the chat box. Do you want us to do the marathon session for NEET PG as well, like we did for INICET? Okay. Chalo, take care everyone. Let's see who is the next question. Beta, agar PV was in all the options, it will be the last thing. It is so simple, beta ji. Somebody saying, ma'am, PV was in all the options. So very simple. It will be the last thing. You will first make the smear and after that you will do the PV. So put her in lithotomy, do a speculum exam, then make the smear, and in the end you will do the PV. Okay, so if it was in all the options, it will be the last one. Don't be scared. We are all in it together and we are in it to win it. Okay, so let's wait for the next faculty. Do stay tuned in, and if you recall anything else, do let us know. All the best everyone, all the best.
Hello. Hello. Good evening. Good evening. So I'm so happy because everybody gave very good feedback about micro. So micro is not much dangerous, much not harmful subject for this INICET. All questions are from notes, DVT, LRR, like that. I got a very good feedback. Thank you very much for that first. And I will start the question. A child with anal pruritus, microscopy of the pathogen shown here. Choose the correct. Maybe the same kind of picture they said, anal pruritus, and this egg is given, plano-convex, kidney-shaped egg. So we can go for enterobius vermicularis. Enterobius vermicularis. We can hear you, sir. Thank you. Enterobius vermicularis. Very simple and direct question. I'm so happy. And blotting methods. I got the feedback. You told the mnemonic, dosa, roti, pizza, by seniors mnemonic, my professor's mnemonic. Everybody follows. Northern blot is for RNA. Southern blot, dosa, DNA. Western blot for proteins. This question everybody answered. You made micro easy, sir. Thank you, Daval Patel. Okay, and next is, if any extra choices are there, any extra questions are there, you please put it in my Telegram group, Micro Magics, or you can contact me, my inbox. Auto-infectious agent. I gave the mnemonic to you, remember? I gave the mnemonic to you. Auto-infection is, these are the agents causing auto-infection. Here it is tonsillitis stercorales. I got somebody gave Hachinana also. I'm not sure about the choices. You give the correct choices. You give the correct choices. Thank you. Next is, all the following are dimorphic fungi except I gave the beautiful mnemonic. Remember, STS, systemic mycosis, T for Talaromyces, and S for Sporothrix. Here Coccidio, Talaro, Histo, all except Cryptococcus. It is the same question you already we discussed in many times. Same question came in GT, same type of question came in our what is called test and discussion. Many times we have the question. All are dimorphic except. That question is very renowned question. If Hachinana also there, you can go for it. That is the doubt, still it is there. Some people say no Hachinana, some people say yes. I will clarify, don't worry. Okay, this is the answer. Cryptococcus is the answer. Next is gram-negative diplococci, Neisseria gonorrhoeae, clinical image is given. What are the drug of choice? I already told, any Neisseria infection, go for ceftriaxone. In case of gonococci, syndromic approach, ceftriaxone with azithromycin. So many people said ceftriaxone is there, go for ceftriaxone, that is the treatment. Okay, I will write it, H-non also there. If H-non also there, that is also an option. That is also an option. It may be multiple choices. It may be multiple choices. Both were there. Great, 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 great. If you want to, both are causing autoinfection. Both are causing autoinfection. There is nothing which is best among the two. Both causes autoinfection, my dears. Okay, right. Next is resistance to penicillin, go for ceftriaxone always, because they produce PPNG. Penicillin is producing Neisseria gonorrhoeae, treatment is ceftriaxone, go for ceftriaxone. Great, great, great. Next is image shown here, the same image I taught in my class. It is available in the workbook. If you see the workbook, the same image was there. What is it? It is called satellitism. One option already there, it is camp test. I know about the other choices. I don't know about the other choices. So penicillin resistant, go for ceftriaxone. I'll write the question, penicillin resistant. I'll write here for my reference. I will make another video, a recollection video. This is first hand information from the kids. After that, I need to discuss with the kids. I'll get more feedback from you. I will reform the questions. Here, see, the question is image shown here is, but I don't know what exact question they mentioned. Okay, right. Same image. Yes, yes, Dr. Madhurima, same image. You see my workbook, the same image is there. I'll take a screenshot and put my Telegram. Same image was there. It is nothing very this thing serious, because I searched in Google. That was the best image I put. Same thing done by the examiner. I used to tell many times in the classroom also. Nothing special. We search in the Google which is the best image. As a microbiologist, I love this image. I gave it the same image to you people also. If you take my notes, I explain this how it happens. Next is one option was camp test. I don't know about the another. Haemophilus influenzae. Yes, this is called satellitism. Organism Haemophilus influenzae. I don't know whether they ask what is it or Haemophilus influenzae. Great. Great, great, great. Exact same image. Thank you, Prince. Paper was a little lengthy. Next is Kanagawa phenomenon in Vagat-Sumagar. I used to teach just 5 points Vibrio parahemolyticus. In the 5 points, you remember, yes, 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 it is salt liver, safety pin appearance, exhibits swarming, and seafoods, and Kanagawa phenomenon. I just teach 5 points. Okay, this same question, Vibrio parahemolyticus. Vibrio parahemolyticus. The test is satellitism, my dear. Arvind Sab, the test is satellitism. Beta hemolysis in Vagat-Sumagar is called Kanagawa phenomenon by Vibrio parahemolyticus. I got the question, I got the clue, keywords, telegramic words, Kanagawa phenomenon, Vagat-Sumagar, Vibrio parahemolyticus. I don't know what is the exact question, what are all the other choices. Okay, that we need to do later. I need to make a proper question from you people only. I will get this is just first hand information I'm giving to you. Lot of match the following came because INICET match the following is what is called characteristic feature of INICET paper. See here. You did the question rule out method, great. That's all. See, louse. I always tell one question from vector will come in my DVT. DVT I put 7 to 8 slides on vectors, especially with videos. Remember, if you attend my DVT, you remember I give that much importance to vectors. So louse is the vector for epidemic typhus. Tick is for endemic typhus. Sorry, slip of the tongue. Sorry. Tick is for Rocky Mountain spotted fever. Just. Rat flea is endemic typhus. Mite is rickettsial pox. Mite is rickettsial pox. Okay, louse is epidemic typhus, rat flea is endemic typhus, tick is rickettsial Rocky Mountain spotted fever, and mite is for both scrub typhus and rickettsial pox. You remember my table? Rickettsial table, I used to tell one table in rickettsia. I put some question on Corynebacterium minutissimum. I don't know where I got the thing actually. Question, please make. Next is some tests for diseases. Okay, one is called standard agglutination test, SAT-B, for brucellosis. MAT is the gold standard for leptospirosis. Cold agglutinin test for atypical pneumonia mycoplasma. VDRL test for syphilis. These are the choices I got, and the person who gave the choice have the question, have the doubt, sir, the SAT, MAT, VDRL, okay sir, but cold agglutinin I have the doubt, sir. You people clarify. What is the fourth choice? Why it is not Hachnana? I don't know, because first time I am getting Hachnana here. People said only strong gliders, and the auto infection, is there any other clue is there? They gave the egg photograph, or if they gave any ovoviviparous like word, if they put any word called helminth, or if they put anything cystode like that. I want to get the full question, my dear, to get the correct answer, because strong gliders, Hachnana, both will cause auto infection, but they gave some trap to you. I need to find the trap. I will clarify the trap. Don't be panic. Don't be panic. Yes, my network is a little bad because I am in the hilltop. I am sitting in the hilltop. Okay, suddenly I borrowed the laptop from other people. I arranged a little my studio to my better. Because of the cold, I wear the DAMS hoodie. Don't worry. Okay, attitude, I want to teach you people. Wherever I am, I will teach. Don't worry. Okay. Next is if I am sitting in my studio, everything will be clarified, clarity will be more, net will be, everything is more. Okay, here I am using my mobile net. I am using my mobile net to see my YouTube and everything. Nothing to worry. Okay, don't worry. See here, this question, how many PCR cycles are needed to produce half amplified DNA copies produced by 26 cycles of PCR? After seeing the question, everybody become panic. If you understand the concept, it is easy, because 2 to the power n. Okay, suppose if 100 copies are 26 cycles, 50 copy will be 25th cycle, 25 copy will be 24th cycle, like that, 2 to the power n. So it is 25. It is 25. Yes, Kodaikanal. Yes. I got some question from Kullang reaction from Streptococcus. I don't know. It is demonstration capsule. Strep pneumoniae or any capsulated pathogen is there. Okay, right. So each PCR cycle doubles the DNA. If 26 cycle gives this amount of copies, 25 cycles will be this amount of copies. So which is exactly half. If 26 cycles gives 100 copies, then 25 cycles will give 50 copy. That is the concept. Got it? Right. If it is 27 means answer 26. Half will be 1 cycle less. That's all, my dear. I am not getting the exact number from you people. If you people have 26, then the answer will be 25. If it is 27 cycles, answer will be 26. Okay, right. Next is patient with painful vesicular lesion. Drug of choice. Painful vesicular lesion, always think of herpes. Herpes treatment, acyclovir. Second painful ulcer is Haemophilus ducrei. You can go for azithromycin, those kind of drugs. Okay, match the column with the Kullang reaction, Streptococcus. Yes, I will get the question for you, my dear. Okay, right. Next is, I got Mycobacterium difference question. What is the question, my dear? Some Mycobacterium difference. I got only one kid, but I didn't get the full question. If it is 26 cycles, answer is 25. If it is 28 cycles, answer is 27. What is the cycle they gave in the question? One cycle less is the answer, my dears. Dimeric antibody, dimer is what is called? IG, secretory IgA. Secretory IgA is dimer. Okay, right. What question from tuberculosis? I have discussed around 13 questions. Some questions I wrote here. Colon reaction, like one or two questions I wrote here. Total around 15 questions will be there. Got it? Mycobacterium, TB, milk answer. What I don't know exact question. Please give the question. If you give the correct question, then only I can discuss. Okay. So with this, we finish our microbiology first hand discussion. This is the first hand discussion. Options may be changed according to.
Okay, so am I audible and visible? Can I get a quick thumbs up? I just need a quick thumbs up from all of you if my audio video is going smooth. Okay, so am I audible? Great. So I think I can see myself, and I hope Micro sir was done because there was some error with his connection, and that is why we could not see him at the end. Chalo, okay, great. Okay, so let us start with the dermatology recall. So how was it? Anyone can tell me what was your opinion on the dermatology questions? So the dermatology questions, majority were the like you have more than one options, multiple choice questions were more, and I think there was only one question which came from the image based, right? Okay, so I have got around 6-7 questions, I guess. So we have got 7 questions. Let us discuss each of them one by one. Okay. Yes, direct question, I would say it was direct question nahi tha because it was more and more multiple choice, but the topics could be very relatable. Okay. Chalo. So let us discuss the first question which I got from all of you. Question hai, this is a question from STD topic. A patient with pus on the tip of the penile shaft. Now I was told that there was no image given with this question. Pus on the tip of the penile shaft. So this indicates that it is a question from urethritis. Okay, because in urethritis patient you see frank pus coming out of the urethra. There is also history of unprotected sexual intercourse. So we can relate that this is a patient of STD urethritis. Now, I don't know whether this was given or not, but the question says that gram staining shows gram-negative diplococci. If that is given, the question becomes very easy. Gram-negative diplococci is a feature of gonococcal urethritis. Penicillin-resistant gonococcal urethritis, please remember the treatment which we give is ceftriaxone. And I think the same question was also discussed by your microbiology sir, that whenever it is the penicillinase resistance or penicillinase producing gonococcus, the ceftriaxone becomes the best option. If you notice in the STD kit also, we try to give cephalosporin group. If we have to give oral, we give cefixime. If we have to give injectable, we give ceftriaxone. So this was the answer. Chalo. So the first question ka answer ceftriaxone hona chahiye. Anybody can tell me what are the other options? I have no idea kya other options hai. If you can just tell me about the other option, we can fill this. Amoxicillin was there. Okay, amoxicillin was one option given. And one was tetracycline. Chalo, we got all the 4 options. Please remember the correct answer should be option number 2. There should not be tetracycline as the answer. See, this is not a genital ulcer where there is resistance to penicillin, so you have to think of doxycycline. No, this is a clear-cut question of urethritis. And if you remember, gonococcal urethritis mein humne padha hai treatment of choice nowadays is ceftriaxone or oblique cefixime. So this was the first question which we got. Now, this is the second question. Again, we have a question from STD. Here, there was a clinical image as told to me by students that there was a clinical image where there was vesicular lesions. Now, I don't know whether the vesicular lesions were on the genitalia or on the body, because one student have shared a body ka vesicular lesion. But if it is a patient of genital vesicular lesions with something on palm and sole, please remember this is very classical herpes simplex virus. herpes simplex virus can have vesicular lesions on the genitals. We call it herpes genitalis. And what is the causative agent? Herpes simplex type 2. If we see vesicular lesions around the oral cavity, what is the diagnosis? Herpes labialis, and it is herpes simplex type 1. Now, what is this palm sole lesions? I don't know whether it is given or not in the question, but if this is given in the question, please remember, bachcho, palm sole in herpes patient can show target-like lesions. Okay, erythema multiforme, the commonest cause is the herpes simplex virus, and that is why the answer should be acyclovir. It was given in the question. Now, vesicular lesions with painful erosions were given. Navneet says कि along with vesicular lesions, painful erosion word was also given. पाम पर था एंड हिस्ट्री ऑफ एसटीडी था. देखो, पाम पर वेसिकुलर लीजन्स नहीं होते हर्पीज वाले पेशेंट्स में. सो पाम पर इफ देयर वाज अ वेसिकुलर लीजन, इट शुड नॉट बी हर्पीज. ओके, vesicular lesions on the palm and sole. Anything else was given? It was a histopath image with question saying vesicular lesion, and I think the image might be cow dry bodies. इसमें you have to tell me the exact question. अगर genital का vesicles है, then I would think of herpes simplex. Okay? Yes. अगर Zang smear दे रखा है तो it cannot be syphilis. I don't know why you're getting confused with syphilis. Syphilis में Zang smear नहीं करते. Plus, if you remember, syphilis में palm soles में vesicles नहीं होते. If you remember, only in a congenital syphilis you see vesicles on palm and sole. Otherwise, palm soles पर vesicle adult syphilis वाले patients में नहीं मिलते. So that is something which I think if the palm sole is given and if it is not a congenital syphilis patient, that could not be a patient of syphilis. ठीक है? History of genital lesions now presented with hyperpigmentation. Now Sushmita is saying that it was a question with genital lesions, now palm sole lesions. If they are writing that history, genital lesion, palm sole, this can be syphilis. Syphilis may you see genital lesions, you see palm sole lesions, and if this is a syphilis, there should be benzathine penicillin in the option, or if there is no benzathine penicillin, they should give doxycycline in the option. So I need a correct option, correct question, so that we can make an answer here. There are a lot of students who are saying that ma'am vesicle नहीं दिया था. अगर वेसाइकल नहीं दिया है तो herpes नहीं बोला जा सकता. The only reason why I'm saying that this is a herpes is because it says vesicular lesion. If vesicles are not given, the next best option for genital and palm sole should be syphilis. क्लियर है सबको? सिफिलिस होगा और सिरोलॉजी कर सकते हैं. डेफिनेटली वी कैन डू सिरोलॉजी. दे कैन गिव यू अ डार्क फील्ड माइक्रोस्कोपी का इमेज. सो प्लीज रिमेंबर, इफ देर इज नो वेसाइकल लीजन्स, देन डेफिनेटली इट शुड बी syphilis. Coming to the next. Now, this is a very, very tricky question. I want all my students to tell me what are the correct options given, bachcho. Please tell me in this question what was given. If they say the first manifestation of SLE patient, okay, if the question says the first manifestation of the SLE patient and they have not mentioned about skin, in general, if they are asking you the first manifestation of the SLE patient, I would mark my answer arthralgia, myalgia, fever, non-specific symptom. But if they are writing the most common manifestation or the most common cutaneous manifestation, then I would go for photosensitivity. So, bachcho, you have to tell me what is given in this question. So, if it is the most common cutaneous manifestation, then it should be photosensitivity. In general दिया है तो arthralgia, myalgia भी आंसर हो सकता है. ठीक है? So, most common है या first है? Most common है तो आंसर हो जाएगा photosensitivity. No confusion. सबसे ज़्यादा you see photosensitivity. Majority of the patient presents with photosensitivity. So, the answer becomes option number 1 for this question. Coming to this question, scabies treatment in children. अब बच्चे बोले कि ये multiple choice. This was a multiple choice question which was given in your exam. Please remember, they have mentioned children. I can give 5% permethrin, safe in children. 10%, please remember, up to 12% benzoyl benzoate can be given in children. Ivermectin, no, completely contraindicated in children. Crotameton can also be given in children. What all drugs are contraindicated? Ivermectin, then lindane. which is also known as GBHC, gamma benzyl hexachloride. So for this question, we can give 5% permethrin, we can give 10% benzoyl benzoate, and we can give crotameton to the patient. If they are writing children, you can give this. If they are writing children, 5% permethrin, 10% benzoyl benzoate, and crotameton all becomes the correct answer. If they are writing 25% of benzoyl benzoate, then you cannot give it. See, I told you up to 12% of benzoyl benzoate can be given to children. Above 12% of benzoyl benzoate cannot be given to the children. So if the question says it is 25%, then this becomes a wrong statement. Okay, 25% agar de rakha hai, so that becomes a wrong statement. It cannot be given to children. Only up to 12% can be given to the children. Okay, so kya answer ho jayega? The answer becomes 5% permethrin and crotameton. This all, both of them can be given in the children. Okay, coming to the next question. Now this is a question where I got the mixed reviews or mixed opinions from these children, students. One is plaque on the side of the neck. Now one student told me that the plaque has one side extension and one side atrophy. If you see a plaque with activity and atrophy at one time, the diagnosis becomes lupus vulgaris, which is cutaneous tuberculosis. And if it is cutaneous tuberculosis, skin biopsy becomes the treatment of choice. So you have to tell me what is given here, bachcho. You have to tell me what is given here. If they are writing something, some annular plaque with atrophy, with scarring, along with that of extension, then skin biopsy becomes your best option. Skin biopsy becomes your best option. Kya hona chahiye isme? So any addition to the question, कुछ और दिया था? Was there any image given in this question, बच्चों? ठीक है? So no systemic symptoms. If they are writing progressive, again progressive lesion favor the diagnosis of lupus vulgaris. Why? If the lesion is progressive, means it is active also, and that is again a feature of lupus vulgaris. ठीक है? Scrofuloderma was, you have to write multiple choice was given. Agar multiple choice tha, then I can also do chest x-ray, because please remember, majority of the time if the neck lesion is given, it can be scrofuloderma. And what is scrofuloderma? The lymph node, underlying lymph node is bursting onto the skin. In that individual, you have to do a chest x-ray also to rule out the pulmonary TB. So even if it is the neck lesion, even if it is scrofuloderma, then you have to do the chest x-ray, keeping in mind the pulmonary TB and the skin lesion as scrofuloderma. So if it is multiple choice, your answer should be chest x-ray and skin biopsy. Chest x-ray and skin biopsy should be the answer. Okay? KOH has no role if it is an atrophic plaque. If it is extending, no clearing is given, no scaling is given, then I will not consider this as a patient of fungal infection. For fungal, I was told that they have mentioned that the plaque was asymptomatic. Fungal infection cannot be asymptomatic, bachcho. But yes, skin TB, they are asymptomatic plaque. No itching, no scaling, they just keep progressing. So if the plaque was asymptomatic, please remember the answer becomes the diagnosis becomes skin TB, cutaneous tuberculosis. Okay, I hope this is clear to all of you. Clear hai? Chalo. Now that is another question which is correct. Now I am not sure whether this is multiple choice or not, but it should be multiple choice, because whatever option is given here, which is correct, epidermis can regenerate from hair bulb. If you remember, bachcho, I told you that this is your, wait, I'll show it here. On your skin, there is hair, and in the bulbar portion of the hair, just below the attachment of erector pili muscle, there is a thickening which is known as Adamson's fringe. Here on the hair bulb, there is a thickening which is known as Adamson's fringe. This is the collection of stem cell. Please remember, there are a lot of studies which shows that if the skin damages, the stem cells from these bulb, they come out and they help in regeneration of epidermis. So please remember, this is the epidermis can regenerate from hair bulb, correct statement. Now second option was stratum corneum is the outermost layer. Is it true or false? Stratum corneum is the outermost layer. This is true, but some students are saying that one of the option number 4 was stratum corneum is acellular. No, this is a wrong statement. I told you stratum corneum is a layer which is only made up of cells, nothing other than cell. So it is a pure cellular layer made up of 4 types of cells. Keratinocytes present in majority, then we have melanocytes, we have Merkel cells, and we have Langerhans cell. So option number 4 will be wrong. Option number 3 is correct. Please remember, epidermis is a ectoderm derivative. I told you in epidermis, the epidermal cells are also ectodermal derivative, except for melanocyte, which is neural crest derivative, and Langerhans cell, which is the mesoderm derivative. So please remember, these were some of the features. I don't know what was the other options given. Some students say that the option was stratum corneum was cellular layer. If it is cellular layer given, then that is a correct option. If they are writing acellular, then it becomes the incorrect statement. Okay, so I think these were some of the questions. There is one more question. Topical corticosteroids, what are the side effects? What does corticosteroids do? Please remember, topical corticosteroids causes thinning of skin. This is correct. Atrophy of skin. This is correct. Acne. That is correct. Please remember, hyperkeratosis. No. Hyperkeratosis means thickening of the skin. The topical steroids never causes thickening of the skin. It always causes thinning of the skin. So please remember, bacho, if these are the option, then 2, 3, 4 becomes the correct choice. Okay? Some students are writing bluish discoloration of the skin. Now bluish discoloration, I would not say that that would be a correct option. If they are writing reddish discoloration, or if they are writing telangiectasia, then that would be the correct option. Why there is telangiectasia? Because when the skin becomes thin, the underlying blood vessels become visible, and that give a very classical reddish appearance to the skin. Hypertrichosis, if it was given, that is also correct. Hypertrichosis is correct. Hypertrichosis is correct. When you use steroids for a longer duration, there will be excess hair growth. You must have seen that patients who use steroids on the face tend to develop more hair on the face. So hypertrichosis would be correct. Students are saying that hyperkeratosis was not given, hypertrichosis was given. So that is definitely a correct option. Okay. So these were some of the questions which were given to me. There must be more question. I think one question was on thalidomide. I have no idea what was that question. I request all the students to please write down under the chat section. I'll go through it. These are the recall questions, so maybe there are some wrong options also. Maybe the question is wrong. Tomorrow I'll try to come up with as much as correct options as well as much as correct images, and I will try to put the exact recall by tomorrow. Okay, so I hope these were the questions from dermatology. Little bit difficult because there were multiple choice and it was difficult for us to more time consuming, and definitely multiple choice made becomes little tricky, but at least the topic which we got were all known topics from dermatology. Okay, so I think that's it. Thank you all of you. And
Hello, good evening, everyone. All right, so let's start with this recall session of INICET medicine part. Hopefully, this time medicine was relatively easy to moderate. So this is a recall based session. Maybe we'll not get full recall because depending on the exact question, the answer might change. So you also try to give your inputs in the options as well as in the questions. So let's start with the question number one. In general, we can say the portion of the medicine were the usual portions, like questions were asked from the CVS, 2-3 questions, and as discussed in the YouTube session INICET, the topics which we discussed, like heart failure will be there, the topic of hepatitis will be there, examination finding murmurs. So these was the topics of the CVS, cardiovascular system. So let's see the question number one. So is the voice clear to all of you? Okay, so question number one. Question is which type of the pulse represent a Frank-Starling law? So the answer here will be the pulse which represent a Frank-Starling law means ki if the stretching is less, contractility will be less, stretching of the ventricle is more, contractility will be more, and that typically will be seen in pulsus alternans. So the option here will be pulsus alternans. Yes, hopefully all of you must have written this as pulsus alternans as the correct answer. So that means ki there will be a low amplitude, high amplitude, low amplitude, high amplitude of pulse will be seen, and this is very specific pulse of left ventricle failure. Every time this we discuss in our cardiovascular class, and pulsus paradoxus is seen in cases of tamponade. That is mainly related to the systolic BP of expiratory phase minus systolic BP during inspiration, more than 10. Pulsus by Gemini is digoxin toxicity. That means ki there will be every alternate pulse will be due to premature ventricle contractions. So this is due to digoxin effect. Parvus attardus means ki it is a low amplitude pulse and late peak. So all of you must have got this correct. So this is seen in AS. So answer here will be pulsus alternans. Pulsus alternans. How Frank-Starling law? Frank-Starling law means ki when the left ventricle failure is there, more retention of the blood will be there, and because of the more retention, the stretching increase and contractility increase, and then in the next cycle, the blood will be less in the ventricle, less stretching, less contractility. So alternatively, the pulse will be changing. So if BIS variance was the option also, so BIS variance is seen in cases of severe AR. That is a 2 peak in systole. So that does not exactly represent the Frank-Starling law. Okay, so BIS variance was also there in the option, so that will be seen in AR, not in left ventricle failure. So it is alternance only. The answer to this question will be alternance. So all of you must be agreeing on this ki the question was same. Which type of the pulse represent the Frank-Starling law? Why not BIS variance? BIS variance is a 2 peak in the systole. So that is not utilizing the Frank-Starling law. Okay, now coming to the next question. So let's recall back the options here. So the question which I got is diagnosis of a lupus nephritis with wire loop lesions. So wire loop lesions were mentioned here. So that means ki it is most likely a grade 4 lupus nephritis, proliferative glomerulonephritis. Okay, what about pulsus parvus? Parvus attardus is a low amplitude. It is a low amplitude. All right. So the question was lupus nephritis. Lupus nephritis, wire loop lesions. So what will be the treatment? What will be the treatment? So the options were steroids alone, cyclophosphamide with steroid, rituximab, and D option you are saying ki there was mycophenolate. Mycophenolate. All right. Was this only option or it was with steroids? So the age of the girl was 14 years old, female. Okay, and creatinine was high. So, all right, creatinine was high. Alone. Okay, mycophenolate was alone given. So it is a direct line from the Harrison, which says that when patient has grade 4 lupus nephritis, grade 3 or grade 4 lupus nephritis, so the treatment should be consisting of combination agents. So INICET, they directly pick the lines from Harrison. So it is a combination which should be used, and out of all the agent, the combination choice is B option only. B option only. Okay, nephrotic range proteinuria or nephritic syndrome. So a patient might be having a nephritis, so it will be a nephritic syndrome. It will be a nephrotic syndrome. Even if it is a nephrotic range proteinuria, answer remain the same. Nephrotic syndrome. Okay. So answer will remain the same. Answer will be same. Mycophenolate with cyclophosphamide. No. Steroid with cyclophosphamide or steroid with mycophenolate. That will be the correct combination. Combining cyclo with myco is not recommended. It is not recommended. All right. So this is the initial treatment. Initial treatment. Nephrotic syndrome, if it was mentioned, even then the answer remains same. Okay, now try to recall this question number 3. This is from the GIT. If this was the question asked, yes, initial agent will be combination agent if it is grade 4. Grade 4. Only induction agent was asked, combination. Okay, now coming to the question number 3. Yes, all of you move to question number 3. So question is cause of hyponatremia and diarrhea. Was this the question? Was this the question in your exam? Cause of hyponatremia in diarrhea. Yes, this was the question. This was the question. So what was the options? So options were decrease aldosterone. Okay. B option, less absorption of sodium from the GIT, decrease absorption. Okay. Long standing diarrhea, increase ADH. So C option was increase ADH. Okay. So this was severe diarrhea. All right. Severe diarrhea. Increase ADH, that is vasopressin in antidiuretic hormone, less reabsorption from the kidney in a hypovolemic state. Okay. Increase aldosterone was there, not decrease aldosterone. So let me check for the correct answer. Gut not able to absorb, increase ADH. Option was related to ADH action in the descending limb. Decrease absorption from the gut, from kidney, increase ADH. All right. Loss from gut. Okay, D option was loss from the gut. Loss from the gut. Decrease absorption from gut, decrease absorption from the kidney. If there is a decrease absorption from the kidney, then aldosterone, usually in a hypovolemic state, aldosterone is secondarily high. So that should not be the answer. Decrease sodium absorption from the gut. So gut not able to absorb. Decrease aldosterone, no. So if there is a diarrhea, there is a hypovolemia. There is a hypovolemia, and hypovolemia trigger a secondary increase of hyperaldosteronism. Secondary aldosterone will increase. So that will try to absorb the sodium from the kidney. That will try to absorb sodium from the kidney. So no loss from the gut. There was increase and decrease of decrease aldosterone, decrease absorption from kidney? No. So hypovolemic state was given. Hypovolemic state was given. Cause of hyponatremia in hypovolemia. So can I got the correct response? What is the cause of hyponatremia in diarrhea? Loss from the gut and decrease absorption in the same option. Okay. Loss from the gut and decrease sodium absorption. Decrease absorption or decrease of aldosterone. So it means that option of low aldosterone will not be there, because in the hypovolemia aldosterone increase, and if the aldosterone increase, there will be a compensatory increase in absorption of sodium from the kidney. So that option is also wrong. Yes, this option will be also wrong. ADH is compensatory. So the best answer will be loss of sodium from the gut and decreased sodium absorption from the gut. That seems to be the best answer. So that will be responsible for hyponatremia. Okay. Why there is hyponatremia is there? Yeah, hyponatremia will be due to the secretion of electrolytes due to bacterial toxins, as well as decreased absorption from the gut. So that will be the best response. So decreased absorption from kidney, increase urinary sodium loss will be there if the kidneys are defective. Okay, why there is hyponatremia? Due to diarrhea, which is causing hypovolemia. Okay, so the answer remain the same. Answer will be loss from the gut, sodium loss from the gut, as well as decreased sodium absorption. Will ADH not increase? ADH will increase, but that will not be sufficient to cause hyponatremia. Yes, ADH will be increased, but that will be appropriate increase in the ADH. There are two terms: syndrome of inappropriate ADH, and one is appropriate increase in ADH. It is SIDH which causes hyponatremia, not the appropriate increase in the ADH. Now you got this fundamental clear. All right. So we move to the next question. Yes, next question is, so tell me, was that the question in your exam? Type 2 diabetes was written. Hypertension patient was there with heart failure symptoms. So can anyone tell me what was the heart failure symptoms given, or was the question just like heart failure symptoms? Okay, so LVH, hypertrophy, patient with shortness of breath, bilateral raise. Okay, so heart failure symptoms was dyspnea was given to you. Yes, dyspnea, and crepitations were given in the option. Correct. This is a heart failure symptom. So pedal edema was there. Okay, pedal edema was present. Pedal edema and heart ejection fraction, all of you saying it is 60%. So that is correct recall. Ejection fraction was 60%. All right. Nocturnal cough was also there on BNP 900. Okay. BNP 900 is given, which is increased, and diastolic grade 2. I think it should be diastolic dysfunction. Orthopnea was mentioned. Okay. Orthopnea, typical symptoms of heart failure. Correct. JVP is raised and non-pulsate JVP is raised. Orthopnea was there in the question. Yes, orthopnea I have written. Normal systolic pressure but low diastolic pressure in the question. Okay, so you want to say that the BP was normal. Systolic functions were okay. All right. Diastolic function. 3 months history of edema. So this is a 3 months history. All right. PND was there. All right. PND is a specific symptom of heart failure. Concentric LVH. LVH is present. Concentric. This is due to hypertension. LA enlargement with LVH was there. Ivabradine was in the option, stating it can cause bradycardia. Yes, ivabradine is in the option. Was another option. Okay, D was coronary angiography. Okay, diastolic dysfunction was mentioned. LVH will cause diastolic dysfunction. Yes, diastolic dysfunction. Okay. So was these the options here? So this is a case of a preserved. The diagnosis is heart failure with preserved ejection fraction. That was the diagnosis. So for the preserved ejection fraction, treat the underlying cause, and also the drug which will be helpful for a preserved ejection fraction will be SGLT2 inhibitors. So you should give a patient a loop diuretic to take care of the edema symptoms, and SGLT inhibitor is the first drug which is approved for heart failure with preserved ejection fraction. Coronary angio to check the ischemic dysfunction. So before that we can give the medicine. Why it is not ivabradine? Ivabradine will be given if beta blocker are already there in a maximum doses. So if beta blocker are in the maximum doses and heart rate is more than 70, then we give ivabradine. Otherwise it is not the first line drug. So to increase the diastolic functions, no. Why not ivabradine? Ivabradine indication is in heart failure with reduced ejection fraction, patient on maximum beta blocker therapy, and NYHA 2 to 3 NYHA, and heart rate is more than 70. All the criteria should be fulfilled. So the answer will be he was already on multiple medicines. So which medicines patient was taking? So you can put that in the option here. Is one or to reduce the heart rate and increase the diastolic feeling? No, it is not approved for preserved ejection fraction. Ivabradine, that is for reduced ejection fraction. For preserved ejection fraction, it is SGLT inhibitor. And diabetes is also there. So SGLT inhibitor will be helpful here. Yes. Okay, so now come to next question. So the next question is, so I think all the options are correctly recalled. Okay, was mentioned. This is easy one. First option was written as loop and SGLT for preserved ejection fraction. Yes, that is the correct answer. Okay, why not angiography? Angiography, before the angiography, you should be controlling the heart failure features. So the best option will be A option. Yes, we have already written pedal edema. Now come to this question. So answer for this question number 4 is loop diuretic with SGLT inhibitors. Now come to question number 5. Was question number 5 case of penicillin resistant gonorrhea was given to you, and the treatment was asked for penicillin resistant. So again, this is the direct question or direct lines from your Harrison, infectious part of the Harrison. Okay, tetracycline was other option. Okay, I will put the option A option, B option ceftriaxone, C option tetracycline. Okay, vancomycin was the option, amoxicillin. Okay, D option was amoxicillin. So meropenem was also given. Meropenem. Okay, so the answer to this question is first line will be ceftriaxone. So it will be ceftriaxone. All right. Now coming to the next one. Next is so you try to give me the correct recall. Correct recall was this question is procalcitonin. Okay, so was the question same procalcitonin role in ventilator associated pneumonia or ICU associated pneumonia? ICU was there. Okay, so meropenem was different. So I will remove meropenem was not here. So this is out. All right. Was the question procalcitonin role in web or what it is their community acquired pneumonia? Yes. Differentiate bacteria from fungus. Okay. From fungal. Bacteria from fungal. Okay, I have written this. Bacteria from fungal. ICU patient on ventilator. Okay. So this was pneumonia ICU patient on ventilator. Culture was sent. Okay, culture was sent. WEP is a provisional diagnosis. Empirical antibiotic start and resident told to do what for? Okay, same question. It was the same question. So, what is your answer to this question? Was it a multiple correct answers? Multiple correct or single best? Okay, web was there. So those who have marked it duration of the antibiotic to decide duration of the antibiotic to decide empirical antibiotic, differentiate bacteria from fungus, diagnose web. So it was a single best answer. So if it was a single best answer, then the correct response here is to decide the duration of the antibiotic. That will be more than deciding the bacterial from non-bacterial causes. So the best answer is duration. Single choice, it is a duration. Single best. Yes. So answer will be A option here. Again, exact lines are taken. They have made the exam from Harrison. Exact lines are there in the Harrison. Page number 1012 of Harrison. They have taken. All right. Now, I think this is a pharma question. So this pharma question is patient is carbamazepine, taking carbamazepine, 1000 milligram of erythromycin after 2 days develop ataxia and imbalance. Why it is due to? Yes. So it is because of the erythromycin, it inhibit the enzyme for carbamazepine. So carbamazepine is the cause here, carbamazepine toxicity. Ataxia imbalance, carbamazepine toxicity. One option was there, know the response to the antibiotic. So response to the antibiotic will be through culture, okay, whether bacteria is sensitive to that or not sensitive. So response will not be there. It is the duration of the antibiotic therapy which will be decided with procalcitonin toxicity. Okay, patient was 2 years of seizure. Okay, relapse of epilepsy. Okay. 8-year-old girl. Yes, this is exact PYQ. This is a pharma question, so we will go to the next question. Question number 8. So question number 8 is patient develops sudden onset of headache. Anyone wants to give any input for question number 8? Patient develops sudden onset of headache, vomiting, on examination, neck stiffness, Brudzinski sign is positive. Imaging shows hydrocephalus but no hemorrhage. What is the likely disease? What is the likely disease? So was that the question? And the options were NPH. Normal pressure, hydrocephalus, viral encephalitis, bacterial meningitis, or subarachnoid hemorrhage. So the answer here will be NPH is the normal pressure, hydrocephalus. Single best answer. Okay. No hemorrhage on CT. All right, no hemorrhage on CT. Photophobia, exact same question. So this is photophobia. All right. CT scan shows hydrocephalus. All right. So the answer here will be correct answer will be bacterial meningitis. The reason is in NPH, other features should have been given like gait disturbance or bladder disturbance. So these should be given in the question. And in NPH, there is no neck stiffness. It is not matching. Viral encephalitis usually presents with a seizure and stiffness. Neck stiffness is mild here, and hydrocephalus is not present. Hydrocephalus is not present. SAH, hemorrhage should be positive. Hemorrhage should be positive, and worst headache of the life should be given here. So the answer here will be the SAH. Yes, it will be SAH. No mention. So why it can't be viral encephalitis? Viral encephalitis does not present with hydrocephalus or such neck stiffness. They present mainly with seizure, altered sensorium sort of symptom will be there. All right, no problem. If there is no fever, that does not as such rule out meningitis. Okay, so the answer is bacterial meningitis. Now moving on to the next one. So let me see who will give me the correct answer for this question. Gate imbalance was there. So if a gate imbalance is there, why hydrocephalus in bacterial meningitis? Hydrocephalus will be there because of the obstruction to the CSF due to high exudates. So that can cause. Okay. No hemorrhage, acute disseminating encephalomyelitis. Okay, no history of fever nahi tha. Okay, no problem if there was no fever. The murmur of mitral stenosis correspond to which wave of the ECG? So can anyone tell me what will be the exact question for this murmur of MS correspond to which wave of ECG? Was that the question? Was that the question, exact question, or was there something else? T wave, ST segment. T wave, ST segment. Okay. No, my question is whether this is the correct statement. Murmur of the MS correspond to which wave of ECG, or was the question key the murmur of MS increase in which phase? Murmur of MS increase in which ways? Okay, so if it was the murmur of MS, so murmur of the MS is a diastolic murmur. So this is the murmur of MS. This is a mid diastolic murmur, MDM. So where will it correspond to? Yes. Exact question was when it increase. When it increase, the answer will be different then. So this is S1. S1 just before the S1 you will get QRS complex, because mechanical contraction will be after the electrical event, and the T wave finishes at S2. T wave finishes at S2, and then this will be P wave here. Somewhere here will be the P wave. After the P wave, atrial contraction will be there, and then QRS complex. So you can see where exactly will be the murmur of the MS will be coming. So murmur of the MS will be corresponding to on this line. This is QRS complex. This is ST segment. This is T wave, and this is P wave. Most likely the answer will be P wave, which represent the atrial contraction. Corresponding was asked. So it was the same question. So P wave will be the answer. P wave will be the answer. Yes. Because it cannot be the QRS complex. It can't be the ST segment, because ST segment and T wave they will be between S1 and S2. They will be between S1 and S2. Yes. Yes, it will be P wave. It will be P wave. Correspond. All right. So these were the questions from my side, which I'm able to gather from the students. So if there is any further question, you can put in the comment section of this recall session. So all the very best for your exam result.
Hi, good evening everyone. Good evening, good evening. Am I audible? Am I visible? All right. So I welcome you to the immediate recall session. Of course, we'll have a formal recall session later on. And yes, I am here for a very short discussion. So far, I have got two questions. One is a pure anesthesia question. Another is anesthesia, or you can say the procedure in anesthesia and neurology. Am I not audible? Am I not audible? Okay, so thanks. Baclofen is the fourth option. Am I audible and visible? Just give me a thumbs up. Can't hear anything. But from my end, everything is perfect. From my end, just a second. Yeah, from my end, everything is perfect. Showing perfect. Audible? Okay. Right. So one question which was pure anesthesia and it is somewhat expected, but what is not expected was the option. So we have discussed this a lot that Sugamadex is something that they are going to ask because it recently got approval in India. But they asked the question on vecuronium, or I think this was rocuronium, either of the two. When someone said rocuronium, someone said vecuronium, but the question was which of the following is used for reversal of vecuronium or rocuronium blockade in cardiac patient. The options were atropine, dandrolin, neostigmine, baclofen. Now, technically, dandrolin and baclofen, they are both skeletal muscle relaxants, so they are out. Neostigmine is a cholinesterase inhibitor that will reverse the effect of NDMR. So yes, this can be right. And because it is a cholinesterase inhibitor, and therefore it is very commonly used along with the anticholinergic to decrease the muscarinic side effects. So atropine per se would be wrong because atropine is not used in reversal, but it is used to prevent the muscarinic side effects. Okay, yes, everybody was searching Sugamadex. In fact, when I got the question, even I thought it would be Sugamadex. So yeah, so everybody is saying vecuronium. So vecuronium, rocuronium, whatever. So the correct answer to this is neostigmine. Second question is not entirely an anesthesia question. The question was somewhat related to postdural puncture headache. And which of the following is true about postdural puncture headache except, so more commonly seen in elderly and females, lumbar puncture must be done in suspected SAH subarachnoid hemorrhage even if NCCT is normal. Meningitis after lumbar puncture is an unusual complication. Lumbar puncture contraindicated in thrombocytopenia that is less than 10,000. And we have to find the false option. So we know the risk factors of postdural puncture headache, that it is very common in young and it is common in female. So this female part is true, but this elderly part is wrong. So this looks like a false statement. But let's look at other option. Lumbar puncture must be done in suspected SAH even if NCCT is normal. In fact, if your non-contrast CT is normal, that means there is no evidence of a subarachnoid hemorrhage on your CT scan, but the patient shows the signs and symptoms of SAH like cluster headache or a thunderclap headache, then the best way to rule out whether there was a subarachnoid hemorrhage would be to do lumbar puncture, and you will find the color and the cells in the CSF that would tell you that there is a subarachnoid hemorrhage. So this is true. This is true. Meningitis after lumbar puncture is an unusual complication because we perform lumbar puncture under all aseptic precautions. So it's a really unusual complication, very thin needle, and you are using sterile technique. Okay. Lumbar puncture is contraindicated in thrombocytopenia less than 10,000. Question was LP can be safely done in thrombocytopenia. Last option was lumbar puncture is safely done in thrombocytopenia. Acha, okay. So lumbar puncture is safe in thrombocytopenia when platelet count is more than 10,000. Yes. This is also then true. This is also then true. elderly was not mentioned, then what was mentioned? Because I got 2 people telling me that elderly was mentioned. Elderly was mentioned. Anyway, we'll keep this question for neurology as well, because except the first option, I think it would be better for the neurology team to comment on it. I just wanted to tell you that in risk factors for postdural puncture headache, it is seen in young and it is seen in females. Okay. Okay. Can you recall any more questions in anesthesia? Can you recall any more questions in anesthesia? Obese and female. Okay. If it is obese and female, then yes, it is common in obese and female. Okay, so let's keep this for neurology. Then there is some confusion. I will discuss with them because some people are saying elderly was mentioned, somebody is saying obesity is mentioned. So let's wait for few more people. Okay. Any other option that you can recall in anesthesia? Any other question? Thiopentone. What question was on thiopentone? Can you recall the thiopentone question? Yeah, we have discussed the reversal question. Yeah, you are writing thiopentone question, but can you recall what is the thiopentone question? Am I audible? Am I visible?
All right. Am I audible and visible? All right. Okay. Hi. So I hope you have done well today in CT बज रही है घर में मेरे. So I hope we have done well the questions today. And let us see, Opthal, I got 9 questions till now in my group. Some are controversials, some need some options from you. Let us see the first option. Just give me a while. Huh? All right. Am I audible now? हाँ, दाल बंद करवा के आया हूँ, पता नहीं दाल था क्या था, उसी टाइम सीटी पे जानी है इनको. Okay, I hope you have done well questions. There are 9 questions which have been told in my group. Some are controversial. Let us see the first one. Now, what is the controversy which I am getting over here is, there was no controversy in that patient presents after 2 weeks. Everyone was saying that 2 weeks. decreased vision था, hazy vitreous, and see 2 weeks so toxic anter-segment syndrome is ruled out. Symptomatic ophthalmia is nothing to do here. So I want you to ask whether Staphylococcus species was given or only Staphylococcus was given. That is the one. That's the only controversy over here. So tell me. Staphylococcus, any species or only Staphylococcus? Only staph. Pranjal, Anushka, only staph. So answer is only staph. That is the answer over here. Because Propionibacterium does not come 2 weeks. It is a late complication. It comes after 1 month. So only staph, and there is no controversy. That should be the answer of this question. Very good. Okay. Second question. Yeah. Okay. So I've got the first one. I don't think so there is a problem in that. The second question, there is no problem at all. Advanced cases of diabetes mellitus, cause of retinal detachment is no doubt fractional detachment. There should be no doubt in that. I hope everyone has got this correct as well. Now, test to visualize all the layers of the retina in vivo. In vivo is mentioned or not doesn't matter at all, because the only investigation of these to tell about the layers is OCT. My question from my personal is whether in the exam OCT word was given or optical coherence tomography was given. I want to know personally, because in the real exam they should not ask you short forms, they should give you the complete. So please tell me this. From my answer is yeah, OCT. Was OCT given or optical coherence tomography was given? Yeah, full word, no? It has to be full word. There should not be any short forms, particularly in exams of this caliber. Alright, good. Okay, now there is a doubt in this question. First, I want you to ask whether the first statement, this was there, that an optic neuritis, which is true. Was this the question? Because this question, first option is true, and that everyone has told. So there is no doubt in the first. Yeah, XYZ is staph aureus mentioned, then better answer should be Propionibacterium, but 2 weeks is very rare. I think only staph was given. That should be the best answer. Okay, so oral steroid preferred initially, was this? I don't know whether some told yes, some told I don't know. And this one also is a query, whether it's there or not. And the fourth option is, I think, correct option. Color vision and cross. Many have told this properly. Okay, so I'm going with this in optic neuritis, which is true. So this was given. Okay. अरे हो गया ना वो species वाला हो गया. अब इस पे आ जाओ जरा. First option, no doubt in this. First option is true option. Second is oral steroid preferred initially. Was this option there? Exact question. Bhavdendra Balu is saying exact question. In options only C was there. Okay, fine. In options only C was also there. ठीक है. Antibiotic with steroid, ruling out technique by Sumer sir has helped. अरे तुम मेरे पे आ जाओ ना पहले तुम. हाँ, can have optic nerve and disc edema. Okay. Can have optic disc and disc edema normal. Okay, fine. Okay. But that is only for demyelination, and that can be in demyelination, not all optic neuritis. Okay, fine. Siddharth is saying steroid is the most appropriate treatment option, but which steroid, oral or IV, was there? AC, BC, ABC, गाली दे रहे हो क्या मुझे? क्या दे रहे हो? क्या बोल रहे हो? अच्छा ऑप्शन बता रहे हो क्या? AC, फिर क्या था, फिर BC, फिर AB, ACD और ओनली C. अरे 5 थोड़ा ऑप्शन आ जाएंगे तुम्हें यार, कुछ भी तुम बोलते रहते हो. एक तो निकाल देता हूँ मैं, गालियाँ निकाल देता हूँ. चलो. Yeah, okay, fine. Gautam, I've got this. It can present with novel optic nerve and optic disc edema. That is okay. ABD भी था ऑप्शन में. हाँ ठीक है, सारे ABD था, AC सब 4-10 एग्जाम देकर आए हो अलग अलग. ठीक है, तो oral was there. ठीक है, तो I'm getting this question I have to reframe by asking. So I've got many things. Okay, fine. I'm going to the next. See, A option is correct. 70% of multiple sclerosis is present. D option is correct. So A, D is correct out of this. Rest I have to see in various. I have to ask many students for this. Okay, now this is a recall session, so I want you to correctly tell me first whether any type of amblyopia was given, yes or no first. I'll ask 2-3 questions and that will give the answer appropriately. All are effective treatment of amblyopia, only amblyopia, or any strabismic and isometropic was given? No, good. So this, and second question is, was refractive error correction in the option or refraction was there in the question? That is my second question. Because patching, this was there, patching and videogams were there in the option. Refractive error correction or refraction? Refractive error correction was there. Okay. Refractive error correction. Everyone is saying refractive error correction. Exact question. ठीक है, मैं तो बड़ा अच्छा इंसान हूँ फिर तो. मैंने तो फ्रेम किया था. Third question. Strabismic surgery was there or only surgery was there? See, if refractive error correction then has to be done, because only after that we proceed further. Patching has to be done and videogams has to be done. So surgery, strabismic surgery was given or only surgery was there? Whatever, I think that is the answer over here. Answer should be strabismic surgery. ठीक है फिर, तो वही आंसर होगा फिर. That's the best answer over here. That's the best answer then. Okay, एक ने बोला सर मैंने तो वीडियो को देखा और मैं तो आगे निकल गया दूसरे में. नहीं, मैंने हा किया और फिर मैं आगे निकल गया कि ऐसा कैसे क्वेश्चन आ गया. मैंने कल बोला था अपने ग्रुप में कि INI एग्जाम में आप क्वेश्चंस देख के करो. कई बार कॉमन सेंस से भी एग्जाम के माइंड से मत खेलो, खेला हो जाएगा. और खेला हो गया, वीडियो गेम्स करते हैं आजकल. कभी ऐसा एग्जाम में आया ना तो थोड़ा दिमाग लगाना चाहिए कि ऐसा क्यों दिया उन्होंने, कुछ सोच के दिया होगा. कॉर्नियल ट्रांसप्लांट, स्टोरेज मीडियन एंड सूचर्स, इसमें तो आई थिंक ऑप्शंस, दिस इज द आंसर. मैकेरी कॉफमैन. ऑप्टिसॉल इज एन ऑप्शन बट सिल्क, ये जो है दिस वाज अ सिमिलर इमेज. एंड नायलॉन इज यूज्ड. Nylon is used but not polyethylene glycol is not the medium. Optisol is the medium but silk is not used. Moist chamber is the medium but Vicryl is not used. So answer is McCarry Kaufman. Now how video games, हाँ तो अगर देखो, अगर एज लिखा होता तो वीडियो गेम्स आप 2 साल के बच्चे को तो वीडियो गेम नहीं खिला सकते ना. वो आपको खिलाता है, वो आप उससे खेलते हो बट वो आपको खिलाता है. तो एज नहीं दिया हुआ था तो वीडियो गेम्स आजकल स्ट्रैबिस्मिक स्टिमुलेटर्स होते हैं which can be done to increase the strength of the lazy eye. हाँ तो एक्सप्लेनेशन तो दिया चिको. अभी तो क्या नाम है तुम्हारा, चिको एक्सप्लेनेशन तो कल आपको मिलेगा. अभी तो सर मैं रिकॉल कर रहा हूँ कि क्वेश्चन सही भी है या नहीं, और एक्सप्लेनेशन दे भी दिया मैंने. स्ट्रैबिस्मिक स्टिमुलेटर्स होते हैं, देयर आर वीडियो गेम्स ओनली. नेक्स्ट, definition of blindness as per the National Program of Control of Blindness या WHO. I have been asking many times this in my group. I have not got anyone who is saying WHO. Everyone is saying India, either India word everyone is saying or National Program is saying. One option is best corrected, other is uncorrected. First, it should be 3/60. That is, everyone should know. The best answer, and I think if they've asked the question in INI, they should ask this one, presenting visual acuity, because that is the answer. That when the patient has visual acuity less than 3/60 in the better eye with available correction, available mean जैसे patient present करता है, that is the presenting vision, that is in India. That was the answer over here. With available correction means, चिको explanation अगर चाहिए, available means if the patient comes with spectacles, you take vision with spectacle. If you come without spectacle, naked eye vision. That's why uncorrected cannot be the answer, because if the patient brings spectacles, you will give them spectacles and take the vision. That's why uncorrected should not be the answer. Presenting should be the answer. Best is for WHO. तो इंडिया वाले कहते हैं हम तो नहीं देंगे चश्मा, हम नहीं देंगे, पेशेंट लेकर आया तो हम चश्मे से चेक कर लेंगे. तो uncorrected cannot be the answer. Answer has to be presenting vision. But Gautam Kumara Krishnan is saying, I don't think presenting vision was an option. It was best corrected. Best corrected vision तो हो गया ना गौतम. Presenting vision, people have told me. So presenting, अब देखो, अब लोग कह रहे हो कि प्रेजेंटिंग वाज नॉट एन ऑप्शन, मैं क्या करूं इसमें? वो अब कहीं कह रहे हैं कि WHO है, अब पता नहीं अलग अलग एग्जाम दे के आते हो उसमें मेरे को फंसाते हो, तो मैं क्या करूं इसमें? अब इंडिया वाज देयर, 90% पीपल आर सेइंग इंडिया, बेस्ट करेक्टेड आंसर नहीं हो सकता, अनकरेक्टेड बिल्कुल नहीं हो सकता, प्रेजेंटिंग या कुछ और वर्ड होगा, टेल मी द वर्ड इन माय ग्रुप, आई विल थिंक अबाउट दैट, अदरवाइज स्टिल नाउ द प्रेजेंटिंग शुड बी द आंसर ओवर हियर. ठीक है, 9 क्वेश्चन है, 2 मोर क्वेश्चंस. आई थिंक दिस वाज द इमेज गिवन, some have given अलग अलग इमेज बना के उन्होंने भेजी मुझे, पर तीसरी इमेज उन्होंने गलत कर दी. So even this question could have been solved by the first image. In the first image there is no squint. Third palsy cannot be the answer because third palsy has down and out eye. Myasthenia gravis I don't know was there or not because myasthenia gravis will not have nystagmus. Horizontal gaze palsy means either PPRF lesions, pontine pyramidal reticular formation, or 6-nerve palsy, which will have a squint in the baseline. So INO has a baseline, there is a MLF lesion, this question is right MLF, there is a nystagmus or an abduction nystagmus, and that is the best answer over here and the only answer over here. Left LR palsy, Bhava, Deni, Balu, in baseline, why will the eye be straight in left LR palsy? Achha, are you saying that one option was LR palsy? Myasthenia was not there. बताओ 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 बताओ, फट 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 बताओ. Good Vaishnavi. Thyroid eye disease. Thyroid eye disease was. Thyroid eye disease. Thyroid eye disease में तो फिर nystagmus वगैरह is not there ना. That is LR palsy was there. Myasthenia was not there. Okay, fine. Myasthenia was not there. Either thyroid eye or lateral rectus palsy was there. Image is wrong. Answer is INO, but image is wrong. Image, so फिर INO की तो अब बना के दोगे मुझे. You have to send me the image. But whatever, INO should be the answer because there is no squint and INO in the baseline. Last question till the other faculty comes. Acute hemorrhagic conjunctivitis caused by PACE, factual, picorna virus. Acha, one was I think polio virus, na? Polio virus was there. Polio virus does not cause, picorna cause. Adenovirus, some say adenovirus was in the option. Adenovirus, Coxsackie A causes generally, and enterovirus is the most common cause. So enterovirus cause, Coxsackie A cause. So most probably answer is B and D. But tell me, अभी तुम उसी क्वेश्चन में लटके पड़े हो. Herleaf or horizontal gaze palsy is the answer. Horizontal gaze palsy may, in the baseline position, eye will be like this. कैसे आंसर हो सकता है वो? ठीक है. I think this is a factual one. Only D was also there. Okay, fine. I will check that. Only D was also there. B, C, D option was also there. B, C, D was also there. But answer is B and D. तो जिसको इस क्वेश्चन में डाउट है ना, so make an image and send me. Make image, the 3 images, and send to my Telegram or personally or in my Telegram group. ठीक है? I think that, and this is my Telegram group. हाँ, ये वाला Telegram group है. ये लो, यहाँ पे बहुत सारी बातें चलती रहती हैं. I think that will be all from my side. This is a group. यहाँ पे आप मुझे भेजो. Send me the images. By making your images, then I will tell you whether the image is correct or not. ठीक है? चलो, that is from my side. I think I've got 9 questions till now. I think 7 questions should have been got correct. One was a doubtful, that amblyopia one. Otherwise 6 to 7 should be okay. 7 is a good answer. 7 is a good question. But we'll come to you tomorrow with all the options and the answers. Thanks very much, and let the other faculty come and the other subject come. Best wishes.
Hi dear students, Good evening, and yes, I have recalled a few questions. And hi, I'm Dr. Sanjeev Chitragar, your pathology faculty. So let's try to recall more questions here. Okay? So I've already got few questions, and please correct me if my options are fully correct or not. Yes. So let us look at questions from pathology now. So I'm sure there were more questions asked from pathology. Acha, so pehla question, let me try to, yes. So this was a question. Patient on renal transplantation present with respiratory discomfort. Which of the following stain is not used? Ye question tha na? Please confirm this question. Which of the following is not used for demonstrating fungi on histology? या ऐसे कुछ question था. अच्छा, CD4 count low था. Okay. Respiratory discomfort, low CD4 count. ठीक है. Then anything else was there in this? Yes, low CD4 count was there. Yeah, all options were correct. Lung biopsy was given. Acha, was biopsy given? Please tell me. Histology image was given or not? Yes, image was given. Lung biopsy post renal transplant. ठीक है, image was given. Acha, used. Okay, aspergillus का image. Okay, thank you guys. Thank you then. ओके बताओ क्या आंसर होगा. आपने क्या आंसर लिखा? एंड आई होप ऑल ऑफ यू वेयर दिस इज नॉट यूज्ड था ना, वो भी एक बार कंफर्म कर लेना प्लीज गाइस. प्लीज कंफर्म नॉट यूज्ड. दिस वाज द करेक्ट वर्ड, नॉट यूज्ड और यूज्ड. देखो दोनों में ना आंसर चेंज हो जाएगा. ओके यस, नॉट यूज्ड वाज द क्वेश्चन. Okay, there was aspergillus. Okay, GMS was given instead of methenamine silver. Okay, GMS is the same actually. Methenamine silver ka short form Gomori methenamine silver. Okay, let me write full name for you guys. GOMORI. Gomori methenamine silver. GMS. Not used was question asked. Okay, good. So ye hai not used, right? So GMS. This was the question. Yes, very good. Okay, not used. HPV given and not used was there. Okay. So answer, क्या आंसर लिखा आप लोगों ने? Okay. So remember one thing, we can use silver impregnation technique. अगर मैंने okay, in my TND also had this question. Which of the following are silver stain? Silver stain, Mason Fontana is also a silver stain. And being a silver stain, I can be using this also for so this is also silver stain. I can be using this for fungus, although the best will be what? Methenamine silver or just called silver stain. Okay. And so the best answer pass, of course we use. See, A and C pakka use karte hi karte hum log. In this best answer, if it is used, answer would have been option A. But the worst one, which is not used at all, will be Congo red. That will be the correct answer in this case. So correct answer आपका होगा Congo red in this. Okay. Yeah, I'll do quickly. And please, yes, जल्दी बता रहा हूँ, don't worry. अच्छा, question number 2. इसका ना मुझे थोड़ा सा recall अच्छे से चाहिए मुझे. I want just you guys try to recall correctly in this. What was the question asked in this? Okay, child presented with fever. Okay, fever था, पेटिके परप्यूरा था. Prolonged duration, कितना duration दिया था इसमें? A child, age of the child was given or anything was given, how long it was, or petechiae purpurae, how many of them, multiple petechiae purpurae या something else was given. Yes, in this I want to know how many petechiae purpurae were given, or ecchymosis was given, and platelet count 10,000 दिया था ना. Yes, okay, and bone marrow aspirate showed megakaryocytes, right? This was given. Yeah, yes, exactly यही था. And which of the following is likely treatment? Please correct me if I am wrong with the option. Aspirin था, aspirin, fever not given. 10-year-old child. Okay, 10-year-old child. ठीक है. और कुछ? Okay, bone marrow aspirate shows slight increase in megakaryocyte. Okay, yes. Bone marrow aspirate shows slight increase in megakaryocyte. Okay. Options में देखो मैं yes, aspirin was there. Aspirin anyway is contraindicated, isn't it? अच्छा, fever होता भी aspirin would be contraindicated. Patient को ITP है, we better give paracetamol, do not give aspirin because aspirin is antiplatelet, right? अच्छा, then rest of the option I want to look. IVIG, methotrexate, bone marrow transplant, wait and watch था क्या? Anywhere wait and watch was in the option or no? I want to just look at that. Wait and watch was there. Initial best treatment. Okay. Fever not there. Wait and watch. Not likely treatment. Okay, question was likely treatment or not likely treatment? What was that? Okay, there was no wait and watch. Okay, ठीक है. So question was initial treatment or not likely initial treatment? What was the question? Okay, in this, okay, no wait and watch was there. Okay, that's fine then. So if there was no wait and watch, and if they had asked what is a likely treatment, then answer I would go with IVIG in this case. Okay, although acute ITP अगर है IVIG, I would preferably do wait and watch. That would be my first choice. If it was acute IVIG, I still do not know whether is it acute IVIG or acute ITP or not in this case. Yes, so my initial treatment will be in this case IVIG. Okay, otherwise my treatment would have been wait and watch, and then of course steroid. Actually steroid option में था क्या? I just want to know if steroid was in the option, because if steroid was there, that should be first choice. If steroid was there, that should be first choice. Bone marrow transplantation, definitely not. Methotrexate, definitely not. Was steroids there? Prednisone, Dexa, ya to steroid, any word? Okay, if it was not there, then I will go. So treatment will be simple. First will be wait and watch. Usually if there are danger signs, then we can think of giving steroids, or we can even give. Usually second line will be rituximab दे सकते हैं, which will be immunosuppressive, basically stronger immunosuppressives, and finally there can be splenectomy considered. Okay, yeah, bone marrow transplantation, definitely not the treatment of choice. Aspirin and A and D are ruled out because there is increase in megakaryocyte. There is no problem with the bone marrow, isn't it? Okay, that will be the answer then. Answer to this question, correct answer is IVIG. That is the correct answer. ठीक है? Okay, next. Was this straightforward question like this? Cancer cells consume more glucose because. Was this the question? Exact question ऐसा ही था? Please tell me. Warburg effect question basically. Yeah, answer to, okay, was this exact similar question was there? Cancer cells consume more glucose because. Was this the question? Please tell me. Yes. Cancer cell consume more. No steroids was there. Okay, yeah. So no steroids was there. Then IVIG will be the answer. Okay. Acidosis was mentioned in the question. Yeah. So increased GLUT. That will be the correct answer. Yes. Yes. Very good. So this will be increase in glucose transporter. Lactic acid preferred despite oxygen was present. Okay. One more option. So lactic acid is not preferred by the cells. Lactic acid preferred despite oxygen. No, that is not the correct answer. So question asked specifically was lactate production despite O2. Okay, that is yes, lactate was there. That is correct. That is happening. But increased glucose consumption. Yeah, mechanism of. Okay, mechanism of cancer cell. Mechanism of cancer cell consuming more glucose, right? I hope this was the exact question now. Because of answer is increase in GLUT. Yes, correct. Glucose transporter will be increased. That will be the correct answer. Okay. Yes. Please, next question. Please let us look at this question as well then. Okay, ये वाला question देख के मुझे बताओ एक बार और please. Increased GLUT2 activity. Yes, correct. Yeah. Increased oxidative phosphorylation, that would be wrong. There is no increase in oxidative phosphorylation. Acha, with oxidative phosphorylation. Okay, please now. I think question was why cancer cell need less glucose. They don't need less glucose. That will be a false question altogether. Okay, please tell me pyruvate converted to TCA nahi hai. Okay, increased. Okay, option was increased glucose to and increase in oxidative phosphorylation was also there. Increased GLUT and OP was there. Yes, was this there? Was the question like this? And oxidative phosphorylation, then this will be false. There is no increase in oxidative phosphorylation. Yes, if this was the question, if this was the option, then okay. Yes, if this was the option, then that is false. If this was the option, then that is false. Then please, okay, let me try to recollect all. Then what were the other option? Last option was along with. Okay, one option was along with oxidative phosphorylation. Any other option? This was the option, then that will be wrong. Lactate wala. What is the lactate wala? Lactate, increased lactate despite presence of oxygen, isn't it? That was there. Preferred so chhod ke. Yes, lactate is increased despite oxygen. Was this there? GLUT2 was there. I know GLUT2 was there. That is why if GLUT2 was given, increased glucose and increase in oxidative phosphorylation, that will be wrong. Yeah. So in this case, yes. So last was something about TCA cycle. What was there? Shouldn't Warburg Acha, Warburg wala kya option tha? Please tell me what is Warburg. So any other word was given? Warburg effect, just simple. Enhanced conversion of glucose to pyruvate to TCA. That is also false. Enhanced conversion of glucose to pyruvate. This doesn't happen. This doesn't happen. Pyruvate to acetyl CoA. If that was there, that will be there. Correct. Lactic acid produced even in presence of oxygen. So in this case, yeah. So that will be the correct answer then. Lactic acid is produced despite oxygen. Agar dekho, please remember, if this option oxidative phosphorylation was given, then option A becomes false. Otherwise, increased glucose to transporter GLUT was correct. Yeah, in presence of oxygen, lactate is produced. Yes, correct. Despite presence of oxygen. Yes, that is correct. Then in this case, option C becomes the correct answer. Option C becomes the best answer in this case. Agar yehi option hai to, please remember. Okay. Okay. Warburg effect. Yes. Question was about Warburg effect only. Yes, correct. So in this case. Okay. Pyruvate to acetyl conversion was also in the option. Word was used for what? No increased. So glucose. So see, glucose transporter with oxidative phosphorylation is wrong. There is no oxidative phosphorylation happening in cancer cell. That will be a wrong statement. Okay. So next question. Next question is, ये वाला मुझे बताओ. A 4-year child's mother died of breast cancer at 30 years. Her aunt also is diagnosed of breast carcinoma. Both were breast carcinoma. Yes. Was this both and anything else? Okay. BRCA, P10, P53. Okay. Two more option. BRCA 1, P10, P53 was there. Okay. Then anything else was there? History were there? Both BRCA 1 and 2 were there. Yes, correct. So BRCA 1, BRCA 2, P10. Sister is 29. Breast cancer only? No, aunt died of cancer. Okay, that's fine. So breast cancer in mother, aunt died also. Her aunt also died of cancer. That is enough for me. Died of carcinoma. Which screening has to be done? Answer is BRCA1. Why? We are suspecting one familial breast cancer in this, right? Sister को screen करवाना है. Aunt died has sister को screen करवाना है. Okay. She has a sister 10 year with one test only. Okay. So whose sister? 10-year-old. Aunt का sister, child aunt died due to breast cancer. Oh, okay. 30-year diagnosed, investigation in sister. Okay. Okay. Sorry. So, yes, 30-year-old is diagnosed. That was the question. Okay. Now I understand. Okay. Thank you. Answer will be same. 30-year diagnosed of breast cancer. Her sister, 10 years, right? Needs screening for which? gene, isn't it? This was the question. Okay. Aunt died. 30-year lady diagnosed of breast cancer. Okay. Mother had breast cancer. Mother died of breast cancer. Sorry. Okay. Yeah. So this is more than enough for me. Answer is BRCA1. The reason? Because most commonly inherited breast cancer mutation, 52% are due to BRCA1 mutation. Right? Yes. So, yeah, BRCA2 was not in the option. Okay. Some people are telling, okay, aunt breast cancer tha, she wants to be screened. If money was, only one test, BRCA1 karna hai. BRCA2 was not there. Okay, CDH was there. Okay, doesn't matter. Even BRCA2 was there also. Answer becomes what? Same. What is that? Answer will be BRCA1 only. BRCA1 only. History of breast cancer in previous generation with early death. One sister has breast lump. Other sister can afford only one genetic testing. Okay, good. Now, next, this one. Look at this. Select wrongly matched. Acha, ye confusion isliye ho raha hai shayad. So, you know, some people confuse this. Select wrongly matched. SKT11, breast cancer, BRCA2, prostate, P53, mucosal neuroma, P10, thyroid cancer. Is this correct? Recall? Is this a correct recall? Please tell me. Is this a correct recall? Yes. Can afford only one test. That's fine. BRCA answer. Okay. That was. No. So in the previous question, BRCA was the answer. Why not P10? Because most commonly familial cancer with breast carcinoma is BRCA1. Okay, both BRCA1 and 2 are in the same. Then answer will be BRCA1 and 2. Okay, so this was the question. And in this case, what is the answer then? P53, mucosal neuromas. Mucosal neuromas are commonly associated with, yes, neuromas are commonly associated with, yeah, mucosal neuromas commonly associated with RET mutation. No. SKT1 is associated with multiple cancers. Most important is, yes, Peutz-Jeghers polyp, then GI adenocarcinomas, lung cancers, ovarian, thyroid, breast. Okay. Image showed lobular carcinoma. Please tell me, in the previous one, image showed a lobular carcinoma? Yeah, RET will be associated with this one. Okay. So in the previous one, image was also given. No, in this SKT11, that is Peutz-Jeghers syndrome, is associated with many cancers, right? Okay. Peutz-Jeghers is associated with many cancers. Image showed lobular carcinoma. Okay. So which of the following is not an aneuploidy? This was a question. Please look at this. Some people are saying, yes, which of the following is not an aneuploidy? Yahi question hoga, by the way. So yes, Down syndrome, Patau syndrome, Klinefelter syndrome, Bloom syndrome. Answer, everybody I'm sure would have written it correctly. Bloom syndrome. So in this case, answer is Bloom syndrome. Bloom syndrome is a DNA repair defect, isn't it? Yes, Bloom syndrome is DNA repair defect. Homologous recombination DNA repair. And mutation kya hota hai Bloom syndrome mein? Helicase mutation, right? We studied this in the class. So yes, that is Bloom syndrome. Yeah. Next, caspase 1 is activated in. Okay, caspase dependent plus inflammation was given. Okay, very good. So caspase 1 dependent plus and yes plus inflammation. What is the answer? Yes, is seen in. Yes, please tell me now. Of course, ye to previously GT में भी आ गया ये question, right? Yeah, answer is pyroptosis. Caspase 1, caspase 11, both are activated in pyroptosis. Caspase 1 is a interleukin 1 activating enzyme. Okay. Yes. Next. In which of the following disease HLA mismatch bone marrow transplantation rejection doesn't happen? Was this a question? Okay, one more was ferroptosis. Okay. Okay, please tell me now. So answer is pyroptosis. Question number 9. Please tell me the 8. Sorry, which is this? HLA mismatch bone marrow transplant rejection doesn't happen. Was this the question? Bare lymphocyte syndrome, Shediac-Higashi syndrome, Job syndrome. Option D was Wiskott-Aldrich also. Okay. Wiskott-Aldrich. Yes. Okay. So Wiskott-Aldrich was also there. Okay. So in this, the best answer will be Bare lymphocyte syndrome. Okay? Yes. In this, the answer will be Bare lymphocyte syndrome. Theoretically, one more. Bare lymphocyte syndrome में क्या होता है? MHC will not be there. So because of that, MHC dependent recognition is not happening. Okay. Even in severe combined immunodeficiency also, it doesn't happen usually. In SCIDs also there will be, because there are no T cells available in the bone marrow of the patient, isn't it? So in this case, answer will be Bare lymphocyte syndrome. One more. I have recollected this partially. Lady with ovarian mass, and I think they had given Cole-Exner bodies. Was this there? Yes. Cole-Exner body was given in the image. And I think inhibin was asked, something like that. Yeah. Cole-Exner body image was given. And then marker was asked. What was the question on this? Because I have recollected it only partly. Marker, inhibin. That will be the correct answer. Okay, ascites was given. Okay, ovarian mass, ascites. Most likely then metastasis. Okay, gross coffee bean nuclei. Okay, gross and microscopy both were given. Omental fat, omental caking was also given. Okay. Omental caking was given. Metastasis is there. Okay. Then multiple correct. Okay. What were the multiple correct in this? Yes. Multiple correct was there, right? Yes. Okay. CA 125 is raised, usually not. Usually not. Inhibin is raised, that is correct. CA 125 usually not. Can be increased, but no, that we don't use it. Then anything else? High inhibin, that will be correct. Two questions. There were two different questions. One was related to granulosa cell tumor. Okay, ascites was a different question. Okay, Cole-Exner body. Okay, caking was a different question. Omental caking was a different question. That is fine. And yes, I think there was one more question on, please tell me, anemia of anemia due to decrease erythropoietin was there? Anemia due to decrease in erythropoietin. Was this a question? Yes, was this a question? Please tell me. Okay, so it was just okay, lady with ovarian mass. Then there was gross image and microscopic image, and sex called stromal tumor. Okay, so this was not an inhibin question. This was just asked what is the tumor. Okay, okay, okay. EPO is useful. Okay, what was the question on G6PD? Please tell me. What was the question on? Okay, which can be treated? Okay, which anemia can be treated by EPO? Which anemia is treated by EPO? What is the answer? Yeah, this will be renal failure. Okay, that is correct. What was the question on G6PD? Please tell me now. What was the question on G6PD deficiency anemia? Yeah, what was the, okay, nutritional anemia, CKD was there. CRF, okay, that is correct. Nutritional, that is wrong. Okay, okay. Please tell me now, what is the question? What was the question on, okay, one more is aplastic, that is also wrong. Okay. Yeah, please tell me now, what was the question on G6PD deficiency? Can you please recollect G6PD deficiency question? What is the question? Please recollect G6PD. And what were the questions? There were no flow cytometry, no images, no WBC question. Very less number of WBC question I am seeing. I do not know whether I have recollected less. Yeah, please tell me what was G6PD deficiency anemia question. Just a minute, guys. What was the question on G6PD deficiency anemia? I think there is some. No, in this it is going fine. Guys, what was the question on G6PD? Sorry, I missed it. There was a drop in my internet. Direct, indirect. Okay, sorry, guys. So G6PD deficiency, bilirubin level correlation. Okay. Chart was given 4 option with decreased. Okay, direct and indirect. Okay. Okay. So indirect and direct bilirubin was asked. Okay. So there will be, yes, increase in unconjugated, that is indirect bilirubin, right? Okay. What was the other question? Was there any other question on, please tell me now if there were any other questions on hematology. These were indirect and direct bilirubin was. Okay. So there was a 3 into 3 table. Okay. Okay. So there was a 3 into 3 table. Okay. So they had asked urine. They had asked about urine conjugated. Okay. Yeah, please. Was there any other question on hematology? Any other question on hematology? Was there any other question on hematology? WBC, no questions on WBC, leukemia, lymphomas, nothing? Any questions on WBC? What about myeloproliferative and EPO? No, myeloproliferative will not work. In myeloproliferative neoplasm is nothing but your CML, etc. There will be no EPO, no erythropoietin acting on that. Any questions? Any other questions on lactic acidosis, hepatomegaly? What was that question, please? Yeah, 10th question. Okay, I'm not able to fully recollect it, right? So some people are saying, okay, in J6PD, urinary bilirubin will not be because it is unconjugated, right? It is unconjugated. Unconjugated cannot go into urine. No leukemia, lymphoma. Okay, that is good. No, okay. Yeah, so urinary will be absent. In the serum, it will be indirect, isn't it? That because it is. Okay, respiratory bronchial image was given. Okay. Most common bleeding disorder. Bleeding tha ya thrombotic disorder? Okay, one more question. Most common inherited bleeding disorder. Okay. Most common inherited bleeding disorder. Was this the question? Inherited bleeding disorder will be VWF. Was this the question? Yes, inherited bleeding disorder was there or thrombotic was there? Bleeding disorder or thrombotic disorder? So in this answer will be VWF or VWD, sorry, von Willebrand disease. That will be the answer. Okay, so histopathology to identify, there was one more question, HPE. Okay. It was bleeding, then VWD will be the answer. Okay. So one more question was on histopathology, identification of, this is a repeat question by the way. Histopathology, identify, yes, bronchiole, respiratory bronchiole, etc. Okay. They mentioned glucose 6-phosphate dehydrogenase deficiency, right? G6PD is glucose 6-phosphate dehydrogenase enzyme. Okay. So VWD, hemophilia, answer is VWD. Factor 5. Factor 5 is thrombotic disorder. Okay. HP identified terminal bronchiole was there, right? Any other question which I am missing? Any other question? Then factor 5 is hemophilia is not most common है von Willebrand है. Most common severe inherited bleeding disorder will be hemophilia. Type 1 von Willebrand disease is the most common. Hemophilia most severe. Most common severe inherited bleeding disorder. Most of the inherited bleeding disorders are okay. Left atrium bronchus, respiratory bronchiole, terminal bronchiole. Okay. So they had given this options where left atrium कैसे देते हैं? I don't know what you are saying. Okay. Glucose 6-phosphate deficiency नहीं हो सकता है, phosphatase होगा. That will be your glycogen storage disorder if that is the question. There will be no glucose 6-phosphate deficiency, no glucose 6-phosphate dehydrogenase या तो phosphatase. If it was glucose 6-phosphatase, then bronchus, 1 minute. Then that will be discussed to you in biochemistry. ठीक है, terminal bronchiole, respiratory bronchiole. Okay. इसको in the next recall session I will put with the respiratory bronchiole, bronchus. Okay. Just atrium. That's what I am telling. Not left atrium. Only phosphate was mentioned, I think. Okay. नहीं. Okay. Lytic lesion in the skull, PTC follicular teratoma. This will be more radiology question, I guess. Obesity associated with which cancer? What is that question? Please tell me. Obesity associated with which cancer? One more question was there. With which cancer? Classically, अगर endometrial दिया होगा तो that will be the answer. One question, caspase not involved in which mechanism? ROS act in obesity not associated with which cancer? Gastric, pancreatic, multiple myeloma, clear cell. Okay. So obesity, please recollect this. What was the question? Obesity, yes. What were the questions asked? Not associated with meningioma, multiple myeloma, gastric and pancreatic. देखो, pancreatic is associated, gastric is associated. Then kidney is also associated. Somebody said renal. Was it multiple? Slide with multiple layers, not squamous at all. Some cilia were there. So, okay, yeah, then it will be pseudostratified. If it is multiple layer, then it will be a bronchus because it will be a pseudostratified. टर्मिनल ब्रोंकियोल में नहीं होगा ना सुडोस्ट्रैटिफाइड. नॉट एसोसिएटेड स्टमक मेनिंजियोमा. क्या क्या ऑप्शंस थे? स्टमक पैंक्रियाज. ओके, स्टमक पैंक्रियाज तो एसोसिएटेड होंगे. यस. देन व्हाट एल्स वाज देयर? नहीं. Stomach will be associated, kidney will be associated. What else were there? Pancreas, meningioma. Meningioma, multiple myeloma are rare. Both of them are rare, but yes, they can be associated. Stomach, common. Pancreas is also common. In this multiple myeloma then, if stomach, pancreas, multiple myeloma was there and meningioma was there, right? So then that will be the answer. Glomeruli and asked function with a red arrow. Okay, glomeruli was given and there was a marked structure. What was marked? Please tell me in the glomeruli. Structure marked. अगर पूछा है तो. Okay. Not associated was there. Okay, in this case, I would say myeloma. That will be the correct answer in this. Okay, myeloma was there, stomach, pancreas, and one more you said was meningioma, right? Free radical question. What was the free radical question? Please tell me. Single best answer was there. Okay, in this okay. मल्टीपल माइलोमा, मेनिंजियोमा दोनों रेयर होते हैं. Both myeloma and meningiomas are rare. Okay, both myelomas and meningiomas are rare associated with this one. Okay, physio question, glomeruli. Okay, leave that. Lesion in diabetic nephropathy. Okay, Armani-Epstein lesion. Kimmel-Wilson was there. Not typical. Okay, not typical. Not a diabetic glomerular lesion. What was their option? Yes, please tell me. Yeah, not a typical diabetic nephropathy, which is not seen. Okay. What was the option? Yes, please tell me. KW lesion, that will be very typical. और क्या क्या ऑप्शन था? Podocyte loss was there. Okay, then anything else that will happen? Podocyte loss. What else were there? Glomerular basement membrane thickening, podocyte loss, Armani-Epstein lesions. Armani-Epstein can be seen. Mesangial expansion will be seen. Multiple true false, dense GBM thickness. GBM thickening, mesangial expansion. Okay, GBM thickening, mesangial expansion. Okay, podocyte loss was not there. KW lesion was there. Armani, somebody said, right? Both will be seen. Okay, KW was not in the option. Okay, mesangial expansion will be there. Okay. What else was there? KW was not there. Okay. GBM thickening was there. Why not typical? Okay, it was KW was not there. Okay, that's fine. I have removed it. Then what was the option? Yes, Armani will happen. Diffuse thickening of the basement membrane, that will not be there. This was there. And podocyte loss. Okay. Yeah. So was this were these the options now? Please tell me. Then answer would be C in this. In this, best answer will be C. Not specific. Yeah, not specific. Not specific finding of diabetic, not a specific finding. Okay. Mesangial expansion, GBM thickness, correct. So diffuse thickening of basement, both C and yeah. Yes, if these were the options, C will be the correct answer now. Yeah, C will be the correct answer. Yeah, which is not a specific glomerular find. What was the question, please? Was it glomerular was given? Yeah, glomerular was given. Was the word given glomerular? Kidney or glomerular? If it was mentioned glomerular, then Armani Epstein. They will be seen in tubules. Not a typical glomerular was mentioned, then answer will become option B. Not a specific glomerular finding. If the word glomerular was mentioned, INICET people, typical, specific question they are asking. Armani Epstein will be a tubular finding. If glomerular was given, then answer will be Armani Epstein. If glomerular was given, then, and this because it's a tubular finding. Not a specific glomerular finding. Okay, then answer becomes option B. Okay, not a specific or not a typical glomerular finding in diabetic nephropathy. Okay, good. Next, any other question? Any other question which I have missed, guys? Any other question I have missed? Both from the chat box also, because the rate at which your chats are coming, I am not able to catch up all of the questions. Please tell me any other question I have missed out. Acha, chalo, ye ho gaya. Next, any other question? Any other question? KW was not there in the option. Okay, that's fine. So any other question in this? I have missed out on pathology. Please, if I have missed out any other question, please, you can join into this at the rate in Telegram. On Telegram, you can add more questions. Telegram, you can join this at the rate path_logic. And you can please put your queries there also. Question on lumbar puncture. What was the question on free radical causes? What was the question on free radical causes? I will solve that also. Let me add that also. Yes, free radical causes. What was the question? Free radical fibrinoid necrosis. Ovary histopathology वही ना वो collectioner body वाला. Okay, causes lipid peroxidation, correct. Free radical causes lipid peroxidation. Then what was there? SOD activates? No, SOD will inactivate. So free radical peroxidation, that is correct. SOD activates free radical. This was the question. Okay, superoxide dismutase will be what? Dismutating your O2 minus. So it will break down. Any other thing was there? In these two options, option B appears to be false. False पूछा था कि true पूछा था question? One option, free radical produced by neutrophil. Yes, that is correct. Free radicals produced by neutrophil, that is correct. Anything else was there? Multiple choice statement was there. Okay, SOD inactivates it or activates it? Inactivates will be correct. Yes, inactivates is correct. This was multiple true false type. Incorrect. Okay, free radical incorrect option. And multiple true false. Okay, fibrin or necrosis, that is not the case. That's it. So, no, that is the correct answer. So, free radical incorrect is fibrin or necrosis. Yeah, inactivated, that is correct. False option asked. Yeah, so fibrin or necrosis. Fibrin or necrosis causes it. No, that is wrong. Okay. Yeah, so that is correct. That is false. Anything else I have missed out? Anything else I have missed out? Any questions on genetics, etc.? I think there was one question on PCR. Half the number of cells will be one less cycle. That's it, right? Half the number of DNA, kuch tha. So that will be one less cycle. Anyway, that I think will be discussed in detail in Biochem. Sir, question 15, that's okay. Okay, these were the questions. Okay, guys. So if you BRCA mutation is detected by which method? What was the question? Lumbar puncture is, which is not true. Contraindication. A question. Complication can be safely done in thrombocytopenia. More than 10K? Yes. Both of them. Yeah, I think there was a question that was 26 cycle, and half the number of DNA copies will be one less cycle. Whatever was it. Histopathology was given, only glandular part was seen. Okay. What was this question? Histopathology was given and glandular part, what was that? Or granulosa cell tumor you are asking? BRCA1 is mutated by okay, they are already okay, chalo, they are already solved then. Okay, guys. So if you recollect any question, please tag me in this group. You can join this group at the rate path_logic. You can just search on Telegram and you can join this group. Okay, and if there are any queries, further queries, I'll be more than happy to take it. And I will hand it over to the next faculty now. Just wait for a few minutes. Other faculty will be taking the class.
Hello, good evening. So voice clear? Voice audible, sir? Yes, fantastic evening. Fantastic evening. Yes, let's start. So welcome to my dear students. I hope this May 2025 INICET Pharmacology question is, I think, very, very simple. Okay, to start. Let's start the discussion. Yes. I just want to see. I hope this May 2025 INICET Pharmacology question is, I think, very, very simple. Okay, let's start. Just once again. I want to see the chat box is not visible. Just once again. Yes. To start, the first question I'm going to start. Ready? Regarding thalidomide, two statements are. First question regarding thalidomide, true statements are. I think it's a multiple response question. The answer will be. Start. The first question I'm going to start. Ready? Regarding thalidomide, two statements are. It is teratogen. Yes, everybody will know thalidomide is a teratogen causing phocomelia. It's a true statement. Anti-metabolic having immunosuppressive property. This is what confusion. It is not an anti-metabolic. Anti-metabolic means it should be a purine or pyrimidine or folic acid antagonism. It is just only immunomodulator. It's a false statement. Role in refractory multimyeloma. Yes, thalidomide and pomalidomide has very fantastic role in refractory multimyeloma. True statement. Useful in lepra reaction. Yes, is useful for treatment of type 2 lepra reaction, so-called ENL. So useful for lepra reaction is true statement. Okay, so the right answer for the question option A, option C, option D. These are true statement regarding thalidomide. Am I right? This was easy paper. Yes, good, good. Multiple answer asked. Yes, good. See the recall. So the answer for the question option A, C, and D. Remember, it is not an anti-metabolic. It's only immunomodulator. Right? Yes. Multiple correct answer is that. So the right answer, the correct answer will be option number A, C, D. The first question. The second question, see, according to Goodman-Gilman, it is having immunomodulatory action, anti-inflammatory action, and anti-angiogenic. It is not an anti-metabolic, so it's a false statement. So that's answer. Coming to second question, a 8-year-old girl was taking 800 mg of carbamazepine daily and was prescribed 1 gram of erythromycin for 14 days. Patient is on carbamazepine, was given erythromycin. Within 2 days, she began to experience balancing of difficulty and ataxia. What could be the reason for this? I think it's a single response question. Here, carbamazepine anti-epileptic, erythromycin antibiotic, but you know erythromycin has microsomal enzyme inhibitory property. Thereby, it will elevate the plasma level of carbamazepine, thereby risk of causing carbamazepine toxicity. So, the difficulty in balancing and ataxia could be the side effect of carbamazepine. That means answer is option will be yes, good. She is experiencing the problem of carbamazepine. Answer B. Yes, good. So all are doing very good job. Fantastic. Coming to question number 3. A male patient with urethral discharge, gram stain shows intracellular gram-negative diplococci, which is resistant to penicillin. What could be the treatment choice for this case? A fantastic question. Look here. It's a combination of micro and pharmacology. So gram stain shows intracellular gram-negative diplococci. That means Neisseria gonorrhea. So for the treatment of gonococcal infection, that too resistant to penicillin, what could be the choice? Answer will be option number Yes, his option is option number C. Very good. Ceftriaxone. Remember, penicillin resistant, so we can't go for this. Neisseria gonorrhea, a gram-negative infection. Vancomycin useful only for gram-positive infection, not for gram-negative. So go for this. Tetra useful only for chlamydial, not for Neisseria gonorrhea. So the right answer, go for option number C. So remember, it's case of gonococcal urethritis. This and all we repeated discussing in our classroom, in our LRR and DVT also. So fantastic question, easy question only. Coming to fourth question. What is the most appropriate treatment for patient with complicated UTI presenting with septic shock? Okay, so options are amoxicillin clavulanic acid, nitrofurantoin, meropenem, and ceftriaxone. What the answer? No. It's wrong. Surya thought resistant as and not got no. It's the answer ceftriaxone only. Okay, next. Look here. Yes, good. A case of complicated UTI with septic shock. So for this case, best is go for yes, good answer meropenem. Good. Meropenem, a carbapenem derivative useful for extensively resistant organism. That is complicated. For example, we are in the Klebsiella and also for E. coli. Complicated infection with the septic shock mean better go for meropenem. Answer is option number B. Whereas other option, look here, amoxicillin nitrofurantoin useful only for uncomplicated UTI, and the septic shock mean go for better answer go for meropenem. Okay. Oh, not septic shock with diabetes. Okay. Prescribing with the diabetes. Okay, I'll change with the diabetes. Okay, with the diabetes. Okay, I'll alter. So this somebody posted. That's why there is maybe some spelling mistake. There may be grammatical mistake. There may be some error in the options also. Kindly excuse. And if we have right options, right list of option, kindly post it. I will rectify the problem. Okay. So here complicated UTI with the diabetes. Okay, I have to change it with the diabetes. Anyway, the answer will be meropenem. Okay. Yes. Now, question number 5. Which of following treatment are appropriate for scabies in infant? Actually, it's a dermatology question. Even see in pharmacology, one of the greatest point is we can share question from dermatology, medicine, psychiatry, and for anesthesia, everybody. So if you are too good in pharmacology, you can answer so many questions. Okay, I just collected 20 questions. If I think there's so many questions from pharmacology, indirectly or directly, I will collect only 19, 20 questions. Anyway, it's a question of terminology. Answering which of following treatment are appropriate for scabies? I think it's a multiple response question. Am I right? If it's a multiple response or single response, first tell me. First, in 9 month old, not infant. Okay, in a 9 month old. In a 9 month old. Okay. Okay. Right. It's a multiple response or single response. Okay, in the previous question, hypotension was diabetes. The hypotension was there. Hypotension was there. Okay, I'll change it. Okay, okay. So it's multiple response. Multiple response means look up. In infant, we cannot go for ivermectin. Ivermectin oral drug. It is teratogen, unsafe in pregnancy and unsafe in less than 2-year-old child. So it is not a choice. We can't use. Other can be useful. Here, the exact answer mean go for this. It's the best. The other drug can be useful or either crotamidon or benzodiazepine. So we can go for if the option A, B, C were given, you can go for this. Only A, B mean go for this. So when you say multi response, other than ivermectin, others can be A, B, D can be useful. Am I right? I think dermatologist also maybe recall this question. Am I right, doctor? Here, ivermectin may not be answered because it's a contraindicated in pregnancy and less than 2-year-old child. Okay, so other options coming. Single response mean go for permethrin. Multi mean go for either A, B, D. Okay. Yes. So if to choose only one option, mean go for this. It is the most effective and safer drug because when you study the journal, they says it is the best drug and the safest drug even in children. Whereas clotrimazole less effective. This also less effective and causing irritation in infant skin irritant. So single best mean go for answer A. A, B or A or C mean go for A, B. That's the best. Two option mean go for A, B. Three option mean go for A, B, C. So A, B or A, C. No, it is A, B. A, B is the right answer. A, B is the right answer. Only two option. That means go for A, B. Go for A and B, doctor. Okay. Right. AB. Right, that's the best answer. Okay, next, go for next sixth question. Which of following new psychoactive drug works as a rapid acting antidepressant? This is in our regular class we discuss what are the latest drug for treating depression. In that box we discuss cannabis, bupropion, ketamine, methadone. What answer? Methadone. What answer? The best answer go for ketamine. Ketamine, a psychoactive drug having antidepressant property. Actually, it has NMDA blocking property. Sorry, it has NMDA blocking property having antidepressant activity also. Actually, we want to call S-ketamine. S-ketamine, a derivative ketamine having wonderful effect on depression. So best answer go for ketamine. Cannabinoids not a antidepressant. It has euphoric effect but not approved as an antidepressant. Bupropion is not a psychoactive drug. It's a real antidepressant, comes under NDRA. And methadone is not the answer. I think spelling mistake somewhere. So the right answer go for option C, ketamine, not cannabidiol. Yes. Coming to question number 7. All of the following are clinical uses of magnesium sulfate except. I think OG madam, Divti madam, I think she was discussed, I think, okay, because this question comes under OG as well as in pharmacology, so we have to share, no problem, okay, anyway. All are clinical use of MgSO4 except. Yeah, we know MgSO4 wonderful drug for eclampsia. It's a drug of choice for eclampsia, anti-epileptic for eclampsia. So it's right. But when we're discussing anti-arrhythmic chapter in regular class, we discuss MgSO for one of the miscellaneous anti-arrhythmic extra point, like that we discuss. No, in that we discuss it has very look at it. When you monitor the adverse effect, we monitor what? Oh, you output, knee jerk, ankle jerk, as well as respiratory. That means it's going to improve kidney blood supply. Okay. Actually, it is useful for reducing seizure and neuroprotective. Improve kidney blood supply. What answer? There was no cannabis, only cannabidiol. Cannabidiol was given, huh? Cannabidiol. Cannabidiol was given. Okay, I'll change. When is cannabidiol? Cannabidiol having anti-epileptic property, not antidepressant. Cannabidiol, a new drug useful for Dravet syndrome, useful for tuberous syndrome, Lennox-Gastaut syndrome, doctor. It's antidepressant, mean go for ketamine, doctor. Okay. Right? Yes. Here, the best answer, go for they are not going to improve kidney blood supply. They may cause kidney problem. So that's why monitor for kidney output, your output. Which of following drug interaction? This is very easy question, I think. How many people vote right answer question? Which is the drug interaction between imipramine and diphenhydramine? This type of question and all, once you see the question, you should come with the answer. Imipramine, one of the tricyclic antidepressant. And diphenhydramine, one of the first generation antihistamine. Now, what is the point? Very simple, very simple. All the TCA having additionally anticholinergic property, that is muscarinic blocking property. That imipramine having very strong anticholinergy, thus why drug useful for nocturnosis. All the first generation antihistamine also having anti-muscarinic property. So the common thing is both of them are blocking muscarinic receptor. That's the right answer. Okay. Yes. Next. Erythropoietin useful with which of following type anemia? This is very simple. Erythropoietin as an undergraduate level, very important. We have erythropoietin, epoietin, neuropoietin, useful for anemia, especially useful for treatment of anemia due to CKD. The best answer go for option C. Whereas for A plus anemia, we can't use this one. Okay. And myelofibrosis, here fibrosis, we cannot improve the erythropoietin level by anemia level by using this. And neutropenia, here supplement B12 or folic acid iron, not erythropoietin. So the best answer go for option C. Okay. Question number 10. Gonadotrophic hormone receptor antagonist. That is gonadotrophic hormone antagonist, GnRH receptor antagonist, useful for. I think it's a multiple response question. Anybody? GnRH receptor antagonist are useful for ovarian cyst, useful in controlled ovarian stimulation, useful in vitro fertilization, useful in prostate cancer. So, CKD only. Anemia CKD. Okay, go for CKD only. Mean go for this. It's the very useful only for CKD. Go for this. Okay. And now, for this question, the right answer go for option A, B, D. If it's a multiple response question, go for option A, B, D. Vinayak, why A and D? Gonadotropin receptor antagonist like ganirelix, cetrorelix, useful for controlling premature ovulation in vitro fertilization technology. So we can use them for IVF. It is not useful for hypoandrogenism because it's an antagonist. It's going to suppress FSH level. So it's not for hypogonadism, but for all other cases useful. So answer will be A, C, and D. Yes, good. Gayatri, Satya, Fantasima, you answer right. Is going to question number 11. Come on, doctor, this question came or not? Please verify. A type 2 diabetes patient having hypertension, presenting with the heart failure symptom, and also having tachycardia, systolic BP about 90, ejection fraction was 60. Best treatment option. Come on, whether this question came or not. Somebody posted me whether question came or not. First tell me yes or no. Whether question came or not. Say yes or no. Answer? Yes. Came. Okay. That means what answer? Whether they given this full option A or option A loop directly, option B SGLT2 blocker, like this, or any other options are there. Can you please answer? Okay. Answer discussed. Okay, it came. My doubt is whether the whole thing is single option or this one option, or extra options are there. What answer? This, yes. Okay, anyway, the best answer for the question go for loop diuretic with the HGLT blocker. It's a case of uncompensated acute heart failure having systolic BP 90, ejection fraction almost to 60, preserved fraction. So we can go for option A. Digoxin useful only for heart failure with the atrial fibrillation. And eMedicoz useful for heart failure with the reduced ejection fraction, not for this case here. Preserved ejection fraction, go for this. Okay. Now, loop diuretic and SGLT same option. Okay, ma. So that means exactly answer A is the right answer. Can you please answer what is the option D, doctor? What they give option D? Any idea? What is the option D? If you tell, please post me. Okay, what the option number D was good. But anyway, the right answer for the question option number A. There is no doubt. Dopamine infusion. Okay, dopamine infusion was given. Okay. Anyway, it's a case of acute uncompensated heart failure. Best go for loop diuretic with the HGLT blocker. That's the best answer. Okay. Next. This question came or not? Contraindicated in pregnancy. I think Dupti madam was discussed or not. This question must tell me came or not. Must tell me yes or no. If yes mean I go for option. It came. If came mean See, among the given option, lamotrigine, levetiracetam are relatively safe in pregnancy. Okay, and valproate absolutely contraindicated, highly teratogenic. Parmesepin also contraindicated, but if the benefit good mean we can take risk and give. This can be given or not. Okay, so the multiple response question mean go for C and D. Multi mean go for option number C and D. That's the best answer. C and D. Yeah, answer is C and D. Single response question mean go for answer C. What are the option, doctor? Whether single response question or multi response question? Yes, it was single response or multi response. Single response mean go for answer C. Okay, single base mean go for answer C. Okay, next. Which of following is incorrect? Ready? Look at this option. Opioid can be rarely fatal. Yes. Opioid high dose may cause respiratory depression. Fatal. True statement. Cannabis withdrawal has few symptoms. Yes. They cause some tension, anxiety. Yes. True statement. Alcohol withdrawal treated with the flumazenil. No. False. Alcohol withdrawal treated with the benzodiazepine, not with the flumazenil. Wrong statement. And one more thing. Alcohol in low doses causing excitation, in high dose causing depression. Yes, good. Alcohol in low doses causing euphoria. This illusion. And high doses causing serious depression, respiratory depression. True statement. So, which of following incorrect mean one answer mean go for answer C. That's the answer for the question. Option C. Next. Topical side effect of corticosteroid cream, which includes, I think, dermatologists will discuss this question. Anyway, I'm also going for because pharmacology coming, so question. Topical steroid causing or what are the adverse effects? Options. What answer? Whether all answers are given or only thing. See, actually, the journal says incidence wise, look here. Skin atrophy is very common, 5 to 20%. So definitely going to occur. Okay, and hyperkeratosis can occur in less than 5%. So it's also true. And acne may aggravate. This is also true. So A, B, D definitely true. If the given C also can be because in some people rarely on chronic because okay. Regarding opiate, okay, what checkman? Come on. Come on, what is the option? Regarding which of following incorrect? Regarding what somebody says, check opiate options. What they given after? Opiate can rarely causing fatal adverse effect. True statement. What options are given? Okay, please fast. Okay, so if you have correct option, can you please post it? I will modify this. Okay, and then here the best answer go for A, B, D. If they given C, go for C also. Next. Reversal of acronym after cardiac surgery is simple. Acronym mean we discussed in class Socramatics. But look at option. Baclofen is a SMR, can be useful. Dandolin is a SMR, not useful. So answer will be either C, B or C. But single response mean go for neostigmine. Actually, for reversal, we go for neostigmine with the anticholinergic. Single response mean answer go for B. Multi mean go for neostigmine with atropine. Single best mean go for neostigmine. Which of following factors are involved in calculating the loading dose? This is very common. Loading dose mean definitely depend upon volume of distribution. But I think this will be multiple response question. If it's a multiple response question, go for option A, B, and C because B, D also important. When you say loading dose, target plasma level multiplied by loading dose divided by bioavailability. So A, B, C are the best answer for this question. Next, phenoldomechanism action. A straight question. It's a D1 agonist acting on renal vessel, causes increasing renal blood flow, useful for treatment of hypertensive emergency with kidney impairment. I don't know what are the other options are given. Can you please post me? Kindly note down 984065384 WhatsApp number, or I think you know my Telegram channel, or post in my Telegram channel, or post in eMedicoz Telegram channel. I'll take it. So please post this option. But anyway, the right answer for the question, phenolidine is a direct D1 agonist acting on kidney vessel, causes increasing kidney blood flow and useful for hypertensive emergency with the kidney impairment. No, sir, D1 agonist. Okay. And then I think straight question, malarial clinical cure. See, for clinical cure mean drug acting on erythrocyte stage. Artemisinin, fastest acting agent, definitely useful. Sulfadoxine pyrimethamine, slow acting, low efficacy, but useful. True statement, useful. True statement, true statement. Chloroquine, useful for false, I mean, the sensitive cases, like plasmodium vivax, not for resistant cases, sensitive cases, useful. Primaquine acting only on exoerythrocytic stage, useful only for radical cure, not for clinical cure. So it is not useful. So useful mean go for A, B, C. They are the right answer. Answer is A, B, C. Multiple question, no? Answer A, B, C. Pembidic acid. Actually, pembidic acid is a cholesterol lowering agent. It is acting by inhibiting ATP citrate lyase. What are the option given? I'm not able to get the option. If we have the option, kindly post it. But answer is pembidic acid, a cholesterol lowering agent acting by inhibiting ATP citrate lyase. Okay. So here, I'm not able to get the answer option. Can you please post me regarding pembidic question? Please post it. I will modify, and when I come to complete recall, I will tell the option. Okay. Anyway, the right answer is acting by inhibiting ATP citrate lyase. And I think there's one question regarding schedule. Which drug? What schedule? I think there's one question. Yes. Look. Actually, it's a competitive. So competitive ATP citrate lyase enzyme blocker. Competitive citrate lyase enzyme blocker. Yeah. Okay. Now somebody asked me schedule. Yeah, I got it. Schedule. Actually, they give an option: insulin, veterinary drug, morphine, hepatitis B. The right answer: insulin is a prescribed drug. Prescription. So with the prescription, what we can get? They call schedule H drug. Veterinary drugs are comes under schedule Z. Morphine, a drug causing addiction, that comes under category X drug. Vaccine, biological, or comes under category schedule G. So insulin means schedule H, veterinary drug mean schedule Z, morphine mean schedule X, and hepatitis B mean schedule G. So that's the answer. But exact question, I think matching question. They given schedule and the drug name matching. So insulin mean H, veterinary drug is Z, and morphine X, and biological the schedule G. Okay, I think 20 question. Whether the last question is there or not, I don't know. Acute mania, drug choice. Come on, this question came or not? Can you please explain? Can you tell me this question came or not? If at all, what are the options? Whether single response or multi response, I am not able to get the question. If it came in, usually for acute mania, we go for valproate or antipsychotic, or sometimes based on the case euphoric acute psychosis, we can go for lithium with the antipsychotic. Dysphoric acute mania, we go for antipsychotic with valproate. But what is the answer? Options I am not able to get. Anyway, Sachin sir will discuss the question. I also get the question from him, and I will tell you. Okay. Multiple options. The main best is antipsychotic with the valproate for euphoric. For dysphoric mania, lithium with antipsychotic is best option. Okay. Amitriptyline was there. Last option, amitriptyline. Amitriptyline not good for this case. Okay. Antidepressants are contraindicated in acute mania. So that's ruled out. Okay. Lithium valproate, haloperidol. Okay, haloperidol. Then multiple or previous question was cannabis less physical withdrawal. Valproate, lithium, haloperidol, amitriptyline was there. Okay, which is useful? Which is useful mean best to go for in this option. Single mean go for valproate, haloperidol. Whether they can just like this or a euphoric or something, because antipsychotic also very good for acute mania. Okay, multiple options. Okay, so lithium, valproate, haloperidol, all these are very effective. A, B, C. Multiple answer mean go for A, B, C. Okay, so I just only collected about 21 question. If any other questions are there, mean kindly post me. I think most of the questions are very straight question. I want one or two questions I have to think medicine, dermatology, pharmacology, integrated. So I think you're going to get a very good rank. May God bless you. All the very best. I come with the full question with the full options and I will discuss later on. So meantime, may God bless you. All the very best, doctor. Thank you for a bright future and hope for the best. Thank you very much. Thank you. Okay, I will add the pemberic acid everything. No history, only acute mania. Okay, ma. Okay, ma. Okay, I'll verify. Okay, best is go for lithium and valproates. Two option mean go for lithium and valproates. Best answer. Anyway, phase 1 reaction enzyme, cytochrome P450 enzyme. Okay, so best answer for this question, I think we can go for lithium plus valproates because for acute mania nowadays injecting olanzapine, respiratory atypical, best is multi-response mean go for A and B is the best answer. Okay. Anyway, we verify and tell you doctor the question. Okay. Phase 1 reaction something. Okay. Phase 1. I have to get the question from phase 1 reaction. Okay. Related to phase 1 reaction. There's one question missing. Okay. I think all the question I covered. I think so. One question. Phase 1 reaction. General pharmacology question. Okay. Unfortunately, one drawback. They say there's no question for anti-cancer and monoclonal antibody. We spent a lot of time for that. Anyway, no problem. All the everything's good. Okay. Thank you, doctor. Thank you. All faculty waiting for you. I will make the full question with the full answering. Thank you very much. Thank you very much. All the best.
Hi students, good evening. Good evening all of you. Good evening. So we will now be talking about pediatrics questions, the recall. So all of you let me know about the questions which you got. So I will be sharing with you all the options which have been shared with us from the students. So I will start straight away with the first question, and the first question was about a 9-month-old child who can speak mama baba, but he cannot sit without support. See, he cannot sit without support, which should be usually by 7-8 months in all children. Okay, so this patient has developmental delay in the gross motor field. Okay, he has stranger anxiety. So stranger anxiety is of course at this age, it is already there at 6 months. So if you look at in our back to basics, we always talk about, I always have this slide on that there is an upper limit of attainment also. And you can see, if you look here, you can see that sitting with support almost 9 to 10 months is the upper limit of attainment. So there is no doubt that this child needs a developmental assessment. Okay, so we don't need a physical therapy for sitting here. Reassurance is not an option because it's a 9-month-old child and he is still not sitting with support, which should be almost by 7 to 8 months. Okay, so developmental assessment. Okay, developmental assessment is the answer of this. Okay, all of you, do you agree with me? Any options? Any other options which you have in mind? Any other options which you have in mind? Anyone? So everyone agrees with me? This was the question in your exam? Hanji? Question also included, he can roll backwards and forwards. So of course we can add this. See, rolling is again at 4 to 6 months. So it's fine, you know. Okay, I will add, he can roll backwards and forwards. Okay, I will add here. Okay, which is at 4 to 6 months, that's fine, but he's not able to attain at least the 8-month-old milestone. Okay, yes, so he needs a reference for developmental assessment. Okay, reassurance, Dr. Chaitanya, because he is not able to sit without support, and 9 months to 10 months will be an upper limit of normal for this child. Okay, so let's go to the second question, and the second question was on cherry red spot with hepatosplenomegaly. So guys, can you tell me, can you share with me what were the options of cherry red spot? We have till now aryl sulfatase deficiency, which is metachromatic leukodystrophy, Gaucher's, Niemann-Pick's. Any other option? Yeah, developmental assessment, yes. Yeah, it's okay, image was not there, but I added an image of cherry red spot for you guys. So tell me what option was there in the fourth. Okay, so Tay-Sachs also has cherry red spot. What was the question, all of you? Alpha galactosidase, someone is saying. So see, cherry red spot is seen in Niemann-Pick's. So if the option was sphingomyelinase, so Niemann-Pick's and Tay-Sachs, both of them have cherry red spot. Okay, cherry red spot is not seen in metachromatic leukodystrophy or Gaucher's. Okay, someone is saying muscle phosphorylase tha. Okay, startle reflex was absent, so it was not Tay-Sachs. Very good. So of course, so very good that someone is telling us that startle reflex was absent. So you know, in Tay-Sachs at 6 months of life, they have startle reflex. Startle reflex was absent. So this makes it more like Niemann-Pick's. Okay. Yes. So the answer of this question was Niemann-Pick's. Remember, startle reflex is seen in Tay-Sachs. Very good. Many of you are saying startle reflex was there. So startle reflex was normal basically. So the answer of this question was Niemann-Pick's. Okay, startle reflex is exaggerated in Tay-Sachs. So the answer becomes Niemann-Pick's. Hepatosplenomegaly was there. Okay, let's go further. And now this is a very simple question. A 36-week gestation born by normal vaginal delivery has distress, and they showed an X-ray. So was this the X-ray showing a prominent horizontal fissure? So did you have this X-ray of prominent horizontal fissure? Can you tell me the fourth option also, all of you? Can you tell me the fourth option also? So see, if startle reflex is there, exaggerated, remember, in Tay-Sachs they have an exaggerated startle reflex. Okay, Normal startle reflex can be there, but in Tay-Sachs it's exaggerated. So X-ray was not normal, X-ray was a prominent horizontal fissure. Okay, 30% FiO2, very good. So remember that transient tachypnea of the newborn usually need minimal oxygen, so 30% is fine. So yeah, term or near term babies have transient tachypnea of the newborn. So remember, whether it's a term or a near term babies, they have usually transient tachypnea of the newborn. Second important point is they need minimal oxygen. So just 30% oxygen also proves that this looked like a transient tachypnea. Yes, so this was transient tachypnea of the newborn. Okay, someone is telling the last option was pneumonia. I will add here pneumonia. Okay, so it was not pneumonia. In pneumonia, you would have many other features like features of sepsis. You would also have more need for oxygen. Yes, so neonatal pneumonia. So term or near term babies have transient tachypnea. Now there was a question on Turner syndrome. What is not seen in Turner's? Anyone? Do you agree with me? So prominent occiput, of course, is seen in Edwards syndrome. It is seen in trisomy 18. Okay, so rest all is seen in Turner's. Short fourth metacarpal, web neck, wide nipples. It was not RDS. X-ray was normal. 36 weeker baby will not be RDS. Prominent horizontal fissure was there, Dr. Rahim, which is seen in transient tachypnea of the newborn. Okay, very good. This has been discussed. Excellent. Now there was another question on aneuploidy is not seen in. See, aneuploidy means odd number of chromosomes. So in trisomy 13, 18, you have 47 chromosomes. In Klinefelter's, again, you have XXY, 47 chromosomes. You can have more number of chromosomes in Klinefelter syndrome. While Bloom syndrome is an autosomal recessive syndrome in which there is a DNA repair defect. They have increased risk of cancers. So Bloom syndrome, aneuploidy is not seen. So they don't have odd number of chromosomes. Let's go to the next question. The next question was, which vaccine is contraindicated in immunodeficiency? Anyone? Which vaccine should not be given? Of course, you will not give a live vaccine. So MMR, oral polio, these vaccines are contraindicated in immunodeficiencies, live vaccines like MMR, oral polio vaccine. Okay, so all of you agree with me about the options? You agree with me? So pediatrics was not very difficult here. Yes, all of you agree with me, MMR. Any change in the options? Okay, let's go to the next question. Now the next question was about a 14-year-old girl who has SLE and nephrotic range proteinuria. So this is a severe lupus nephritis. And on the biopsy, you see wire loop lesions. So can anyone tell me which class of lupus nephritis is this? Which class of lupus nephritis will have wire loop lesions? Class 4. It means it's a severe lupus nephritis. Okay, it means it's a severe lupus nephritis. So just listen to me carefully. See, I'm a pediatric nephrologist, so I'll tell you what I do every day. Whenever we have kidney involvement in SLE, we trust cyclophosphamide. Now, you know, all over the world, there is a lot of trust on mycophenolate, but we don't use mycophenolate as an induction agent. Okay, in kidney involvement. So in lupus nephritis, severe lupus nephritis, wire loop lesions, class 4, you should give IV cyclophosphamide with steroids. Because in severe kidney involvement, suppose it was crescents in the biopsy, I will still give cyclophosphamide and steroids. Okay, remember that in severe kidney lupus involvement, we give cyclophosphamide. Okay, okay, let's go to the next question. So can anyone tell me what were the options in refeeding syndrome? How do you explain hypomagnesemia, hypokalemia, hypophosphatemia in refeeding syndrome? Anyone? Yeah, MMF alone, of course, will not be given. Very good. Thank you for that. MMF alone will never work. You have to give him IV and oral steroids. IV and oral steroids. First you give IV, then you go to oral steroids. MMF alone will not work. Now, can anyone tell me what were the options in the refeeding syndrome question? How do you explain hypomagnesemia, hypophosphatemia, hypokalemia in refeeding syndrome? Raise insulin, I agree. Okay, glucagon was in one option. Okay, let me add here high glucagon. What about anything else? Not a child, but still the options will remain the same. The pathogenesis will remain the same. Aldosterone release. Okay, I will add here aldosterone release and renal clearance. Okay, renal clearance. Renal clearance. So see, all of us know, if someone is chronically starved and when they suddenly get refeeding, they get anabolism. So in their body there is high insulin secretion, which leads to increased protein and glycogen synthesis, and because of the increased uptake of potassium, magnesium, phosphorus, they have hypokalemia. See on the right, hypokalemia, hypomagnesemia, hypophosphatemia, thiamine deficiency. So this is the refeeding syndrome. Remember, hypokalemia, hypophosphatemia, hypomagnesemia and thiamine deficiency. Okay. Okay, someone is saying increased procalcitonin increases phosphate excretion. Okay, I'll add here increased procalcitonin. Okay. Okay. So the answer is, of course, the first option, sudden insulin release. There is no doubt about this, the first option. Now, there was a question on a 4-year-old boy with broad-based gait and upper motor neuron lesions. What will you think of? Anyone? And can you tell me, are these options correct? A 4-year-old boy with broad-based gait, hyperreflexia, positive Babinski. Anyone? What do you think? What do you think? Anyone? Anyone? What do you think? So a 4-year-old with upper motor neuron lesions, see, in spinal cord lesion, you may have weakness in the lower limbs. He's not having weakness in the lower limbs. Okay. In Guillain-Barré syndrome, remember it's an ascending areflexic. So of course, Guillain-Barré syndrome is areflexia. In sagittal, okay, he had a recent ear infection also, but still correct option was cerebral palsy. Ear infection will not give us anything here, so it looks more like cerebral palsy here. Cerebral palsy can have upper motor neuron lesions, and if basal ganglia are involved, they can also have broad base gait. So the answer of this question was cerebral palsy. Okay, in ADEM there will be seizures, altered sensorium. Okay, I'll add here, someone is saying ADEM was the option. Let me write here ADEM, but they will not have a broad base gait. Okay, diffuse encephalitis, of course encephalitis will not have a normal sensorium. The word encephalitis starts with fever and altered mental state. So encephalitis was not there. It looks more like cerebral palsy. Okay. Increase in tone in the lower limbs, of course, is cerebral palsy. Okay. So you guys are confusing between two questions, I think, but yes, it looks more like cerebral palsy. Doesn't look like a spinal cord weakness of the lower limbs. Guillain-Barré syndrome is areflexic, and D and E are out of question. Okay. Now, there was a question of a child with low platelet count, 10,000, and his bone marrow shows megakaryocytes. So this was ITP. Thrombocytopenia with megakaryocyte proliferation is ITP. Now, what drugs do you give in ITP? In ITP, see, this is severe ITP, platelet count less than 20,000. So if platelet count is less than 20,000, we give IVIG. So options we have in ITP to increase the platelet count are steroids, oral or IV, and we can give IVIG. Okay. Okay. Okay, in the last question you are saying child was clingy with strangers, irritable with strangers. So if you go back to the last question, was there a history, a sudden onset history or a long duration of history? Anyone? See, we need to have a history, whether it's an acute onset or a insidious onset. Now you guys are telling me a lot of options, lot of questions. So let me know. So let me know. Okay, that's another question. Okay, clingy child is another question. Okay, okay, don't mix up the questions, guys. Okay, here we have a 6 weeks old child. So last question was IVIG and steroids for ITP. Now here is a 6 weeks old child who has non-bilious vomiting, but it is not projectile. See, not projectile, it is not pyloric stenosis. Pyloric stenosis is projectile vomiting, number one. Now it's forceful vomiting, or forceful vomiting, which can also happen in other lesions like gastroesophageal reflux. Now child has a normal bowel movement. Okay, those who are saying it's cow milk protein allergy, they will not have a normal bowel movement. So this is not cow milk protein allergy. This is not pyloric stenosis also, because in pyloric stenosis abdomen examination will be abnormal, vomiting will be projectile in pyloric stenosis. Okay, so this was actually not pyloric stenosis. Now you guys need to decide it was projectile or non-projectile. If it was not projectile, normal abdomen examination, it will be gastroesophageal reflux. See, listen and tell me carefully. If it was not projectile, normal abdomen, normal bowel, it is not pyloric stenosis, it is not cow milk protein allergy, it's more likely to be a gastroesophageal reflux. Yes, so my question is right, it looks more like gastroesophageal reflux. Okay, can we go further? Okay, now the question is which of the following represents marasmus? Of course, remember the most important funda of marasmus is calorie malnutrition. Okay, so it is more of carbohydrate, but remember it's relatively protein preservation. Okay, so the second option is true, it is calorie malnutrition and more of protein preservation. Now it's a starvation state, so they have high cortisol levels, insulin is low, insulin is not high, it's low in marasmus. So the second option is true, it's calorie malnutrition and relatively protein preservation. Okay, okay, so this is the second option here, not in marasmus. Now you think about what was there in the marasmus, but you should know cortisol is high, insulin is low. Of course edema is not there in marasmus. Okay, let's go further. Now the last question which I will be talking about in pediatrics was GERD is very common, Dr. Jha, in infants. It is very common in infants. Okay, and someone is saying vomiting was shortly after breastfeeding, then though definitely post regurgitation vomiting is gastroesophageal reflux. Okay, I can add that. So signs of good attachment, all except. So of course all of you know that in a good attachment more areola is seen above than below. This was the exact option, more areola above than below. Mouth is wide open, lower lip is everted. Lower lip is everted. Chin is touching the breast. So lower lip is not inverted, lower lip is everted. So first option is wrong when we talk about good attachment. Okay, that was all about pediatrics. There were around 13-14 questions which we just showed you. Guys, do you have any other question to discuss? I've discussed with most of the students of DAMS in multiple groups, and this is what I found. Yeah, if multiple options are correct, then B, C, D are fine. B, C, D are correct. Okay, Dr. Omkar? B, C, D are right then. Yes, you're right. Areola visible more above than below. Above than below. So I should correct this. Areola visible more above than below. Okay. So lower lip is this is the wrong option. Okay. So that was all about pediatrics. Breastfeeding was multiple correct. Okay, then you can answer B, C, and D. They were correct. Okay. Do you have any other question to ask? If you have any doubts, feel free to email me. My name is Dr. Siddharth Sethi. So if there are no more questions, we'll stop this session. Thank you. So guys, just remember that before the NEET PG, revise all your notes. Again, go back to DVT. And that should be your crux. Okay, do give the CBTs. Just revise the notes. Revise the DVT. And that should be enough for you guys. Okay, I can tell you most of the questions were already there in the back to basics videos. So if you ask me, back to basics videos are the gold standard. They are not like 500 hours of videos. They are short, crisp videos which give you all the essential information. So please trust your nose, trust the back to basics, and just in the end, just revise the DVT. And don't forget the PYQ sessions. They are very important. Do follow that. Okay, there was a question on breast milk jaundice mechanism, and you are right, it is glucuronidase deficiency. Thank you for that. Yes, we have discussed that in fact it was there in the last INICET also. Breastfeeding jaundice, breast milk jaundice is because of glucuronidase deficiency. Thank you so much. Thank you everyone. I will add that question and I will have again another recall formal tomorrow. So remember, that's beta glucuronidase deficiency. Thank you.
Yeah. Okay. 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 Sure.
Thank you everyone. I will add that question.
Good evening, students. Okay. I hope everything is visible and audible. So today I will be discussing INICET respiratory medicine and ABG. These are the topics that I am going to particularly discuss. First thing, whatever I have received feedback from students. So it was clinical based questions were there, and they told that sir, we are in hangover. I don't know what they have done in that 90 minutes in the exam. So it was difficult to recall. So it was clinical based, and many students told that it was difficult to recall. So I got few recall questions. I want you to modify those options, and when I leave, I'll also give you my mail ID and my Instagram ID. you can actually send it directly to me. Okay. Then, yes, it was intense. That's why they felt it was like some hangover. So many people were unable to give the exact recall. Actually, medicine will be like that only. By the time you reach medicine questions, your thoughts will be so confused generally in the examination hall, because INICET generally goes with integration. Integration is something that we speak day in and day out in our back to basics videos. DVT, everything, we try to make it clinical scenario based with image, investigations, and based on that, treatment decisions. Now, this was one question they have asked. High altitude, what was the ABG disorder? Yes, Dr. Shubham Chauhan. Whenever there is high altitude, there will be hypoxemia. So hypoxemia can cause hyperventilation. So whenever somebody hyperventilates, there will be CO2 washout. And this CO2 washout is responsible for respiratory alkalosis. Was this there in the exam? Okay. Yes, rapid altitude ascent will cause hypoxemia that can cause CO2 washout. Okay, I'll just modify it. I think this is a direct question, nothing to worry. Rapid altitude ascent. Okay, this was the key word. Thank you, Dr. Neetu. Okay, this was the question 1 that I got. Then next, Shubham Chauhan, very good. Role of procalcitonin. Role of procalcitonin. Actually, the elevated levels signify it is bacterial origin, though it is not useful in choosing the antibiotic. The decrease values, so whenever the values decrease, it can be used to de-escalate antibiotics. Just like you are in a war against bacteria in your body with antibiotics. You have S100, you have Rafales. Now somebody will come, and when to de-escalate, when you know you have completely destroyed their air bases, you have completely destroyed their navy ships, that marker is procalcitonin. Procalcitonin is not useful in starting the war, but it is useful in de-escalating the antibiotics. So this is helpful to identify bacterial origin, and sometimes even in other infections also it can increase. But the decreased values will always help you to de-escalate antibiotics. Okay, one option was bacterial and fungal. Yes. So for bacterial and fungal, it is useful to de-escalate antibiotics. So if somebody asks me one answer, procalcitonin has a value in de-escalating antibiotics. It can de-escalate antibiotics. So for confirmation of diagnosis, it is difficult. You cannot confirm pneumonia with elevated procalcitonin, because in any infection, procalcitonin can increase. Next, coming to, yes, this spirometry question. So this was also messaged to me. I want the exact terminology given. How much was the FEV1 by FVC ratio? This we have discussed multiple times in spirometry algorithm. If it is low, if the ratio is low, it is definitely obstructive. And somebody is telling that even smoking was given in history. So smoking, it is obstructive. and if it is COPD, as discussed many times, COPD can cause air trapping initially. It can cause air trapping. Air trapping can be there. And later, as time progresses, there will be hyperinflated lung fills. You can notice hyperinflated lung fills. Hyperinflation. Yes, RV by TLC, it means it is elevated. So if the ratio is elevated, it means residual volume is significantly elevated. So initially when the air trapping is happening, residual volume will be significantly elevated. Then as it goes into hyperinflation, symmetrical involvement, the increase in residual volume and TLC might be proportional. So disproportionately residual volume will increase initially as a part of air trapping. Once it becomes a very generalized disease, so residual volume and TLC can increase hand in hand. Lung compliance decreased. Okay. Again, in what was the question? Option 1 is restrictive. Restrictive you can rule out. This is not restrictive. This is not restrictive. Then next question. I think that surface tension question will be dealt in your physiology. So we'll just discuss medicine now. So core medicine topics. And in COPD, lung compliance, static can be increased. Again, that will also be discussed in physiology. I'll also contact physiology faculty regarding the exact options and we will give it to you shortly. Okay. So surface tension question was there. Okay. Surface tension. Surface tension question was there. Okay, this I will note down and we will try to bring out the exact options. Then lung compliance decreased was also there. Okay, lung compliance in COPD, it behaves differently. Static generally increases. Dynamic usually decrease. Static increase, dynamic decrease. So any more questions, students, in respiratory and ABG? Hey, we have forgotten our national disease. Was there anything on pulmonary TB per se? Any question? Any question with respect to, see, decrease in FEV1 by FVC is not normal age changes. 40 years, it is not normal. Come on, guys. Anything regarding our national disease, pulmonary TB was given. No. Oh my God. They have forgotten our national disease. Oh my God. National disease came in derma. Okay. Good. Dermatologists are now more worried about TB. They have become nationalist. So WHO criteria to diagnose TB spine. Okay. So if they ask you best test for any TB, if the sample is available, it will be microbiology only. If it is not available, it will be radiology. Increased chance of cholestasis. Okay. How to diagnose pot spine? Yes, it is radiological, because in most of the situations, getting a sample is difficult. If sample is available, then it is microbiologically. Okay, pneumothorax case. So pneumothorax. Most common cause is usually trauma only. For tension pneumothorax, most of the things trauma. It is trauma. Trauma. Yes, that's what I was asking. See, some are asking what is routinely used is radiological. If they tell me for any infection, best is microbiological. Which is false. PPV is most common cause of tension pneumothorax. So trauma has two. One is iatrogenic trauma PPV. And one is trauma happening outside hospital, that is road traffic accident. Can tension pneumothorax be iatrogenic? Yes. During mechanical ventilation, it can be iatrogenic. So they must have asked regarding whether it can be iatrogenic, yes or no. Yes. Tension pneumothorax can be iatrogenic. Then anything else? Wrong dressing can make tension pneumothorax. See, when you put an ICD, by chance if you block that ICD tightly, so the air from the pleura will not come out. So that can also increase the pressure and result in tension pneumothorax. Wrong dressing can also cause. Simple pneumothorax will never false. It's not like that. Simple pneumothorax, if you have drained it, and if you clamp the ICD inadvertently, all that air can accumulate and it can become a tension pneumothorax. So simple pneumothorax can later become tension. It can become tension. It can become tension. Yes, after the exam, this is what most of us feel. Especially the medicine part, I feel always the options will be very close and confusing. Then I hope 6 questions. This was also the recall that many students have said me. They were unable to tell the exact questions, but they can give me rough idea. So what I will do is, once again, let me check my WhatsApp and Telegram, Instagram, and I will, as soon as possible, will come with options and explanations. So if you have any more, you can just ping me on Instagram or WhatsApp, or you can send these questions to my mail. Okay, so just wait for another 1 or 2 days. So let me not speculate that this is the answer for that question without having clarity in the question and options, because that can harm few students' confidence. So these are the questions that I could gather in the limited time after exam. Let me take another 1 or 2 days so that I will come back with standard question and answers. Okay, students? So thank you. So do mail me any other questions that you felt were confusing. Definitely, I will search with my contacts also and give you the exact solution. Thank you, students.
Okay, so good evening all of you. Let's discuss some surgery questions. So am I audible? Is it everything okay? Audio video fine? Can you hear me? I cannot see the chat. I think I'll go back and join again. Yeah. So I guess everything is fine. So let's now discuss some surgery question. देखो problem क्या है ना कि in recall on the first day itself, neither the questions are clear nor the options are clear. So please understand, this is not the exact recall. It's basically I'm trying to collect all the questions that was asked, or we'll have a recall session, or rather I'll have a recall section once I have all the options and question correctly. तो आज हम सिर्फ superficially I'll discuss, and जिनका भी पेपर अच्छा हुआ है, जिनका भी खराब हुआ है, doesn't matter. Today is the time to relax. टेंशन नहीं करना. नॉर्मली क्या होता है, यू आर वेरी कंफ्यूज बिटवीन टू ऑप्शन, फिर आपको लगता है ये सही था वो सही था, यू आर लिटिल कंफ्यूज. जस्ट रिलैक्स. आज एंजॉय करो, रिलैक्स करो, डोंट वरी. सो फर्स्ट क्वेश्चन इज वेरी क्लियर. वी ऑल नो स्टेज 4B इज स्किन इन्वॉल्वमेंट. स्किन इन्वॉल्वमेंट इज अल्सरेशन. और रिमेंबर अल्सरेशन भी कौन सा, नॉट बाय प्रेशर. Malignant ulcer, there should be malignant cells in the ulcer. Number 2, PUD orange, that's lymphatic block. Number 3, satellite nodule. Inflammatory breast cancer goes in 4D. So there's no confusion in this question. I guess आप सबका ये सही हुआ होगा. And very many question, I just have the question, I don't have the options. So I don't have the options. Just 1 minute. So I'll just give the question and answer. अब देखो ये जो क्वेश्चन है, दिस इज बेसिकली दिस इज द प्रॉब्लम. You may find one or other, maybe erythema more than 1/3 of the breast surface is basically inflammatory breast cancer. So it's same. Cellulitis or erythema more than 1/3 of the surface is actually inflammatory breast cancer. It is same. It's equivalent. Okay, so that by definition, inflammatory breast cancer is more than 1/3 of the erythema. So that's it. This is what I said. The option may differ, but we'll understand the gist. अब यहाँ पे क्या है कि it's a familial breast cancer, and we all know familial breast cancer is associated with BRCA1 and 2. Obviously, BRCA1 has a more risk. So this is the answer. This is for Peutz-Jeghers syndrome. This is for Leigh-Fabry syndrome. All of them are risk factor, but answer is of course BRCA1. Alvarado score. I do not know the exact findings given. Sound issue is, am I audible clearly or not clearly? Voice is breaking. Just give me 1 second. Just give me 1 second. 1 second. Is it better now? Is it better? So, right. So basically, what was there, what was not there, I'll not go into detail because I'm sure कि ये हर आदमी अलग-अलग बोले. So basically, Alvarado is very simple. Mantrils, migratory pain, anorexia, nausea, and vomiting both, each one having 1. Tenderness 2, rebound tenderness 1. Fever 1, leukocytosis shift 2. So I think the answer was 7. I guess what the student told me. What all findings were there? Moving pain was there 1. Anorexia was there 1. Probably nausea was there 1. Tenderness 2. Rebound tenderness 1. Leukocytosis 2. So though I'm not sure what was there, but basically Alvarado we have discussed in regular batch everywhere, and TND also have discussed Alvarado. So I'm pretty sure that you can calculate it, right? A 65-year-old patient, and here I want your help, undergoes colonoscopy for evaluation of altered bowel habit. Colonic mass was found. Size does not matter in TNM staging. Adenocarcinoma involving only mucosa, no submucosal involvement. Okay, tenderness not there yet, it's fine. Basically, you can remove the tenderness, no issue. But mantral, if you know, you can very well calculate, right? So here, I would like to know from you, was stage 0 a option? Was stage 0 a option? You can remove tenderness, no problem. I'm not discussing the exact question. I'm just telling you, was stage 0 a option? No, we are not here to discuss tenderness, what there or not there. Basically, you know what is Alvarado, you can calculate. Yes, so that is the answer. Stage 0 is the answer because it is carcinoma in situ. I discussed TNA with you, although I did not tell the stage. I will just revise the TNA with you again. TIS is carcinoma in situ called stage 0. T1 is submucosa. T2 is muscle. T1 A and B, musculus mucosae and submucosa. T2 is muscle. T3 up to serosa. T4 outside serosa. So, if it is only mucosa, then this is T0, which is, sorry, it is TIS, which is equivalent to stage 0. So, if it is only mucosa involvement and stage 0 was the option, then that is the answer. Yes, so Happy Soul says stage 0 was the option and only mucosa involved. So, you consider this as stage 0. Okay? Stage 1 is mucosa, nahi, submucosa, T1 and T2. Stage 3 is T3 and T4 and N1. Right. So here this is the answer. Okay, I do not know the options, but I can tell you if stage 0 was there, that's the answer. Fine? Don't worry, galat ho gaya to koi baat nahi, sabka galat hua hoga. Don't worry about it. Now this question was on percentage. मैंने आपको बोला था कि only 2-3 things you have to know in burn. I have discussed burn in some places, like online also I discussed in Guwahati also I discussed trauma. So I told you in burn you have to know the percentage. You have to know the fluid assessment by Parkland, ATLS and Muir and Barclay. So percentage in Wallace's rule of 9, head neck 9, anterior posterior thorax 9, abdomen 9, upper limb 9, thigh 9, leg 9, 1% perineum. So this is 9, this is 9, this is 9 and this is 9. This is what was given. So answer was 36%, roughly 36 to 40. Okay, just confirm, was it only face burn or was it head and neck burn? No, 40 to 45 will not be the answer. Only face. So I will go to 4.5% and that too, if only singeing of eyebrow or grade 1 burn was mentioned, then you will not even calculate it. So only anterior part, then I'll go for 4.5%. Not back of the head, then of course we'll remove 4.5%. So this we will take, this we will take, and this will take. 9 3s are 27 plus face burn 3-4%. So the answer should be somewhere near 30%. Again, the question may differ, though not the same wording. Both upper limb, Rohit, will be 9 and 9 and chest will be 9. So 27 is clear, chest anterior. Face, how much? It depends on the question. So it should be around 27 to 30%. I think that is the right answer. If whole head neck is not given, then it should be around 30%. In this question, mechanical ventilation, obviously barotrauma, pneumothorax. Whatever the question was, trachea deviation to the other side, decreased breath sound, this is a barotrauma. Mechanical pneumothorax. This question was not there, so let's delete it. I think there was this question, we'll remove it. A 40-year-old male, okay, no such question, let's delete it because I've collected the question from here and there. A 40-year-old male presents in emergency with respiratory distress, blood pressure, there is hypotension, tracheal deviation, distended neck vein, absent breath sound. This is classical tension pneumothorax. Was this kind of question there? Was this question? And yeah, if they're asking what will you do, the answer is needle thoracostomy, put a needle. If they are asking what is ATLS next guideline, then I'll say ABC protocol. ICD we don't do in tension pneumothorax immediately. ICD we don't do, ICD we do later on. Immediately we have to go for needle insertion at 5th intercostal space. यार तुम लोगों के साथ प्रॉब्लम क्या है ना, यू स्टार्ट लुकिंग एट द कॉमर्स एंड फुल स्टॉप एंड क्वेश्चन मार्क, उससे कोई फर्क नहीं पड़ता भाई. हम अगर इसको हटा देते हैं इससे कोई फर्क नहीं पड़ता है. द आंसर विल नॉट चेंज. सो दिस इज व्हाट आई सेड इन द बिगिनिंग, दैट क्वेश्चन विल नॉट बी सेम बिकॉज आई हैव नॉट गिवन द एग्जाम. I basically want to tell you the concept that what they ask, whenever they have any question like this, then the no needle thoracostomy, so that's not. First thing should be ABC, airway, breathing and circulation. So if you have an option of secure airway, that is going to be your answer. Any trauma patient, first thing should be ABC, airway, breathing and circulation. CT scan also we never order first. CT scan comes in adjunct of primary survey. So any question of chest injury, pneumothorax or anything, first suspected head injury does not matter, Hari Govind. CT scan is never ordered first. The first thing should be ABC, secure airway. That's a very, very commonly asked question. In trauma, I have told you at least 5 times when I discuss trauma, whenever you have a question of trauma, the first thing should be secure airway. GCS 8/15, again secure airway. In head injury, whenever GCS is 8, intubation is the first thing. So first thing should be intubation. Okay, let's understand this question first. Just listen to me. Don't write anything, just listen to me. Dekho, the question is on trauma, and for trauma, the first thing is ABC. If it is a case of head injury, listen to me carefully. With GCS 8, then the answer is intubation, secure airway by intubation. If it is head injury, if it is not head injury or there is tension pneumothorax or decreased breath sound, then the first thing should be needle thoracostomy. So what I think by what you are writing here, that it was a case of head injury with GCS 8, the next thing should be secure airway by intubation. Any one of you, rather than writing one word and one line, you can write the whole question and option, and I'll tell you the answer. So if any one of you can write the whole question and options, otherwise let's take A, B, C as the first step, and secure airway is always your first step. Not a cause of recurrent renal stone. I guess this was a question. Prince, critical limb ischemia is below 0.5. Critical limb ischemia is below 0.5. That's the right answer, Prince. So, recurrent renal stone, hypocytiuria will not cause stone. Citrate in urine. Oh, hyper. The question was hyper. Sorry, hyper. The option was hyper. Citrate in urine is inhibitory to crystallization. Imminent gangrene, Dr. Dia, will be 0.3. So if the question says critical limb ischemia ABPI, it will be 0.5, and imminent gangrene 0.3. Yeah, hypercytiuria. You are absolutely correct. That was a wrong fault on my part. As you know, citrate should be more than 300 milligram per day in urine, and it's inhibitor of crystallization. So citrate inhibits stone formation. Citrate does not cause stone formation. So hypercytiuria is protective. That is not a cause. So answer is C. I will come to imminent gangrene later on. So here there is no confusion. I guess ये आप लोगों का सही हुआ होगा. Any confusion here? Hypercytiuria is protective. Hypercytiuria is protective. Okay. Now here I would like to know from you which photo was given. It was sleeve gastrectomy and without Roux-en-Y bypass, or sleeve gastrectomy with Roux-en-Y bypass. Can you tell me photo 1 was given or photo 2 was given? Which photo was given? We are not discussing 0.5 and 0.3. Okay. So this was a question. The same question, same photo I showed you in DVT also and in class lectures also. So I think there shouldn't be any confusion. It is SARDS, single anastomosis. Okay. So this question, I hope कि आपका सही हुआ होगा. अगर Roux-en-Y बनाते हैं तो Didner switch होता है. Roux-en-Y नहीं बनाते हैं तो SARDS होता है. Not a boundary of hepatocystic triangle. Was this a question? Not a boundary of hepatocystic triangle. Don't write photo was different, photo was not there. I'm just asking, was this a question? Do you have a question like this? So this is the hepatocystic triangle, which I'm sure you know. Liver, common bile duct, cystic duct. This is the boundary. Cystic artery is not a boundary, it is a content. Cystic artery is a content. Okay? Okay. Now, left lip, image was not there, that's fine. I told you image doesn't matter. So, of course, you can remove the image. Don't say that the image was not there. I'm simply asking and telling you the question. Cleft lip muscle repaired, orbicularis oris. This is the oculi is in the eye. Yeah, CBT is not a boundary actually. Common hepatic is the boundary. This is the common hepatic duct. Like, look at the screen. Yeah, that is a misprinting. This is the boundary, not this one. This is CBD. Common hepatic duct is the boundary, not CBD. Levator labii superioris is slightly on the lateral side. What other options were there? This is of course misprinting. We don't have ani superioris. We have labii superioris. Zygomaticus cannot be the answer. This cannot be the answer. Orbicularis oris out of these four is the best option, but it depends whether we are talking about the central cleft lip or the lateral cleft lip. So I'm not sure what was the question, but orbicularis oris apparently is the best answer here. Again, the photo may differ, so don't say it is the same photo or a different photo. Photo of Z-plasty was given. And what is the true statement? Muir-Barclay, I'll tell you, that is albumin. Now we are using albumin. Orbicularis oris is the best, most important muscle to repair. Most important muscle. I'm repeating, don't worry about the image. Try to understand the question. Can you tell me the options here? Transposition flap to increase the length is the best answer. Zigzag suture is not the answer. If you have a Z-plasty, then you do transposition to increase the length. That is the best answer. Lengthening is the best answer. Okay, don't worry about the photo. Don't worry about the other options. I'm telling you the exact answer. If it is Z-plasty, it is a transposition flap to increase the length of the scar and reduce the tension. That is the best answer. It's not a skin graft. The problem is whatever answer you have marked, you want me to tell that answer? No. The answer is transposition flap for lengthening. Forget about rest 3 options. I'm telling you, if there is an option of Z-plasty is transposition flap to increase the length, forget about other option. This is the best answer. Forget about the photo. Have you understood this? What angle you take? Any angle. 60-degree angle we take most often gives 75% lengthening. These are the questions they ask. VAC, vacuum assisted dressing closure. देखो, ये मैं आपको कई बार बता चुका हूं, even in grand test. It's not a pedicle flap भाई. आप ये सब उल्टे सीधे वर्ड क्यों बोल रहे हो? Pedicle flap नहीं है. It is a transmission flap for lengthening of the scar. Yes. Okay. Can you tell me the VAC options? The pressure we keep is minus 120 to 125 millimeter mercury. This is the negative pressure therapy. This is the wrong statement according to these 4 options. Okay, I think we are getting too much confused and we are going haywire. It's not that this option was there, I have marked this question, so this should be the answer. Let's understand the option. Was this option there, negative pressure at 10 to 15 millimeter mercury? If option was 125, then that is the right answer. This someone told me correctly. We keep 125 millimeter mercury. That's absolutely correct. What were the other options? Pressure given was 125. That's absolutely correct. One option was bacterial load. Option A was not there. If it was 125, then that's correct. It can be continuous or intermittent. That's okay, but generally we keep continuous. Okay. One option was it reduces the bacterial load. Directly, it does not reduce the bacterial load, but it promotes vascularity and granulation tissue. By that, you can reduce the bacterial load. If all the options are there, multiple choice, then I think all answers, if the pressure was minus 125, then I think all options are correct. In this question, all options are correct. I'm not sure of the question if multiple answers are there. Yes, it increased granulation tissue is correct. Decrease edema, correct. Pressure minus 125, correct. Decrease bacterial load. If you have to mark one, then decreased bacterial load is not it doesn't reduce the bacterial load, but it can prevent some proliferation of bacteria by increasing vascularity. Yeah, it was A, B, C. Then Neeraj, I think the right answer is it does not reduce the bacterial load. बाकी सारे सही है. बाकी सारे सही है जो आपने लिखा है. It promotes granulation tissue. Then pressure should be minus 125 and can be continuous or intermittent. There was a question, ABC is better than ABCD. Thyroid nodule, no past history of radiation. Radiation means papillary cancer, that's not there. Euthyroid, ultrasound showing solid nodule, FNAC is inconclusive. Hemothyroidectomy done, now capsular and vascular invasion. I don't think there should be any doubt here. I have not even mentioned the options here. I guess you all know the answer. Can anyone tell me this was not a question? Was this not a question there? Okay, so let's remove this. I think there's lots of confusion. Someone has given me wrong paper. 32-year-old patient with chronic diarrhea, pain abdomen, toxemia, dilated colon, lead pipe appearance. Was this a question? Like a question like this? Do we have a question like this? Yeah, that was a follicular cancer, but there's no such question. So let's remove it. Do we have a question like this? Okay, was it an image-based question or direct question? If it was a hostile colon, lead pipe colon, this is ulcerative colitis, we can very well leave this. It's an image-based question, discuss in radiology. Let's leave this. Do you have a question like this? Lactating mother, painful breast lump. Lactating mother, painful breast lump. At the end, you can ask remaining question. Let's remain focused on this. You do not have a question like this? Okay. So, what was the option? This is staph aureus. Why staph? No, why Corynebacterium? I don't understand this option Corynebacterium. There's something to suggest Corynebacterium? I mean, a lactating mother no staph, then Corynebacterium should be the answer. Granulation tissue and then the Corynebacterium should be the answer. Okay. So that will be discussed in cyst and granuloma and neutrophil. Okay, fine. So that's a microbiology question, not related to surgery and not abscess. No staph aureus, then Corynebacterium is fine. IOC of ureteric stone, repeat question. Was this question there? And this is a very, Corynebacterium is fine. Granulation tissue, neutrophil, then it should be Corynebacterium. IOC of ureteric stone. Do you have a question like this, which is a repeat question, I guess? Yeah, so this is NCCT. Here also there's nothing to discuss. NCCT. Do you have a question like this? White patch immunocompromised patient? NCCT is best for ureteric stone. That is a repeat question. Ureteroscopy is not diagnostic, Deval. Ureteroscopy is not diagnostic. NCCT is diagnostic. So white patch, immunocompromised, it is candida, of course, pseudohyphae will be there. This also you can discuss in pathology or medicine anywhere. STK11 is Peutz-Jeghers syndrome. P10 is Cowden syndrome. BRCA2 is correct. Mucosal neuroma you get in Rett gene MEN2, not here. So this was also wrong. Ureteroscopy is only therapeutic, it's not diagnostic. Yeah, so some questions which are not mentioned here. First is ABPI. If they are asking rest pain, then it should be less than 0.5. If they are asking pre-gangrene, then it should be less than 0.3. No confusion here. No, STK11 is not colon cancer. This is Peutz-Jeghers syndrome. You can have breast cancer, lung cancer, all in Peutz-Jeghers syndrome. So ABPI 0.3 will be pre-gangrene. Okay. White patch will be candida, always. ABPI gangrene less than 0.3, will not have gangrene above 0.3. We have rest pain. Yeah, imminent gangrene 0.3. That is a micro question. So, yeah, imminent gangrene will be 0.3. P10 is Cowden. So, Cowden you have thyroid cancer as well. For achalasia, you just have to know a little bit of Chicago. There are many classifications, but only Chicago they ask, and that too rarely. ABPI normal is more than 1. Less than 0.9 will be claudication. 0.7, sorry. Less than 0.5 will be rest pain, and less than 0.3 will be pre-gangrene. Imminent gangrene. Los Angeles classification is not for achalasia. This is for GERD. Los Angeles classification is for GERD. Breast conservation, only one quadrant involved is not a contraindication. If one quadrant involved, that's called multifocal, you can do. When it's multicentric, more than one quadrant, then that's a contraindication. So contraindication for breast conservation is not one quadrant. I don't have many questions. I don't have the options also. So there's very severe confusion right now. So let's collect the question and then I'll get back to you. I'll make a video of all the recall questions. So I think I'll stop. There's lots of confusion regarding questions and options. And the question given to me, many of them are wrong. So now just you relax. We'll go for NEET aggressively. We'll have some sessions. And if you have any doubt, I'll do one thing. I'll give you my phone number directly, which normally I don't do, but I think NEET is very near. Or you can use Telegram. We have a DAMS Telegram question, DAMS Telegram also. I'll be regular now. If you have any query, you can put it on Telegram, DAMS Telegram. Or my number 9811135398. You can send me WhatsApp if you have full question and you have doubt. Bets will be Telegram, okay? So that's it from my side. I'll stop. All the best to all of you. Most common functioning parathyroid tumor is parathyroid adenoma, single adenoma. Sterile pyuria, no organism, most likely tuberculosis. Most likely. Interstitial cystitis, stone cancer and tuberculosis, these are the 4 causes of sterile pyuria. No, I will be regular on DAMS Telegram now because we have a very hectic schedule. But now NEET exam is very nearby, close. So I'll be a little more regular. If you have any question, you can use DAMS Telegram. Okay? Most common endocrine pancreatic tumor is non-functioning pancreatic polypeptidoma for pancreas. For parathyroid, it is solitary adenoma. For pituitary, it is prolactinoma. Depends what the question was. Yeah, pituitary adenoma is most common. Anyway, so I'll stop now and I'll collect all the surgery questions and I'll try to post it on YouTube or DAMS site as soon as possible, within few days. All the best to all of you.
Yes, very good evening, everyone. So we are here to discuss the questions of physiology. So I hope the exam went well for most of you. And regarding the physiology questions, before I start, आवाज ठीक है, डिस्टर्बेंस आ रही है मुझे तो. Okay. चलिए, so very good evening once again everyone, and I hope the exam went well. And regarding physiology, the questions were not very difficult this time, if I might say so, right? So we are here to discuss the questions of physiology. So I hope, yes, very good evening everyone. So we are here to discuss the questions of physiology. So I hope the exam went well for most of you. And regarding the physiology questions, before I start, so the exam, I would say the questions in physiology were relatively easy this time. There were 2 or 3 direct repeats. Like one question was tetanizing frequency, which I will just discuss. So do let me know if that was the exact question. Remember, a proper recall would happen tomorrow. Then I would be compiling some more questions as I can lay my hands on, and with all of your support and feedback, right, I would be able to gather more questions. So let's begin with the first one. Good evening once again, everyone, and okay, great. So let's start with the first question. First one is, which of the following is seen in high altitude? Right, I think this is an easy question. Every one of you should have got it correct. As we go to high altitude, remember there is decrease in atmospheric pressure. It causes hypoxia, thereby causing increase in rate and depth of ventilation due to stimulation of peripheral chemoreceptors. So there will be a carbon dioxide washout resulting in respiratory alkalosis, right? So if this was the question given, then it is definitely the right answer. No, Faraz Singh Sandhu, metabolic alkalosis nahi hoga, it would be respiratory alkalosis. Hai na? You are doing more ventilation at high altitude. So CO2 washout will happen resulting in respiratory. I think you mistyped it. Let's move to the next one. IGF-1 and IGF-2 structurally resembles. Now, if this was the exact question, then please remember in Genong it is clearly mentioned. Okay, great. So in Genong, it is clearly mentioned that insulin has a cross reactivity with IGF-1 and IGF-2 because of the structural similarity. This line is mentioned in Genong, although I must tell you that if you search the answer from Google or ChatGPT, then you know the answer is given as pro-insulin, but that is wrong answer. Because no, Prince Ghai, pro-insulin is wrong, because that is what I am telling you. In ChatGPT and Google it is coming as pro-insulin, but in Genong it is clearly written that insulin has a structural similarity with IGF-1 and IGF-2 both. That is why there can be cross reactivity between them, right? So the answer is actually insulin. So this was an interesting one, especially if you have been looking the ChatGPT since afternoon, right? Or maybe the Google. So question number 3. This was also one of the question where I could gather some options. You could, if you did insulin, it's wonderful, Avantika. That's very good, because a lot of students actually were telling in the DAMS group that it is pro-insulin. Gaurav Samaria, because structural similarity and cross reactivity is maximum with insulin, right? It is clearly mentioned in our Genong. Surface tension of the fluid lining the alveoli increases during. This is also a relatively easy question. If you could remember, during inspiration, there would be increase in size of alveoli. ChatGPT का answer insulin है, यशोधन ठीक है, फिर तो सही है, फिर that's fine. Because some student, I didn't search, but some students were telling me कि on ChatGPT pro insulin दिया हुआ है sir. ठीक, so okay. यशोधन, I agree with you. If ChatGPT answer is insulin, then ChatGPT is correct, right? But yes, coming back to here, if there is more increase in size of alveoli, remember there will be relatively decreased concentration of surfactant. There will be a relatively decreased concentration of surfactant. Why? Because if the alveoli increases in size, the surfactant molecules concentration relatively will decrease. If the concentration of the surfactant relatively will decrease, then remember there would be increase in surface tension, right? So answer is actually inspiration. And remember, some students were saying standing and supine. Remember, not much effect on the surface tension during standing and supine, because that is mainly affecting the blood flow. We are talking about the surface tension, right? So if you do expiration, Shrishti Shivani, if you do expiration, then the size of alveoli is reducing. Then relatively there is more increase in concentration of surfactant, which will help more inflation of the alveoli, right? So there we say that is why the hysteresis loop occurs, and we say that basically during expiration compliance is more, right? But here they are asking not compliance, they are asking surface tension. So you have to read the question very carefully, as I always say. Yes, wonderful. If you, I think most of you have chosen. Dr. MS, P nahi pucha hai. I would be discussing tomorrow again in detail. P is the collapsing pressure, or the distending pressure, as we say. Distending pressure is more in smaller alveoli. It keeps the alveoli inflated. Here they are asking surface tension, right? Remember, detailed explanation will follow tomorrow. Tomorrow I will also take up this P concept once again of the Laplace law. Moving to question 4. This is, I think, a multiple time repeat, and none of you should have done this wrong. None of you. Bezol-Jarisch reflex effect seen after its activation. I think here it was mentioned that what is not seen, right? So what is not seen in basal-gyrus reflex after its activation? So if that was the question, that what is not seen, then we know apnea is seen, bradycardia is seen, hypotension is seen, but tachycardia is never seen, right? So basal-gyrus, remember, came last year in INICET also. Yes, Anugnya Rima, expiration में alveoli का size छोटा हो जाएगा. So what will happen in expiration? If the size will reduce, then relative concentration of the surfactant will increase. Multiple option tha Hari Govind. Then the answer would be, if they are asking what is correct, if they are asking what is correct, then the answer would be naturally A, C and D, right? These are all the correct ones then. Okay, I agree with you. If multiple options was given, then it would be right. Yes, multiple correct, then I've changed it. Then the answer would be ACD. If it was not seen, then naturally it would be hypertension is not seen, right? Or tachycardia is not seen. Moving on to question number 5. This also you can tell me if this was there or not. So in normal awake person at rest with eyes closed, the EEG waves that are reduced on opening the eyes. The EEG waves which are reduced on opening the eyes. Remember, this is a characteristic. Hypoapnea was option. Okay, thank you. I will correct it. Thank you. Thank you. Yes, thank you so much. So I would be needing your inputs. If hypoapnea was option, then also remember that is wrong, right? It doesn't matter. Yes. Next, definitely this, I think again all of you should have got it correct. If I am sitting relaxed with my eyes closed, my mind wandering, then I am having alpha waves. But as soon as I open my eyes, remember what will happen. This is famously known as alpha block. The alpha waves are replaced by beta-like waves, high frequency waves, right? So here the answer is alpha. Again, a repeat question, easy one. Dr. Hari Govind, I would be doing a detailed discussion tomorrow, right? So tomorrow at or nearly the same time or in the afternoon, right? You will be having the information. Which is the 2-pair option, Shubhashri? Can you please let me know which is the 2-pair option? 2-pair, if question number 4 you are talking about, then the answer is, if question number 4 you are talking about, then the answer is, which of the following, if they had seen what is seen, then hypotension, bradycardia and apnea will be seen, right? Yes. Hypoapnea is also seen. You are right. Moving on to question number 6. Calculate the tetanizing frequency. This I don't think I even need to discuss, because exact question we have discussed multiple times, even in the mock test as well. So calculate the tetanizing frequency if the contraction period is 40 millisecond. Yes, you want me to solve it? No, I don't think so. And the answer would be tetanizing frequency is inverse to 1 upon contraction period in millisecond. Okay, Vidushi Sharma, if one option was all the 3, then that is the answer, right? Except tachycardia. So here the answer is none other than 25 Hertz, because it would be 1 upon 40 millisecond. That would be 40 upon 1000, and I think we all know the answer. It would be 25 Hertz. Absolutely correct. Yes. Riya Agarwal, which question was different? Please let me know, or you can send me the direct question on my WhatsApp number. I would be sharing again today once we are done with the session. Yes, Riya, can you please share the question with me? Himali Maniar, it doesn't matter if the tetanizing frequency, if the contraction period is given as 40 millisecond, the answer would be only 20 Hertz. Doesn't matter. Remember, I would be doing tomorrow latent period. We do not use for tetanizing frequency. We only use contraction period, right? Latent period is not included. Relaxation period is also not included, Aditi Ghosh. So latent period is given as 10 millisecond. Okay, I agree with you. Contraction period is given as 40 millisecond. Yes, what else? And relaxation period is 40. Remember, these are standard durations of a simple muscle twitch. Yes, Dr. Ashu, hypoapnea is the same thing as there is a transient apnea followed by a rapid increase in ventilation. That is a characteristic feature of basal-gyrus. It is commonly seen in the J reflex, as we say. Yes. Moving to the question number 7, which of the following is an example of feed-forward mechanism? Here I would be needing your inputs. Yes, so please tell me what was the exact options given. Yes, what were the exact options given? Yes, can you tell me the exact options? Which of the following is an example of feed-forward mechanism? Heart rate increases from supine to standing. Is it feed-forward? What do you think? Is it feed-forward? Heart rate increases from supine to standing. Heart rate increases from supine to standing. Yes. No thermoregulation. Okay, then was exercise given? Yes, Dr. Sandhya Nagendran, was exercise given? Because heart rate increases from supine to standing, this would be a negative feedback. Because once you stand, your venous pooling will happen, baroreceptors will cause, right, more increase in heart rate. Fourth option was not there. Then what was there? Please correct me. Yes, I need your feedback. Yes, I need your inputs. Vasoconstriction occurs upon exposure to cold. This is again negative feedback. Fourth option was ADH. Vasopressin, what option was there? Doc Garima, yes. What exact option was there? Because remember, increase in cardiac output in anemia is also negative feedback, because in anemia there is decrease in viscosity, so we are going to increase the cardiac output. Okay, I will try to get the right option from you all. So if thermoregulation and exercise were not given, then remember the classical examples of feed forward are anticipatory tachycardia, receptive relaxation, right? Option was vasopressin in dehydration. Okay, Viraj? Vasopressin in dehydration. Okay, ADH responds to thirst. Fine. Was there any option mentioning only thermoregulation? Yes, I have noted it down. Was there any option mentioning only thermoregulation? Can you recall? Was there only? Yes, I got it. Thank you so much for ADH option. Was there any option mentioning only thermoregulation? Only thermoregulation. Remember, ADH response to thirst is also not feed forward. Why? Because if you are dehydrated, then what will happen? Yes, if you are dehydrated, then what will happen? Your plasma osmolality is increased, which is causing increase in no such option. Dorsal nucleus. Okay, fine. Thank you so much. So I will try to gather in more information about this question and I will discuss tomorrow. Yes, if then it should not be vasoconstriction, it should be thermoregulation. ADH secretion response to dehydration. Okay, thank you. So I will get back to you tomorrow with the exact option or the exact answer to this question, right? Tomorrow, right? So let's move to the question number 8. This I will work up more and let you know tomorrow, right? So just give me today's time. I'll get back to you tomorrow. Patient has come to OPD with fever. Which hypothalamic area is involved? Was this a kind of question which came? I think this is the question. Patient has come to OPD with fever. Which hypothalamic area is involved? Okay. Yes, Dr. Buruda. Bus, I think this was the question you were talking about. Dorsomedial I have written here from the recall. Dorsal was there. Okay, fine. I'll take up it as dorsal, but the answer will not change. Then what could be the answer here? Remember, fever. Fever, which area is involved? So I have already tell you in class, remember AC, anterior hypothalamus cools you down, and anterior cools you down, and preoptic nucleus is a part of anterior. Yes, which options were there? If anterior was not there, then they must have given preoptic. Somebody is saying yes sir, same. Dorsomedial to sahi nahi hai. Dorsomedial is not given. Posterior was not given. Okay, I would remove the posterior. Anything else? Anterior was not there. Then there must have been preoptic. Please try to recap. Preoptic is a part of anterior. Preoptic must have been given. Insular cortex was given, but that is not the correct answer. Insular cortex will not be the answer. Amygdala will not be the answer. Anterior hypothalamus was not given, does not matter. They must have given preoptic. Deval Patel is saying it preoptic was given. Then preoptic could be the answer. Yes. Okay. Fine. This also I am circling off. I will try to get more information regarding this. We will discuss tomorrow, right? Paraventricular cyperineath, if that was the option, I have written periventricular. If you are saying para, that is not the answer, right? Preoptic was there, then it is the answer. 100% that is the answer. Then there is no doubt. So which of the following is not the action of ADH? This is a controversial question. Please listen carefully. I will be discussing tomorrow. Not an action of ADH. But let me first ask you, which are the actions of ADH? Yes. Does it increase the water permeability in the collecting duct? What do you say? Yes, that is the primary action. This is true. Increases absorption of urea in MCD. What is MCD? Medullary collecting duct. Right or wrong? This is actually correct. Why? ADH increases the synthesis of which urea transporters? Remember UTA1, UTA3, mainly A1, right? So this is correct. Increases absorption of urea in thin descending limb of loop of Henle. ADH increases absorption of urea in thin descending limb of loop of Henle. Remember, now you will have to recall and help me out. If this was the option given, then this is also, not 100% correct. TDL is same as Bududa. TDL is same as descending limb of loop of Henle. But some urea absorption occurs here. Very, very less. Some urea absorption occurs here. So if this was given, I would consider this correct by elimination. But I would again say that unless and until we can recall the exact options, it's very, difficult for me to say the correct answer. But still I will say amongst these four, this will be the answer, because ADH neither increases nor decreases absorption of sodium and chloride in thin ascending limb. Rather thick ascending limb also, if that was there, that is also wrong. MCD was not given, Dr. Buruda. Then what was given? Himali Maniar, urea, both sides, separate option. Himali Maniar, can you please recall for me? Even if it was given as increases, that is also not the action of ADH, because please remember, ADH is not doing anything to sodium reabsorption in thin ascending limb. Neither it increases nor decreases. That is not the correct answer, right? That is not the correct answer. Urea, both sides. Both sides means, yes, can you recall the option? Nandini Jindal, please. Yes, can you recall the option? And I think there was one more question which I have not written here, but you could recall for me, and that was, they had asked about tight junctions. That where are the tight junctions present? Tight junctions are present where, right? If that was one of the questions as well. And I think the options given were apical, basal, apicolateral and basolateral. This was one more question, I think, if that was there. So please remember here, basal and basolateral are absolutely wrong. Now some students were sending in the group that it is apicolateral, but Sandhya Nagendran, no, the best answer is apical, because they are present at the apical portions, right? So apicolateral is not correct, Harsha. The better answer is apical or apical. That is again clearly mentioned in our physiology books, both Genong and Guyton, right? So the answer is actually apical. Is that, if that was the exact question given? Although in some places it is a slightly controversial answer, because in some places apicolateral is given, but still I would say the better answer is apical, right? Because it is mentioned in Genong as apical junctions are the tight junctions, zonula occludens, right? And if you have any more questions to tell me, please DM me on my WhatsApp number. You all have my WhatsApp number, but still I am sharing with you again. And Now relax for today, and then from tomorrow onwards, start pushing yourself for the NEET exam, right? And don't worry too much about the exam, right? Result would follow soon, so please don't waste your time. This is my WhatsApp number. Get to me with any more options if you could, remember or recall for me. Dr. Sanjay Ramprasad, Jod Besto will be discussed in medicine. Yes, I know there was one more question that would be discussed in medicine. So don't worry, the medicine in Jod Besto will be discussed in endo in medicine, right? So, but if you could recall the question, please send me. Right? So best of luck from my side. Take care all of you. God bless you all. And now relax for today and right, and get back to studies from tomorrow, right? Because NEET is not far off, right? So you have one more battle to win, right? Chale, take care all of you once again. Thank you so much.
Hello everyone. So how was INICET examination? I hope the day went well, and I hope that biochemistry was not too difficult for you people. Let's see how many I can get questions on recall. I have not been able to get much of the recall since evening. How was biochemistry portion? See, I always say there are few very important topics like glycogen storage diseases, phingolipidosis, alcohol metabolism. There will be a question related to insulin. There will be something related to the alcohol metabolism. Enzyme inhibition was there or not? I have not seen any question in recall on enzyme inhibition, whether there was a question on electron transport chain inhibitors, rotenone and all was present or not. Was there anything related to it? Right? Let's get started. In case you are able to recollect some questions, please let me know in the chat box. Alright, so let's get started. There was a question related to insulin, IGF-1 and 2. Probably you might have seen this question in physiology as well. I have put this question not per se because it is from biochemistry, it is from physiology, no doubt, but it has a very important topic, and that is insulin. And insulin you will study in physiology, you will study insulin under medicine. So this recall session, especially for those who are going to give NEET examination this year, next year, please make sure that you revise these most important topics. So wherever they come, the answer to this you will get in physiology. IGF-1 question was the cyanide question is it's a repeat question. It came last year also. There was a question last year which said that all of the following are inhibitors for complex 4 except, and the options were nitric oxide, cyanide, carbon monoxide, and some other option was given, and azide or hydrogen sulfide, and the answer was of course nitric oxide. So this carbon monoxide, this mechanism of action, electron transport chain inhibitor, it is cyanide. It is cyanide. So complex 4, good. There was complex 4 inhibitor. The various complex 4 inhibitors are carbon monoxide, cyanide, hydrogen sulfide, and azide. So yes, exact same one. Okay, so this is the same, this is a repeat question. This is a repeat question from last INI exam. Last year INI exam, November exam, this question was there. Malonate was also there. Malonate was also there. Alright. So we were discussing the insulin like growth factor 1 and 2. They have a 7.5 kilodalton ka around molecular weight, and these insulin-like growth factors, they are single chain protein homologs that promote cell growth. This is how pre-proinsulin becomes proinsulin. See, there is a signal peptide which will get cleaved, then it will become proinsulin. Proinsulin will become mature insulin, which is made of 51 amino acids. So insulin is protein in nature. C-peptide is released, and that is completely non-reactive molecule part of it. And of course, the answer for that question was insulin. अच्छा, there was a question. ये वाला question मुझे पूरा help करो इसको frame करने में. I need your help. What was the question related to cherry red spot with hepatosplenomegaly? What's the enzyme defect was asked? Of course, the answer is sphingomyelinase. I know you know the answer, right? And but what was the question? Complete options क्या क्या थे? Other options, what were they? I need your help in this. I need your help in this. We'll discuss that glycine wala question. Yeah, I have that question. Achha, there was a question related to the components present in diet. The components present in diet that help in gaining weight. Something like that. Component present in diet helping in gaining weight. Helping in gaining weight. I don't know what was the question. I am just taking it from the chat box. Achha, this question which we were discussing, isme there is hexosaminidase. Okay. Hexosaminidase is Tay-Sachs disease. No hepatosplenomegaly is seen. Cherry red spot, of course, is present. Aryl sulfatase was given. Aryl sulfatase is usually a distractor, never an answer to any question. With cherry red spot and startle reflex, that was there in the question. Okay, I get that. Startle reflex was there in the question. Good. इसका फोर्थ ऑप्शन तो बता दो भाई. What was the fourth option? Sphingomyelinase, hexosaminidase, aryl sulfatase. What was the fourth option? Yes, I always say this. This is sphingolipidosis is a must. And I always say if this topic I usually say is one day before topic. Sphingolipidosis, we can't miss this topic. There was no question from glycogen storage diseases. INI loves glycogen storage diseases. कोई question नहीं था glycogen storage diseases. All your von Gerk's disease, McArdle's disease, Cory's, Anderson's, Pompey's, no question from that segment. How is this possible, yaar? क्या question paper बनाया था फिर? Yes. What was the fourth option here? Sphingolipidosis. Yes, there was. Some of us are saying there was a question. Glycogen storage diseases पे. क्या था क्वेश्चन फिर? थोड़ा हेल्प करो. What was the question? Debranching enzyme. Can you recall the enzyme question? Exact question, like even if it is in pieces. Debranching enzyme, liver and muscle is involved. Okay. Liver and muscle both are involved. Muscle both are involved. वही मैं सोचू ऐसे कैसे हो सकता है. ग्लाइकोजन स्टोरेज डिजीजेस वो तो इतना फेवरेट टॉपिक है. हमने अभी रिवाइज भी किया था उसको. there was something related to muscle and glycogen ketosis was present. Now I am getting a mixed picture here. Now I'm getting a mixed picture here. Baby having hypoglycemia, also ketosis was there. Von Gerk's given all symptoms. So probably it was some question was there related to glycogen storage diseases. Glycogen storage diseases. And in the same question, AST, ALT was high was given. AST and ALT high was given. Alright, if we go with the recall and if we are all talking about the same question, these are the options these are the key points which we can see. Right, so there was some question related to glycogen storage disease. Some of us saying hepatosplenomegaly was given. Some of us are saying a child was normal till 6 weeks, after which he developed muscle weakness and ketosis was present. Glucagon after diet does not increase glucose IV. There will be okay. So, this was the part of the same question. Glucagon after diet does not increase glucose, but given IV does increase glucose. Alright. So, this was the part of the same question. 1.4 per glycogen in liver. Alright. Good. So there was some question related to glycogen storage disease. Right. Let's see if we are able to get the complete, if somebody can frame the complete question, because I have got one word only. Alright. Okay. There was a question which said liver glycogen content was elevated. Alright. Point noted. Liver glycogen content was elevated. This is more like sounding like von Gerk's disease. This is more like von Gerk's disease from whatever options you are giving me. Enzyme defect was asked. Then it is glucose 6-phosphatase defect. Enzyme defect. If this was not there in the option, debranching was not there in the option, then it is glucose 6-phosphatase. Okay. Alright. Good. Now ketosis is there. Ketosis can be seen in Cories also. Right. So here there was a key point. Child with hepatosplenomegaly, blood glucose became normal after giving glucose and it must be glucagon, but blood glucose level did not increase after giving glucagon after overnight fasting. So it's a mixed picture yet. I do not have a complete question, but by and large, if we see these key points, the ketosis is present, von Gerk's disease, AST, ALT, hepatosplenomegaly, more likely it is pointing towards the glucose 6-phosphatase defect. Alright. Yes, but still, yes, we need to make it differentiated from debranching. Yes, I still need to differentiate it from debranching. Debranching is Cories. So it is between Cories and von Gerk's. But I need a complete question for this, right? So for that to happen, we need a complete question. Only then we'll be able to decide. So it is between von Gerk's and Cories depending upon the key points which you have given me. Alright. Let's discuss this question. This sounds interesting. The component, they love this. They love integration part. INICET, they love to combine something which is present in all the metabolic pathways. So there was a question related to the component present in diet helping in gaining weight. Right? What was this question? Let's work on this question. the component present in diet, कुछ क्या था वो मतलब what was given. See, if they were mentioning about what should not be taken, of course carbohydrate should not be taken in excess, because carbohydrate will be converted to fat in the body. I always say आलू क्या है, आलू fat ही तो है, it is fat, although we are taking it in the form of carbohydrate, but it becomes fat in the body. So there was a question related to GLUT receptors. GLUT receptor. GLUT receptor ka question. There was some question related to xenobiotics. GLUT receptor पे कौन सा question था? GLUT2, GLUT4 comparison was asked. Something related to GLUT2 or GLUT4 was asked. They usually ask GLUT2 or GLUT4. GLUT transporters anyhow is an important topic. Make sure you revise this for the NEET examination. All right. Insulin dependent. Oh, so they are asking about, if the question was mentioning about insulin dependent, it was about GLUT4. It was about GLUT4. All right. Okay. So if we work on this question, the gaining weight wala question, it was, I'll come to the revision of sphingolipidosis later. This question, which of the following will be increase in the obese patient, right? Something of this type, or people who take a diet rich in carbohydrate. So what was the question? I think it was something either related to which of the following will increase in obese patient, or which of the following will increase in people who consume carbohydrate rich diet. Carbohydrate rich diet. So this, what do you think will increase? अगर मेरे पास यही दो options होगा, even then you can come to your answer. Even then you can come to your answer. Depending upon, I don't have the other options. So see, if somebody is taking carbohydrate rich diet, there will be high free fatty acid in circulation. Why? Because all the carbohydrate becomes fat in the diet, in the body. And see, what will happen as a result? There will be increase in malonyl-CoA. When will malonyl-CoA come? Malonyl-CoA comes whenever there is increase of glucagon, and obese people particularly, they have insulin resistance. They have insulin resistance. So insulin resistance may there will be higher site pe glucagon, and that is why this whole insulin resistance will result in high malonyl-CoA. Malonyl-CoA will inhibit the carnitine shuttle, thereby increasing the fatty acids in the liver, which also leads to fatty liver. So, agar ek option was carnitine, mitochondrial carnitine was one of the option. What was the fourth option? Can somebody help me with option D? Mitochondrial carnitine. Carnitine increase nahi hoga. Carnitine, the transporter will not increase, right? There will be increase in tricarboxylate transporter. All right. If the option fourth was tricarboxylate transporter, the tricarboxylate transporter is if it is all these are given, right? And depending upon what was exactly asked, I can give you the concept behind it. So the concept is, in the obese people or people who are consuming high carbohydrate rich diet, there will be carbohydrate which will be converted to acetyl-CoA. See, everything in our body gets converted to acetyl-CoA. acetyl-CoA will be converted in the mitochondria to citrate. More of citrate will be transported by the tricarboxylate transporter inside the cytosol. This citrate will split to give free fatty acid, and there will be splitting to give acetyl-CoA and the oxaloacetate. Oxaloacetate will be somehow converted to pyruvate. The acetyl-CoA will be converted to free fatty acid. So what I mean to say is, so whenever we take high glucose, glucose by a series of reactions becomes acetyl-CoA. Acetyl-CoA combines with oxaloacetate. It comes outside, becomes citrate in the form of citrate, of course. Ab bahar in the cytoplasm, this citrate will split again to form oxaloacetate and acetyl-CoA, and this acetyl-CoA has no other choice but to form palmitic acid. So here there will be formation of palmitic acid. The glucose which is higher, it will form palmitic acid. So depending upon the concept is this, depending upon whatever the question was there can be a multiple correct answers. Then it can be A and B both are correct, B and C both are correct, like that, right? So it can be that type of a question, probably as per your recall, as I can take from the chat box. You're saying this was a multiple type of question. So more than one of them was correct, right? More than one correct answers were there. All right, good, right? So it is good. So there will be, then there was a question on GLUT4, we got that. There was a question on glycine also. Let's revise that also. Let's see. The pH was, I think the pH was shown in the examination. You got the titration curve. Let's discuss this question now. I got that. वो previous question में multiple correct answers होंगे. So that we do not get confused what is the correct answer, we will take again a recall session with actual options. In this we are just discussing the most important topics. Make sure that you revise these topics for the examination, right? अच्छा, एक चीज और, there was no question on phenylalanine, tyrosine, tryptophan, aromatic amino acids. Aromatic amino acids पे कोई question नहीं था. Aromatic amino acids, anything related to phenylketonuria, tyrosinemia, alkaptonuria, कुछ तो आया होगा. अच्छा, this question was very simple. You are excited about glycine wala question. pH of this Zwitter ion, I know you got it right, and that is why you are very excited about this question. pH of the Zwitter ion as shown in the following graph. You have to tell the pH which is at the center. Zwitter ion means the number of charges are same, positive and negative. The titration curve of glycine pK1, pK2 is given. So all you have to do is add this 2.3, 9.6 and it will become 5.95. And all of you are saying it is 6. You got it right, right? So anything else you recollect from the examination? Any other question you have from biochemistry portion? There was no question this year from competitive, non-competitive, as I can take note for. So there was no question on competitive, non-competitive. There was a question related to electron transport chain, although there was a complex 4 related question. They have given this time, there was no question related to this molecular biology, recombinant DNA technology, something related to that. Anything related to the molecular biology was there? Can you recall something related to PCR or the sequencing DNA sequencing, anything related to that if you can recall. कुछ तो होगा, ऐसे कैसे molecular biology तो AIIMS, they love it. कुछ something related to it था, एक था. No vitamins, nothing. There was a question, northern blotting, southern blotting. क्या था भाई? northern blotting, southern blotting, southwestern blotting, क्या आया था? Which technology is used in identification of some disease gene? Too good, too good. So there were two questions now I can see. There was something related to quantitative PCR and there was something related to blotting also. All right, in case you remember this, you can put it in the chat box. Right, I wish you all the best for the NEET examination. We have got some of the very important topics. So let's just quickly write down the last minute revision topics for the NEET examination based on our INICET examination. I would say INICET recall say my most important topics for the NEET examination have come out to be the insulin, glucose transporters. There will be a question on amino acids. There can be a question on amino acid, can be glycine, sulfur containing amino acids can be asked, or the 3 aromatic amino acids can be asked. Then we would say fat metabolism. The lipid metabolism portion is important. Then do revise PCR for the examination point of view. Sphingolipidosis, glycogen storage diseases, and the electron transport chain and oxidative phosphorylation, particularly the inhibitors. With this, I sign off and I wish you all the best for your NEET examination.
Good evening, guys. Hi, hope all of you are doing well. Well, not wasting much time because Sanjeev sir has already conducted the session. So most of the questions are hopefully same only. Yes, pathology is done. Some new questions. I won't take much time on this because pathology is already. Good evening, I hope. Good evening, guys. So chalo, most of the questions are same, but there are few questions which are new to this, so we won't waste much time on this. Quickly we'll go through this. अभिषेक झा, बैंक का रात का हम सफर हूं, इनका भी और तुम्हारा भी. Thank you, Karthik. This is really special, boss. Only new question. I won't take much time. So everybody, granular cell tumors in a much better frame questions, which I thought will replicate the exact ones. All the following associated with granular cell tumors, except Wall-Exner bodies, yes. Inhibin positivity, yes. Sex cord tumor, yes. The answer is D. All except question. The question was all except. Call external bodies was not there. So I hope you remember. We studied inhibit, calling your call external bodies was not there. Himali. Inhibit calling your ex-girlfriend 99 times for coffee. Right? That repeats. Inhibin positive. Call X for call external bodies. If it is multiple question, absolutely. That's what I thought, right? Except was not given. I had like bit of confusion. Some people are saying except was there, except was not there. So I'll take it as this manner. So there was no except, right? So answer becomes A, B and C. Is that the correct answer? A, B and C? Yes, if there was no except, call external bodies. GF is for glandular cell tumor ovary. 99 is it is CD19 positive, and you have coffee bean nuclei. So it was multiple choice question. Great. Chal, without wasting any time, let's move to the next question. A woman presents with, please help me out with this question again. There is bit of controversy over here. Thank you Balu. So woman presents with bilateral multilobulated ovarian cyst containing solid components. Her serum CA125 levels is elevated. Please help me out with this. Was CA125 mentioned in the question? Yes or no? Because if it is not mentioned, the answer will be mucinous cyst adenocarcinoma. And if it is CA125 present, then it will be serous component, serous carcinoma. Please help me out with this. Was CA125 mentioned in this question, particular question? Because omental baking or abdominal baking with multilobulated mass, it goes more towards mucinous cyst adenocarcinoma. Great. So if CA125 present, so I go with serous carcinoma then. I hope all of you was given. Chalo, done. If it was given, I'll go with serous cyst carcinoma. Otherwise, the question would have been mucinous cyst adenocarcinoma. Done. Chalo. Next question. This is simple. Same like sir discussed you. Not used for Indian fungi. I came to know they have mentioned the fungus, that is Aspergillus. So without wasting any time, Aspergillus fungus infection. Yes, GMS. Mason Fontana pass, all of them positive. Congo red is not positive, so it is positive for amyloid. What is normal, Baba? Omental caking and this multiloculated goes more in towards favor of mucinous adenocarcinoma. But if they've written CA125, it goes for serous carcinoma. Right? Then next question. Patient presented with, here also have a bit of controversy, multiple punched out lytic lesions, seems like multiple myeloma, but they ask which thyroid malignancy. I need to know. This is why Vinayak Nigam, this is why I am confused. Serous is unilocular, multilocular, but then there is no CA125 positive. Was multiloculated and CA125 both mentioned? Yes or no? No, it is not normal. Not normal. It is raised. Yes, I hope. Yes, I came to know there was X-ray finding given over here. Great. I just want to know whether follicular and medullary were both in the option. Great. So there was no medullary carcinoma, right? Done. Thank you so much. So Hardal cell carcinoma was given. Thank you so much, bache. Hardal cell. So then answer becomes follicular. We have studied this. The papillary has lymphatic spread. Follicular has hematogenous spread. And because of hematogenous spread, I hope you remember palpable lymph nodes. Palpable lymph nodes goes in favor of papillary. We have studied this P for P. Okay, great. If medullary was not in the answer, same way it has to be follicular carcinoma. But if you see distant metastasis, distant hematogenous metastasis, because again, see, medullary also has tendency to metastasize to bones, right? So distant metastasis through blood is more in the favor of like lungs, liver, bone. This is more goes in favor of follicular carcinoma. Follicular carcinoma. Then please remember for the next year, medullary carcinoma. I hope there is nobody who should wait for second year. I hope all of you get cracked in this attempt only. Medullary also has more tendency to go to bone metastasis. So if there was no medullary, it is straightforward question. It goes in favor of follicular carcinoma. Right? Then any changes, do correct it. Not an aneuploidy. Not aneuploidy. We all know. All three aneuploidy. Bloom syndrome is not aneuploidy. You have studied my back to basics notes. You know this. It belongs to recombinant DNA repair syndrome. Can you quickly tell me DNA repair syndrome? Can you quickly tell me, guys, what are the examples of recombinant DNA repair syndrome? I hope you remember there were three main, and I told you the back to basics mnemonic. The mnemonic is AFP. AFP, come on, guys. For next year, ataxia, telangiectasia, Fanconi anemia, and the third one, the ask in this particular question is Bloom syndrome. Right? AFB, ataxia, telangiectasia. So these are three recombinant DNA repair syndrome. And the gene mutation that I am sure all of you know. It is because of helicase gene mutation. It is because of helicase gene mutation, not because of any aneuploidy. Right? Then next question. Not associated with obesity. Simple question. Pancreatic stomach has to be there. Confusion between meningioma. Yes, meningioma also has very rare chances. But then obese female, can still cause meningioma. Can still cause meningioma. So yes, meningioma in obese female has increased tendency. Multiple myeloma has nothing to do with obesity. It is mainly because of, can you recall and tell me what is the main genetic factor responsible for multiple myeloma? I hope you remember. It has to be hyperdiploidy. The most common genetic abnormality associated with multiple myeloma is occurred because of hyperdiploidy. Right? Done. Next question. Most common inherited bleeding disorders. Simple, straightforward, as it is question. It has to be von Willebrand disease. Von Willebrand disease is the most common inherited bleeding disorders, not hemophilias and not any other disease. Von Willebrand disease, deficiency of von Willebrand factor will go with the most common inherited bleeding disorder. Can you please help me out with this? Can you tell me the drug of choice for von Willebrand disease? Come on, quickly. Drug of choice is desmopressin. You go with desmopressin as a drug of choice. And also, then you have that types also. Cryoprecipitate is also given. Very good, Dev. With von Willebrand disease. Done. Caspase 1, straightforward question. Not wasting time on this. Sir has already discussed. It has to be pyroptosis. Pyroptosis. Right? Necroptosis don't involve caspases. Right? So it will be pyroptosis. Done. Erythropoietin used in treatment of which of the following? Himali, I know. We'll quickly finish it off. I've been asked to revise all the questions, so let me do my job, Baba. Anemia due to chronic kidney disease. Nutrition anemia will not respond to erythropoietin. It will respond to the, for example, IDA will respond to iron. B12 will respond to B12. Myelofibrotic disorder will not. This is fibrosis going on. It will not respond to erythropoietin. Aplastic anemia. There are no stem cells in aplastic anemia. So if there are no stem cells, there is no point giving erythropoietin. It will be B. Then which of the following is a false statement regarding gene cancer? False statement. It has to be go with TP53. Everybody come on. So it was multiple choice question. Which one, Baba? This one, Abhishek Jha? This was a multiple choice question, is it? So ninth question, multiple choice question. Can you recall what are the other options? So it was only one option or there was any confusion? Only CKD was a better answer. You thought there were other options also where erythropoietin could have been given. So A, B was the only correct answer, right? Chalo, done. Then TP53, mucosal neuromas. We know this. Mucosal neuroma occurs as a part of MEN2B. Come on, guys. MEN2B, which gene mutation? RET gene mutation. It has to be RET gene mutation. Great. Then talking about TP53, we know. TP53 gene acquired disorder lead to which syndrome? So nutrition will not be the answer. Nutrition will not be the answer, guys. I've been asked to take again pathology because most of the students are not there with sir. And I've got some new questions also. So leave from any syndrome. Done. HPV serotypes. Was this question there? Cervical carcinoma, HPV. Was this question there? So there is no doubt it has to be 16, 18. 611 cause laryngeal papillomas. Cause warts. It cause warts. Cause squamous papillomas. Chalo, great. If this was there, great. So 16, 18 is the one which is responsible for squamous cell carcinoma. Done, 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 done. 24-year-old man, please tell me, help me out with the history. Was this the history? 24-year-old woman with breast lump, best reveals DCIS with comedonecrosis. Was pathological finding also given? Mother or sister history was given. Genetic test. Okay, so this was not given. So just the history. The death occurs. Okay, image of what? Drishti. Okay, so DCIS was not mentioned. Okay, thank you so much for this. Was image given? Dave, can me please help me out with this? Was image given and which image was given? Image of what, Baba? Acha, mammographic image was given. Is it mammography image? Or they gave an image of comedonecrosis? So what you are telling me is, acha, HPE also and mammography was also given. Okay, okay, okay. So in HPE there was given comedonecrosis. Am I right? HPV image showing DCIS or comedonecrosis, and then there was radiological. Acha, there was no radiology. Some people are telling, sir, histopathological image was given, and sometimes it was not given. So mammographic image was given. Okay, great. So mammography image along with comedonecrosis and then gene. So there has to be BRCA1 gene. We anyways know that BRCA1 gene is, now Aman is telling there was no image given at all. Acha, if she could afford only one of the following, she will go for. Okay, so still there is a confusion. People are telling there is no image given. They just ask a patient could afford only one test. So the answer will be BRCA. No matter what, the answer is BRCA1 gene without any doubt. Most common inherited gene involved in breast cancer is BRCA1 gene. Most common inherited gene is BRCA1 gene. So answer will still remain BRCA1 gene, and TP53, if you remember, is the most common acquired gene associated with breast cancers. Inherited side is BRCA1 gene. If she could afford one, it will be BRCA1. Can you anybody recall and tell me which histopathological image was given? Is it comedonecrosis only? The pink. So okay, got it. So now I can relate. Calcification on mammography. This calcified mass only comes out as comedonecrosis. So that was comedonecrosis. Okay. So for next year we can remember, for comedonecrosis, be prepared for BRCA1 gene. With calcification, be prepared for BRCA1 gene, because both of them will give you DCIS. And in DCIS, cancer is most commonly seen with BRCA1 gene mutation. Thank you so much. Thank you so much for this. This question again, sir, will have discussed. Which of the following HLA mismatch transplant rejection least likely to occur? Least likely to occur. Answer is Bayer lymphocyte syndrome. You study this back to basics. यही था great. Bayer lymphocyte syndrome. Deficiency of MHC molecules. अरे जब MHC molecule ही नहीं है, if there is no MHC molecules, how can HLA recognize it? Himali is still asking. Memo वाला question यही था कि दूसरा था? Himali just needs to confirm. So Dev has confirmed me. Thank you so much, Image. Though there was history, there was 2 images, and there was affordable investigation. So all 3 was there. Great. All 3 were there. So next year they can split and ask a separate question out of this. Thank you so much, Dev. Really appreciate that. So no MSC hai. I'm sure you know this. Bayer lymphocytic syndrome 2 type के होते हैं. Type 1, type 2. Type 1, type 2. Type 1 में MSC deficiency है. Type 2 में MSC 2 deficiency है. So if there is no MSC molecules, there cannot be HLA mismatch reaction can occur. So it has to be Bayer lymphocytic syndrome. Can you tell me other syndrome where there cannot be any HLA mismatch? Then again, SCID. I hope that was not in the question. So SCID was not in the option, right, Dev? It was Bayer lymphocytic syndrome, right? Because again, SCID will not give you HLA mismatch because there are no lymphocytes to react against. I hope SCID was not in the option, because then the history will also become relevant. Great, great, not there. Now again, this is what I need to confirm from you guys. Diabetic nephropathy, yesterday's class we discussed Kimmel-Wilson disease image. Everybody, not the characteristic of glomerular finding. Is this the line? Did they ask you about the glomerular finding and was their image given? Please help me out with this. I won't take much time of you guys. I know it's a long day, already have suffered a lot. Okay, SCID was not there, straightforward. Answer has to be with Bayer lymphocyte syndrome. Was glomerular word used and was there any image given? Because if they've used glomerular finding, then there has to be answer is abscine Armani crystals. No way. These three are the glomerular findings. And guys, Armani abscine cells is a tubular finding. It is a PCT cells. PCT with a lipid laden. I am sure all of you studied this from my notes. हमने पढ़ा था. Abscine Armani cells are lipid laden PCT cells. It is not a glomerular finding, so it is straightforward ruled out. Great, great. Word use, no image. Thank you so much there. So it is lipid laden PCT cell. Yes, it is a seen in diabetic nephropathy. Again, it is not at all specific also. Armani abscine cell is not specific. It is seen in many other conditions such as Fanconi anemia, Fanconi syndrome. And also, because it is not seen in glomerulus, it has to be D only. I hope all of you have gone for yes, I understand. Exam was not easy. I won't say yes, it was doable. I won't say because the options and the art of ruling out was what required here. I will not say the paper was extremely difficult. I will not say it was easy. It was more of a dependent on the art of ruling out the options. Ruling out the options. It demands the need to read the question carefully. It demands to read the question, all of the questions. The glomerular word will change the question. It will be Armani abscine. Please put me, everybody, just a thumbs up, all of you who have went for Armani abscine cells. Because rest all are glomerular finding. This is small mistakes that you need to understand. I hope you get cleared this attempt only. God forbid. Please make sure this is what you. INICET is not difficult. INICET doesn't come from other planet. It is just about reading the question with the mental equilibrium and reading the question with calmness in the mind. Right? Right? Done. Next question. Child presented with petechia, purpura, platelet count of 10,000. Was 10,000 given? Is there anything that else that is not in the question? That any relevant history? B. Bone marrow shows megakaryocytes. Treatment given. Great Divya, great Hashvita, Niharika, thank you so much. Then obviously answer should be clinical history goes with ITP, child with acute ITP. Generally, see, this is what is a controversial here because it's a child usually have acute ATP. Acute is normally a self-resolving disease. It is self-resolving disease. Self-resolving means it has to be wait and watch. So there was no wait and watch, sure, right? There was no wait and watch given, right? So then there is no doubt left. It has to be IV immunoglobulins only. Are you sure it was a child given? Are you sure it was about acute ITP? No wait and watch. Okay. Initial best treatment, but no wait and watch was given. Are you sure about this? Have you read all the 4 options? You're sure, right? There was no wait and watch? Great. If there is no wait and watch and history was of child only given, chalo. Then answer has to be initial treatment has to be IV immunoglobulins only. Because why? Generally acute ITP we don't treat it. It is usually self-resolving disease. Yes, we start with steroids and then we go for IVIGs. But then if you are saying then it has to be IVIGs. Initial therapy given. Okay, initial therapy means it has to be no doubt out of all this question IVIGs is the best answer. Great, get that. Mechanism of cancer cell consuming more glucose. I need to finish it off at earliest because I know all of you are very tired. I don't want to waste your time. You need to have good food. So jo ho gaya tha wo ho gaya. I have not still figured out the best options possible. But Warburg effect hai. Then answer has to be A, GLUT2 receptors. It's because of the cancer cell have increased GLUT2 receptors, they take more glucose inside. There is something that you need to change on because at this question, option A seems to be the better one. Okay, so this is the exact line. Then the answer will be C. Then the answer will be C. For sure. We all know it has Warburg effect means aerobic glycolysis. Okay, option D. So that anyways has nothing to do with oxidative. Warburg phosphorylation has nothing to do with oxidative phosphorylation. So you sure about this line C, right? Lactic acid is preferred. Okay. So this is why it cannot be the answer. Okay, done. Got it. Good, done. This is why the question and oxidative phosphorylation. So then answer A cannot be the possible. The Krebs cycle or oxidative phosphorylation has nothing to do with. So it was just GLUT2 receptor, that was answer. If GLUT2 was with oxidative phosphorylation, it cannot be the answer. Then the most probable answer seems to be lactic acid preferred despite oxygen. Aerobic glycolysis will go with down as the better answers. I again need to confirm this. GLUT and oxidative phosphorylation was same in the same option. Pyruvate. Option D was more pyruvate required to TCA. Thank you so much. Thank you so much, Nunal. More lactate, more pyruvate required for TCA. Thank you so much. Chalo, done. The last question. Again, which of the following is incorrect about free radical injury? Pyruvate converted to acetyl coenzyme A, which enter TCA. Okay, so pyruvate, just a minute guys. Pyruvate is converted to acetyl coenzyme A. I'll take a screenshot of this. Done. Thank you so much. Thank you. Chalo, that brings the last question. Free radical injury. Which of the following is incorrect? Was this the question or it was multiple choice question? Was this a multiple choice question? Yeah, all except came. Incorrect came. Can you help me out with this? Neha, no doubt. Then the answer will be lactose in spite of option D will be the better answer. Lactic acid preferred despite oxygen. So it was all except question. Okay. So then there is no fibrinonecrosis. We all know occurs in blood vascular injury. And free radicals has nothing to do with any diseases involving. If you remember, fibrinonecrosis we studied. No sir, correct was asked. Multiple choice question. So option 1, 2 and 3 was the correct answer. So this was multiple choice question. Is it? ABC correct. Okay. Thank you so much. Guys. Correct was asked. So ABC was the correct answer. Fibrinonecrosis nothing to do with this. This is seen if you remember MRP conditions. We discussed this in class. Malignant hypertension, rheumatic heart disease and polyarthritis nodosa. Nothing gene pool. Suraj, what was the question on gene pool, guys? Suraj is helping us. Gene pool pe bhi ek question tha. Anybody remember that question? MRP do not involve free radical injury. Anybody question on gene pool? Anybody, if you remember gene pool question, do let me know. Gene pool resembles what? Seen in all except. What is gene pool? 3 different question, Baba. I need your help. Gene pool means population individual, term used for. Okay. Gene pool term used for. So population would have been a better answer. Population was there, right? Gene pool options for family, individual, population. Then population is the correct answer. So you're telling me there was question on gene pool? Gene pool is linked with an option is individual, family and population. Is it so? Population, family, individual, tissue. Is it so, guys? Yes, then out of this gene pool definitely will go. I'll go with population for sure. I hope all of you have gone with population. Then, so I can say there was 20 questions on pathology, and thank you so much for this. Thank you for me. I need to come again because I need to frame a right questions to help your juniors, because I'm sure all of you will go through. Only thing I want to tell you is please, now don't think about the questions. जब रात को सोओगे, please don't think about the wrong answers. Most of us, we even don't know the correct language. So just because I am telling ki this is the right answer, that doesn't mean it will be the correct answers. There is still a chance, because there are certain factors which most students could miss it. तो देखो अपने हाथ से जो होना था वो तो हो चुका है, तो अपने इस टाइम पे और all is well करना है. अगर कुछ लग रहा है कि the question that is wrong, if we are conveying that this answer is wrong, don't think it is wrong. There might be something that we would have missed, but you would have picked it down there in the exam. So helping you, wishing you the best of this. Please. खाना है खाओ, पीना है पियो, जो करना है करो, but don't think about the questions while you sleep. जो भी हमारे हाथ में था, we gave our best shot. जो होना था वो होगा. Genital lesion, a week back something like was there. Nitu is telling there was one question with HPE where a genital lesion a week back something like was given. Absolutely shit. Please, Nitu is helping us. If anybody could help me out with this. Genital lesion a week back something like was there. What was the exact question? Nitu is telling a histopathological image was given. Histopathological image was given on genital lesions. Is it so? Can you recall, guys? Genital lesion histopathological image. Can you please help me out with this? I really would appreciate that. Drug of choice, DOC for HP genital lesion. Okay, done. Diploco image. Okay, done. Chalo, done. That is all from my side. Thank you very much, guys. Please. कोई टेंशन नहीं, कोई स्ट्रेस नहीं. You did your best shot. Trust on God. If you deserve it, you will definitely get it. कुछ मत सोचना. Thank you very much, guys. God bless you. Bye, guys.
एक बात बताओ भाई, देखो
Okay guys, good evening all of you. Welcome to this INICET PSM recall. Me and Dr. Kashish sir both together are going to present on behalf of both of us. I'm going to speak, but we have discussed, and on Monday we will have a full discussion on the questions. Yes guys, so this is just the version 1, okay, of the recall, because these are just recall. So if there are any changes, do let me know about that. These are the changes sir or Kashish sir, we are okay with either of the case. Yes guys, now if you look into the question distribution, the question distribution this time was classical INICET discussion, where in statistics we had 4 questions, health programs 3, epidemiology 2. So classically, if you have attended my class, I do actually say that statistics gives you the maximum chunk, sometimes epi. So this was a classical paper of INICET. Health programs were 3, again they were the good ones. Now there was one bouncer question which probably you could have done if you would have just excluded one. Vector, a classical question hamesha aayega. Vaccines, again hamesha aayega. Yes guys, one overlap question was on blindness, which Saurabh Sharma sir would have covered it up in his discussion. Okay, so I am not taking it up at all. Okay. Now statistics, पहला type of test, statistical test तो आना ही आना है. ठीक है. In a group of patients who are hypertensive, you have given the drug, and after taking the drug you are measuring the blood pressure. This was one version. Some students had given this version कि diabetic patients है, उनका लिया, उनको advice दिया, and again concept same है. So number of groups were 2, before and after. They were paired. Output variable, blood pressure. So it is quanti. Algorithm 2. Answer was paired t-test. I hope I am clear with this. There is no doubt with this particular question. Now, second question. Now this is a classical question on sampling where they said that okay, in a hospital the patients are divided into 3 groups: mild, moderate, severe. Now see, they are doing a meaningful division because the keyword was disease severity. So answer to this question was stratified random sampling. There are some students who said, sir, why not cluster? Because meaningful division hai na, disease severity hai. On that basis the classification is done. Yes, again direct question from the notes where we discuss the difference between a cluster and a stratified random. In a stratified random it is meaningful, yes, and in case of your non-meaningful it is cluster. Yes guys. Now someone is asking 3 groups, why stratified? Arey yaar, stratification can be done in 10 groups, there is no problem in this. Yes guys, I hope it is clear with this. Now if there is not mention of random but still these 4 options are given, still stratified. Unless and until in an option they would have given quota, then it would have been important to say stratified or not. I hope I am clear with this. Yes, done. Guys, any changes in the question which you remember, do ping me. I will make a change because I had circulated the version 1 in the Telegram group also, and whatever changes I have got, I have taken it accordingly. So I am sorry if there are some errors. So we will discuss again it in detail. We are just trying to actually recall. Okay, so I hope I am clear with it. Okay, okay, stratified was not in the option. Is correct by ruling out. Some are saying it was there, some are saying not there. Jo bhi ho, please feel free to reach out. Done hai? Okay. Question number 3. Wrongly matched pair related to statistics. Correlation, relationship. 1000 baar we have told. Relationship seen by correlation and regression. Skewness, moments. We don't know what is moments. Yes, moment tha bhai, moment. Yes, not that. See guys, actually in maths, skewness का दूसरा नाम is moments. चलो, you don't know, no problem. Option 3, mean, median, mode, measure of central tendency. Yes guys, so dispersion तो हो ही नहीं सकता है. Dispersion is about range, standard deviation, standard error. So answer to this question was 3. Again, slightly modified from the notes, but still I'll say it's a direct question. Okay? Question 4. In statistics, what do the centiles and quartiles primarily represent? Measure of central tendency, not at all. Mean, median, mode, measure of central tendency होता है. Measure of dispersion, range, standard deviation, standard error वो भी नहीं हो सकता है. Measure of correlation, regression and your correlation वो भी नहीं. तो बचा एक. Some students say कि measure of position था. Some students say that measure of location was था. ठीक है? So basically कुछ भी हो, answer will again be 3. I hope I am clear with this. Guys, the classification, if you remember when I teach in the class or even Kashish sir teaches, we say focus on the classification, measure of central tendency, measure of dispersion or deviation of data. Chara question direct from the notes. Yes guys, done? Now, epi 2 questions. 1. Total population was 100, previously infected with measles were 10, total new cases of measles were 20, calculate the incidence. Now guys, if you have attended my class, I very categorically say that in case of incidence and prevalence, it is not the numerator only, it is also the denominator. Yes guys, the denominator is also different. So in incidence, the denominator is population at risk. In prevalence, it is total cases. Yes guys, okay? Now, or total population. So here 20 are new cases divided by 100, answer was 20%. Majority did it wrong, because you need to take it as population at risk. Because we are taking population at risk, it would have been 100 minus 10, which is 90. So 20 by 90, answer would have been 22.22%. I hope I am clear with this. No doubt guys. Yes? Okay. Question 6. Organize the following steps in correct sequence for conducting a research. Now again guys, if you have a basic understanding of how PSM works, this question you could have answered. See, whenever we do a thesis, a research, We will first set a research question. पहले question रखेंगे. Yes, who is better, Ranbir Kapoor or Ranbir Singh? Then we will set up the research objective, where we will see what parameters we are going to take. Then we take the population. After you take the population, you will do the data collection and then you will do the analysis. So 3, 4, 2, 1. Answer to this question was 3. Yes guys, again, if you have attended a full class, you would be able to actually do it. Okay? Now I can say some of you are saying कि थोड़ा थोड़ा अलग है. Please do not worry, you can just drop a message. Yes, I will make those changes and we will come out with a full discussion. Okay? So 4 questions from stats, 2 questions from AP, 6 question boss. Absolutely trust me, these are things which we are going to make a question. Okay? Done? Now, demography and family planning. Classical question about SDR calculation. Okay? Now, in SDR, classically, we always teach you that it is less than 15 plus more than 65 divided by 15 to 65. Okay? But if you remember, whenever I teach in the class, I do say that this is a US indicator. In India, elderly is 60. Yes, so this formula would be changed. So for Indian context, the formula was less than 15 plus more than 60 divided by 15 to 60. Okay? Even if you hear the back to basic recordings, Ultimate Live, I say this always, and that's what my seniors of AIMS put it up. So less than 15, 6000, more than 60, 2000 divided by 12000. So it was 8000 by 12000. Answer will come out as 2 by 3.66. Even if you did not know this, there was nothing to panic. You cannot ask the question, the computer, अरे 65 क्यों लिखा है, 60 क्यों नहीं लिखा है? Yes guys, I hope I am clear with this. Okay, Drashti is saying data analysis was not there, study setting was there. Okay, I'll make that change, no problem. See, you have to select the population. Yes, so population comes from a study setting. So again, it depends upon the option. Don't worry, I will change those. You just drop me a message later, no problem. Yes guys? Okay. Now, vaccines, always a question, simple. SCID patient, you know, SCID patient is immunocompromised. Yes, in immunocompromised, all live attenuated vaccine contraindicated. This was an indirect way to ask what is a live attenuated vaccine. MMR, IPV killed. Recombinant vaccine, hepatitis B. D and T are your toxoids. P was killed. So answer to this question was MMR. Okay? Now, health programs. First, RMNCHA plus N. What is not included? Arey bhai, there are again 2 versions. Some students said, sir, they had asked included and they said it is multiple answer. ठीक है, अगर not included geriatric है, then included will be adolescent, family planning, infant population, because what is the full form? Reproductive, maternal, neonatal, child health, adolescent, nutrition. Either way, answer is same. ठीक है? So I hope no problem with this आसान सा question. Yes guys? Okay. Question number 10, MMU. During the Mahakumbh Mela, now this question indicates that the questions of INICET are always built up, yes, at a very near time of your exam, because Kumbh has happened just recently. ठीक है, मल्टी है तब भी कोई प्रॉब्लम नहीं है, जेरियाटिक हटा के बाकी मल्टी कर देना. ठीक है, चलो ऑप्शन मदर, पुट दैट ऑल्सो, मदर इज ऑल्सो अ पार्ट ऑफ RMNCHA. ठीक है, नो प्रॉब्लम, आइदर वे जेरियाटिक नहीं है, बाकी जो है दैट वाज द आंसर. ठीक है बॉस, नो प्रॉब्लम. ओके, MMU, putting up surveillance unit. Why are we trying to do it? We are trying to reduce the need of medical profession. अरे बिल्कुल भी नहीं. For early diagnosis and detection of disease, yes. For immediate quarantine of individuals, no. To provide curative treatment, only no. They will provide preventive therapy also. So answer to this question was 2. So that we can pick up the disease outbreaks early. This is a very common phenomenon. You go for any congregation, the establishment of doctor unit is always there. Okay? According to recent NACO guidelines, अरे कुछ भी recent नहीं है, guys, this is for some 20 years. Which are the following groups no longer classified as high risk group? Now, interestingly, I teach this. It is exactly from your workbook. I put a screenshot also. High risk group only for commercial sex worker, men having sex with men, your transgenders, intravenous drug users, okay? Bridge population, truck drivers, and single migrant men. So answer to this question was truck drivers. Direct question, even we have discussed in the workbook. Okay? Vector. Yeah, always one question in environment is from vector. Yes, you could have easily solved it. I got a recall with this. Yes guys, done. चलो phase 5 कोई फर्क नहीं पड़ेगा यार, दृष्टि phase 5 में भी वही रहेगा, ठीक है, कोई प्रॉब्लम नहीं होना चाहिए. Yes, okay. This I'm not even telling you the answer because you know it. कौन सा क्या करता है? Match the column. You can match it. I'm not even telling you the answer because I expect you would have matched the column. ठीक है? Done. Over. Okay. Now, which of the following acts is primarily concerned with medical data protection? Now guys, Achin sir always say that if nothing is of a subject, then it is of PSM. Technically this is not PSM, but exclusion se banta. If you know MTP, it is abortion. If you know PCP and PNDT, it is about sex selection. Bacha do DPPP HIPAA. Yes, DPPP stands for Digital Personal Data Protection Act. It is a general knowledge question. It had come actually in the year 2023 when these Facebook people and Instagram people were misusing everything. So government of India had brought the Digital Personal Data Protection Act. चलो GPDR कर लो विभोर, कोई प्रॉब्लम नहीं है. अगर आप GPDR भी कर लोगे तब भी बॉस पता कहाँ था GPDR क्या है. So only one question was A. So guys, even if someone would have made a blind guess, ठीक है, you should have been able to actually change or get it. ठीक है, that is all. One question, if you ask me, out of the 13 was a bouncer. So guys, I expect that you would have got at least 12 out of 13 correct. Trust me guys, anyone who has got 12 out of 13 correct in the INICET, at least in the PSM segment, you are in the top 500. Baki, other subjects will drive your rank. This, my dear students, is all up from my side and Kashish sir's side. Guys, the way ahead for your NEET exam, both me and Kashish sir would be taking up your quizzes for NEET PG on the Telegram channels. Please do not hesitate to give those quizzes. That's the best way to revise. Any other query, do not hesitate to reach out to either of us. We are the PSM duo from DAMS. Love you all guys. All the best. Bye bye. See you. Take care. Yes. Bye bye.
Very good evening, all the students. Can you update in the chat box? Is audio, video, everything fine? Can we start? Yes, every student, kindly update. Is audio, video fine? Yes. Yes, thanks for update all the doctors, Dr. Shweta, Dr. Swati, thanks a lot, beta. Let's start. So, beta, first of all, I will give you a brief orientation of this ENT segment in INICET examination. Beta, it was very moderate paper. As for ENT, 5 to 6 MCQs were there. All the questions from the workbook, I will be giving you the page number. I will be sharing the screenshot. Everyone, very good evening. Yes, how was the paper, beta? Class notes की importance समझ में आई बेटा? So, question number 1. I have just compiled all the choices, all the important concepts which they have asked you in the today's session. I will be coming with a detailed explanation analysis of each and every question, but now just fast recap, okay, which are the important points they have asked you. Question number 1, they have asked you something on the match the following question. Please kindly help me, kindly in the chat box you can add match the following. From page number 173, if I take you to my page number 173 workbook, we have learned, आपको याद है बेटा क्लास में हमने याद किया था, supraglottic area have inspiratory dyspnea, glottic area have biphasic, and how to differentiate biphasic dyspnea of glottic from subglottic. याद आया बेटा क्लास में याद किया था? Hoarseness, change in voice. Clear? So this point we have discussed in a nice way in the classroom. Supraglottic have inspiratory dyspnea, glottic have biphasic dyspnea with hoarseness, and subglottic have only biphasic. So lower respiratory tract have expiratory dyspnea. From this concept, and if you remember better, I made you write this concept 2 or 3 times. Okay, this was a important PYQ. So what they have asked you, match the following MCQ. So very simple, inspiratory dyspnea is your multiple choice. It was supraglottic. They will ask you laryngomalacia is the 4th option. But I have just collect the recall choices. The question concept was inspiratory dyspnea. There was an option of laryngomalacia. Laryngomalacia, that is your supraglottic area. It will be having which type of dyspnea? Inspiratory dyspnea. Then the one question was stipple sign. Multiple correct answers. Stipple sign, agreed beta. One stipple sign, lower respiratory tract infection. Beta, this concept was there. I am not asking that this MCQ direct one-liner was there. It was the MCQ based on this concept. Do you agree with me? Patient is having stridor, laryngomalacia, supraglottic stridor. Supraglottic, which stridor? Inspiratory dyspnea. Glottic area, subglottic biphasic. Group, lower respiratory tract, was having expiratory dyspnea. This was one MCQ which they ask you on multiple options. There were multiple options which are the true option. So just remember to crack this question, inspiratory dyspnea, supraglottic. Which is a good example of supraglottic we have learned in the classroom? Laryngomalacia, epiglottis cyst, epiglottitis. So out of these words, if anything is there, it is inspiratory dyspnea. Done. Inspiratory dyspnea. If it is croup, it is lower respiratory tract. Stipple sign, that is your croup. Stridor is seen in how many conditions? Okay, that MCQ will be if the examiner asks you which type of stridor is seen in. So it will be your lower respiratory tract. Lower respiratory tract. That will be your group. Will be having stipple sign and will be having dyspnea. Okay, done. I got your point. They have asked you directly stridor is seen in. That was the MCQ. One MCQ was which of the following is a correct indication of cochlear implant? If you remember in the classroom we have learned. In the classroom what we have discussed. If you remember conductive deafness we use hearing aid. In sensory deafness, we use cochlear implant. In neural deafness, we use brainstem implant. If you remember this point. So, cochlear implant is indicated in which patient? Is indicated in your sensory deafness. If it is indicated in sensory deafness, now you have to choose bit out of these 4 options. Where is your sensory deafness? Otosclerosis? Not at all. What we have learned, otosclerosis, we are having conductive deafness. So beta ye option rule out ho gaya. So option 1 is ruled. So this is gone. Ossicular fixation again is a good example of conductive deafness. So right answer, this will be again going for hearing aid. Option 1, option 2, they are going in the favor of conductive deafness, that I will be giving hearing aid. Ototoxicity, outer hair cell damage, it is a good example of sensory deafness. And if you remember, we have repeated this statement multiple times. Congenital hearing loss, they are congenital hearing loss, they are sensory neural Mondini dysplasia, Michel aplasia, all these things. So we will be going for cochlear implant. This question was right, beta. These options can, and all these students, beta, do you want to add something in this MCQ? Any choice? One choice was ossicular fixation, one was otosclerosis, one choice was ototoxicity, congenital hearing loss. Any change in the option? Yes, any change in the question? Answer will be option 3 and 4. One option, Meniere's disease. Meniere was there, beta. Meniere's. As far I have recollected all these options from my students, they were saying that these 4 options were there. Otosclerosis, ossicular fixation. Perfect. Thanks for all the compliments. These were the 4 choices. Question number 3, beta. 50-year-old female. I tried my best to take the keyword from all the students. 50-year-old male. History was given. Vertigo for few minutes. History of some vomiting in the morning. ऐसी कोई history थी. There was no history of hearing loss. तो बेटा क्लास में कई बार मैंने आपको रिपीट किया था. No hearing loss. If examiner mention no hearing loss, no CNS symptoms, no hearing loss, that is going in the favor of vertigo for few minutes. हमने क्या बात की थी? Vertigo for few minutes in the specific position, we call it as BPV, direct one-liner, in which your posterior semicircular canal is involved. The 4 options were vestibular schwannoma. Now beta, this cannot be there. Malignancy. क्या बात की थी हमने याद किया? In acoustic neuromas, beta. What concept we have learned? In acoustic neuroma, we have discussed the concept that they will be giving you ice cone appearance. Neither they have given some ice cone appearance, nor they have given you some histopath finding, nor they have mentioned rollover phenomena, nor they have mentioned any tumor. So this option rule out. Vestibular neuritis, no hearing loss, agreed. This was the important concept we have discussed in a classroom. There is no hearing loss in BPV and vestibular neuritis. But here there is a history of upper respiratory tract infection. एक बच्चा है, history of URTI with some pain, some symptom in the ear. ऐसे history होगी तो vestibular neuritis. But here is a typical history of BPV. So what is the right answer of this MCQ? That is your benign paroxysmal position vertigo. Diagnosis. Often repeated MCQ, better recall. This is simple recall. We'll be discussing all the points again on Monday or Tuesday. I will be coming with detailed analysis of each and every MCQ. I have taken the note. The first question was on the basis of stridor is seen in which condition? Question number, endolymphatic hydro. One option was Meniere's. So Meniere's was in this MCQ. Meniere's was not in this question. Meniere's, this question is not going in the favor of Meniere's, beta, because examiner have not mentioned the fullness of ear. Examiner have not mentioned hearing loss here. So because hearing loss is not there, we will not go with the Meniere's disease. Answer will not be endolymphatic hydrops. Clear? BPV. One question number 4. याद है बेटा? Just thumbs up in the chat box. मैंने आपको when we discuss this topic in detail, angiofibroma in middle ear anatomy on page number 50, मैंने आपको कहा था ना बेटा, आप वो points लिख रहे हो जो PYQs हैं, और यहाँ पे हमने एक point लिखा था, if you remember, no biopsy. हम angiofibroma में क्या नहीं करते बेटा? 10 बार पूछा हुआ उन्होंने क्वेश्चन. So this is one of the easiest question. No biopsy, no debulking done in angiofibroma. So this answer is going in the favor of angiofibroma. The 4 times angiofibroma going, we are not doing biopsy. Now examiner confuse you by writing general anesthesia, local anesthesia. Forget beta. Biopsy is contraindicated. Epistaxis is there. True. Nasal obstruction, one of the prime symptom. Recurrent bleeding, absolutely is the key word. No biopsy is done. Say angiofibroma. Even when the last week when I conducted the INICET important topic session, I have highlighted this point कि बेटा angiofibroma तो tips पे होना चाहिए. One more MCQ was there on the basis of pain in the neck. They have given a typical history. Pain in the neck, otalgia, ear pain, referred otalgia याद है? We have made a nice table of referred otalgia with fishbone in pyriform fossa, which nerve is involved. बेटा ये line diagram याद आई आपको? In the classroom we had made this line diagram. Page number 200 this line diagram, larynx covered by hypopharynx, याद है यहाँ पे मैंने आपको लिखा था internal branch of superior laryngeal nerve, यहाँ पे मैंने आपको PYQ में डिस्कस किया था, it is your fishbone history, 50-year-old female with history of fishbone, loss of sensation in the upper part of larynx where the fishbone stuck in pyriform fossa. So they have given now indirect MCQ, which nerve is responsible? Internal branch. याद है बेटा हमने क्वेश्चन किया था वर्कबुक में, 2 MCQs for pyriform fossa, 2 MCQs on post-cricoid space. So answer will be here, internal branch of superior laryngeal nerve. This was the right answer. Clear? So these were the 5 hardcore MCQs from ENT which I have collected till now. Beta, इसके बाद भी जो questions आते हैं, I will be coming with a detailed analysis of all the those students who couldn't perform well in the INICET. Beta, no worries. Now just work hard on the upcoming INICET examination. This one exam can't change. Honestly, बता रहा हूँ बेटा, don't waste your time in deep analysis. From tomorrow morning, just let's start preparing for the upcoming NEET examination. Am understandable? Any query you can ask me in the Telegram group. Thanks a lot. One MCQ on basalt abscess. Beta, option was basalt abscess. I have discussed this. I was in lecture. I have discussed this question with 2 students who went for INICET today morning. So what they were saying, basalt abscess was in the option. But that was a typical history of locked jaw and all those things where we are not getting, in basalt abscess we will not be getting the symptom. But in that MCQ they have mentioned the patient with ear discharge and then having some locked jaw and all the trismus, all those symptoms. So I'm not confident of all the remaining options, beta. But in basalt abscess we are not having this type of presentation. Clear? Any other query? Kindly, beta, please inbox. If any other query, any recall MCQ which you feel there was there in the examination, just forward me in the Telegram group. I will be discussing. Hypoglossal nerve MCQ already discussed in the anatomy section here. Anatomy section. Clear? Child difficult to open mouth, that is locked jaw with trismus. That MCQ was there. I feel that was. I am not confident of the remaining choices. Let me discuss that question. Then I will be coming. Clear? Thanks a lot. So these were the 5 hardcore ENT MCQs. Best wishes, best of luck for your upcoming NEET examination.